This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme.
Members, I wish to inform you that I have received a letter of resignation from Mr Fran McCann as a member of the Assembly for the West Belfast constituency. I have notified the Chief Electoral Officer in accordance with Section 35 of the NI Act 1998. I have been informed by the Chief Electoral Officer that Aislinn Riley has been returned as a member of the Assembly for the West Belfast constituency to fill the vacancy resulting from the resignation of Mr McCann. This morning, Ms Riley signed the undertaking and rule of membership and entered her designation in my presence and that of the clerk to the Assembly. She has now taken her seat and I welcome her to the Assembly and wish her every success. Before we move on to the matter of the day, next matter of the day, members will wish to note that this matter is technically still active for the purposes of the Contempt of Court Act 1981, that this continuance of the case should be a formality and therefore risk of sub judice issues arising is low. Nevertheless, I do urge members to exercise their usual caution and moderation in this regard. Mr Doug Beattie has been given leave to make a statement on the death of Dennis Hutchings, which fulfils the criteria set out in Standing Order 24. If other members wish to be called, they should do so by rising in their places and continuing to do so. All members called will have up to 3 minutes to speak on the subject, and I would remind members that interventions are not permitted, and I will not take any points of order on this or any other matter until the item of business has been finished. And I call Mr Beattie. Doug Beattie.
Thank you, Mr Speaker, and I hope this matter of the day can can be held in a manner that befits the issue at hand. And first thing I need to do is pass on my condolences to the family of Dennis Hutchins, his colleagues and his friends. And I will also pass on my continual condolences to the family of John Pat Cunningham, who deserves truth and he deserves justice. But now so does Dennis Hutchins deserve truth and deserves justice. People need to understand or find out why his case was elevated above all other cases, why his case suddenly ended up at the top of the pile along with others. And this goes to the heart of some of the issues that we are having to deal with in what is a difficult legacy process which is affecting our present here now. I engaged on the issue around Dennis Hutchins as far back as 2016 when I was the Justice spokesperson for the party, and I wrote to the then Director of Public Prosecutions to find out why so many military personnel were being subject to investigations. And I'm not talking about the wider investigations, because we can talk about those statistics all we want. But what I found was that under Section 35(5) of the Justice Northern Ireland Act 2002, there were 9 legacy cases referred by the Director of Public Prosecution at the time. And all nine of those cases were either solely about the security forces or in part about the security forces. Not a single one of the 9 was in regards to terrorism or terrorist actions. So what we actually found was that Dennis Hutchins' case was elevated above all others by the Director of Public Prosecutions, not through a PSNI case file. And that is something we do have to look into. It is something that we need to examine, to be fair to the family, to understand why this was elevated. We need to understand what was the new evidence which elevated this case above all else. And we do need to find out what was in the public interest to bring this case forward. And we need to make sure that we stop this perpetual lie that Dennis Hutchins was up for murder, because he was not, and there was no evidence to suggest that, and that wasn't even being brought forward in the court case. But what we did do is we took a guy in his 80s with kidney failure, with heart disease, and we brought him to court. And some will say, well, that's in the public interest. And some will say, well, in hindsight, maybe we shouldn't have done that. Well, it's not hindsight, because the case was made. The case was made that this would have a detrimental effect on his health, and as we saw, it did. Thank you, Mr. Speaker.
Thank you, and I call Paul Fruit.
Speaker, and it is regrettable that we come here today having to have this matter of the day for the sad passing of Dennis Hutchins. I only met Dennis briefly. I uttered a few words to him, that was it. But what Dennis reminded me of is people who I've surrounded myself with all my life. Strong, hard-working, diligent, compassionate soldier. A soldier who served his country and who would have no doubt been let down many times in the act of that service by his superiors and his officers. And that's certainly true of the start of the Troubles. But here was a man doing his duty, serving where he was sent. He didn't have a choice in that. And yet, years later, this soldier, this brave soldier, as an old man, was dragged to Belfast to go through what can only be described as a show trial. Mr. Hutchins has been investigated before, and there was no clear, compelling new evidence that I can see that justifies this man being dragged to Belfast, away from his family, to stand in a courtroom. How unfair. How unfair that a brave soldier who served his country, who went where he was sent, who was let down many times, I'm sure, in the service of his country, was let down again by the judicial system, and I've no doubt by the leaders of the state. And my thoughts go, Mr. Speaker, to his family at this time, but also to people who supported him. I think of the likes of MP Johnny Mercer and our own councillors in Mid and East Antrim and Causeway Coast and Glen, who travelled up to meet with Dennis and support Dennis in the trial. But of course, our thoughts must rest with the family, the people who are left behind, people who are left to pick up the pieces of what is, I believe, a tragedy, an instance that should never have taken place. And we have seen throughout the years where the judicial system has let people go because of ill health. I think of many Republicans who walk free, but yet no service was given to Dennis Hutchins.
Members, time's up. Thank you. And I call Linda Dillon.
Can I firstly say this is a human tragedy, and my thoughts are with all of the families who are suffering at this time, including the family of Dennis Hutchins. But let's be clear, this House, our job is to make legislation. Our job is not to do the job of the PPS. Our job is not to do the job of the police. Our job is not to do the job of the judiciary. And this was a judicial process. It is not for us to interfere in that. And I have had many cases where families have come to me where they didn't think they had maybe been served in the best manner by the judicial process. And I have had to say to them, I can never, ever, ever interfere in the judicial process. It must at all times be independent. I truly and genuinely believe that, and I don't understand why everybody else in this House would not feel the same way. In fact, I find it unbelievable that we would not all be saying the very same thing to anybody that would come to us on any matter that is up in the courts. But I do think it's worth saying that had these issues, and I speak in the wider context of legacy, been properly and thoroughly investigated 30 and 40 and 50 years ago, not us, but these families would not be in the circumstances that they're in today. They would not be continuing to be dragged through the courts, because a family was dragged through the courts as well. A family who lost somebody they loved. And many, many other families like them. And I think we need to be conscious of that. And Mr. Beattie talked to the fact that, we should be careful in our tone in this debate, and I think we should. And I think everybody should be conscious of that, and be conscious of the fact that there are many, many people out there listening to us, and we will set the tone for what happens outside this House. I've said it before here, and I'm going to say it again. Be very conscious of the tone that you set. I think all of these matters need to be dealt with through the judicial process in the absence of what we had. We had Stormont House Agreement, which was agreed by the two governments and by the parties here. We had a process which hopefully may not have delivered justice for all, and we know it probably wouldn't have delivered full justice for many, but it had the best possibility to deliver something for everyone. And I think that we need to seriously engage, and I know that my party leader has written to both governments in that vein. We're supposed to have a real thorough engagement around legacy. I haven't seen or heard anything about it, and I'm one of our party spokespersons on legacy matters. I haven't seen any notes of meetings. I haven't heard what's come out of those meetings, and all I've actually heard is this perpetual nonsense around let's have an amnesty, and that is unfair. It is unfair to everybody involved. It has been rejected by all of the parties in this House. It has been rejected by the victim sector, and they are, after all, the most important people.
Thank you. And I call Dolores Kelly.
Thank you, Mr. Speaker. I'm very conscious of the caution that you've given to Assembly members in participating in this matter of the day, and indeed I'm mindful of the families, both of John Pat Cunningham, a young man who was shot in the back, and the family of Dennis Hutchings is never easy to lose anyone, regardless of what age they are. But I dispute the fact that that was not in the public interest. And indeed, I'm not aware of the level of evidence, but it clearly met the very high threshold set for prosecution by the PPS, and that's why it went to trial. And I think all members here have expressed the view that no one should be above the law, that the law should be applied equally. And that is a maxim I think we can all have faith in and belief in. I noted in recent weeks, the age being no barrier to prosecution, because I saw where a person who was 100 years old is currently before trial, I think in Germany, for war crimes. Quite rightly so, some might say, because even though the generations who suffered at that time may well be long gone, but their families remain, and the hurt and the question for answers still remains. And it is the case for many people here who have yet to get truth, justice and acknowledgement and accountability. And one of the ways in which, of course, is where there's justice available, justice should be sought, regardless of who the alleged perpetrator is. And the argument about army personnel has been long dispelled, given that we know that HET didn't do proper investigations. There certainly was no investigation by military police at the time of the killing. So, no one should be applied above the law, and people should actually be very strident in upholding that principle, not just in word and in deed, and not cherry pick depending on who the alleged perpetrator is.
Thank you. And I call Paula Bradshaw.
Thank you, Mr. Speaker, and thank you to Mr. Beattie for bringing this matter of the day here today. I think it's important that we have this debate. Mr. Speaker, I am one of only a handful of members of this House who come from what we colloquially call a mixed marriage. My mother's from West Belfast, my father's from North Belfast. And I can tell you that at time of birth, the joy is the same. At a marriage, the happiness is the same. At a milestone birthday, the crack is the same. And at a time of death, the grief and despair is the same. I have no doubt today that Mr. Hutchins' family will have been plunged into the same grief and despair. Furthermore, the family also connected with his story, that of Mr. Cunningham, will relive that time and be re-traumatised by it. I do not know what happened in 1974. I was only 2 years old, and as I look around the chamber today, I see many people of a similar age to me. I am very concerned, Mr. Speaker, that there are those in this House and beyond, especially on social media, who are playing politics with Mr. Hutchings' passing. It is essential to note that decisions on prosecution and fitness to stand trial are matters for the independent PPS and judiciary. They are not matters in which politicians should be involving themselves. Not 24 hours ago in this House, we talked about the vitriolic language used online that can create dangerous situations that spill into real life. And so I call on those who took to Twitter last night and other social media platforms and today who are using Mr. Hutchings' passing to gloat and stoke up tensions, to reflect on the potential outworkings of their language, tone and content. We all have a duty to create a society where we do not see a return to the Troubles, one where we can come together to improve public services for our constituents and focus on the matters that matter to them. One issue in which we should continue to treat is this deadly, serious virus together, and we must ensure to take responsibility for protecting those most vulnerable in our society. I said yesterday of Sir David Amos MP, may he rest in peace. In turn today, I say, may Mr. Hutchings rest in peace, and indeed Mr. Cunningham, may he rest in peace. Let us never again recreate such a grotesque conflict. Thank you.
Thank you. I call Tim Allister.
Thank you. Last night we heard of the sad end to the torrid pursuit of an old soldier. The veteran Dennis Hutchings was needlessly dragged to court from his home and his family in Cornwall in what had all the appearances of a witch hunt of a former soldier. when I stood with him last Monday outside the Crown Court, it was evident to me that he was a far from well man. This was a man who every other day had to have kidney dialysis, who had heart trouble, and yet there he was, strong in his presentation, but labouring under the obvious strain and cruelty of being put in the position he was put. I say to this House, our Director of Public Prosecutions, Mr. Heron, should be considering his position. His office argued Mr. Hutchins was fit to stand trial. His office determined to bring the charge before him. His office proclaimed there was new and fresh evidence. Where was it? I followed this case as best I could. I have to say to this House, I heard no new and compelling evidence that gave me any thought at any time during this trial that there was ever likely to be a conviction. So I do say to Mr. Heron, our Director of Public Prosecutions, why did you do this to this man? What was the justification and the basis for dragging him before the courts? Mr. Hutchins entered this trial under the presumption of innocence, and in the same vein, he died an innocent man.
I call Jonathan Buckley.
Thank you, Mr. Speaker. The sad news last night on the death of the late Corporal Major Dennis Hutchins will leave an impact on many in Northern Ireland. First and foremost, to his family, can I pass on my deepest sympathies on the sad and tragic passing, to his friends, but also to our veteran community who have really been touched by what they have seen over this past months when Dennis showed his true and lasting qualities of a solid old soldier, to clear his name, an honourable man that came to Belfast to stand trial and clear the name, not only for him, but for his regiment. And as has been said in this House by many members, whilst I recognise that there is an understandable desire from the Cunningham family for justice, but I do have to ask, was this justice best served? Because to place an elderly man, a former veteran, a soldier, a man that had served his country with distinction, who had run into the face of danger to protect people, was brought before a court unfit from a health perspective, on kidney dialysis, heart troubles, as has been mentioned. It is quite clear that Dennis Hutchins should not have been in Belfast before the court. Rather, he should have been with his family at his home. And you know something, I think that in the days to come, there is undoubtedly questions that arise now for the PPS. How did they come to this decision? Where was the new information? Did they assess Mr. Hutchins' health? Did they understand the serious pressure that it placed not only on him personally, but indeed his family? I salute that former soldier. And I say to the veteran community today, I understand your hurting. I understand your pain. This can never be allowed to happen again. He has been let down by the very state that he undertook to protect its people. Thank you, Mr. Speaker.
Thank you. And I call Stuart Dixon.
Thank you, Mr. Speaker. Mr. Speaker, this morning there are two grieving families to hold in our thoughts. Two families connected by tragic circumstance. The first, whose grief has been their constant companion for decades. The second, whose bereavement journey has just begun. In respect for those families who will both be grieving and in distress today, in memory of John Pat Cunningham and Dennis Hutchings, let today not be a time for recriminations and political point scoring. Let today be a day for compassion and sensitivity. People will struggle today with a terrible sense of loss, a feeling which we all have the misfortune to know, and one which we can empathise with. Events, Mr. Speaker, remind us of the long shadow that legacy casts over our community and of the ongoing pain and anguish that it causes. In the days and weeks ahead, it should be our responsibility as politicians to again highlight and pursue the need for a comprehensive way forward on legacy issues. But for today is a day to show compassion and empathy for two bereaved families.
Thank you, members. And that concludes this matter of the day. Members, please take your ease for a moment to move on to the next item. Okay, members, Mr Colin McGrath has been given leave to make a statement on waiting times for children's red flag cancer referrals, which fulfils the criteria set out in Standing Order 24. If other members wish to be called, they should do so by rising in their places and continuing to do so. All members called will have up to 3 minutes to speak on the subject. I would remind members that interventions are not taken, and I will not take any points of order on this or any other matter until the item of business has been finished. And I call Mr Colin McGrath.
Thank you very much, Mr Speaker, and I thank you for accepting this matter today to allow me to raise what is a very, very important issue. We are regularly told that our children are our future, that our children are precious, and that our children are to be protected. But what has come to light in the Children's Commissioner's report, more than just a number, tells me, and I think all of our society, that we are not protecting all of our children, that we are not looking out for all of our children, and indeed, Mr Speaker, that we are failing some of our children. The report has highlighted that more than 17,000 children are waiting to see a consultant for the first time. Mr Speaker, in this place, in this chamber, politicians are often accused of thinking only in parliamentary terms. So let me put this into parliamentary terms. With well over 17,000 waiting and 18 constituencies, that averages just shy of 1,000 children in each constituency waiting to see a consultant for the first time. Mr Speaker, let that sink in. Each member, 1,000 children in your constituency waiting to see a consultant for the first time. Also, Mr Speaker, what is absolutely harrowing is that amongst those 17,000 children, there are 24 waiting a year with a red flag to see a clinician over a cancer diagnosis. Mr Speaker, we are supposed to live in the first world, not the second, not the third, but the first world. And we are leaving children for 1 year to see a doctor when they have a suspected or even a confirmed cancer case. Again, I have to say this, we are not protecting our children or looking out for them. We are failing some of them. And we know as well, Mr Speaker, that many children and families across the north are waiting too long for appointments to deal with autism, ADHD and a whole range of other medical conditions. So let me be clear in summary. If the system isn't working, then it's broken. And if we know that it is broken, then there is a duty upon all of us here to do all that we can to fix it. And for those very children and their families who are still waiting, that is what I want to see in the weeks and the months ahead. Thank you, Mr Speaker.
Thank you. And I call Carol Killen.
And I want to thank Colin McGrath for bringing this Matters of the Day forward. So, as Colin said, these children and young people below 18 years of age, 17,000 of them, what they're waiting for is equality, basically. I also commend the Children's Commissioner for bringing this report forward. However, I do have serious concerns, as most members will. 24 children who have been waiting a year who are considered red flag. That is horrendous. It's horrendous for them, their clinicians, their medical teams, but more so their families. And we know them. These are people like ourselves, and it's awful. The system is broken. The system needs fixed. We've all said we need to take politics out of health, so we all agree on that. However, with the length of time that children and young people are waiting for their first appointment, their second appointment, for diagnoses, the list is getting worse. And it was like that before COVID, so let's be honest about that. COVID has compounded it, but it's got progressively worse. And there are no signs that it's going to be fixed soon. At the heart of all this, it isn't just about money, it's workforce planning. There is no safe staff legislation brought forward. Workforce planning, the approach is to bring more agency staff in, and that is completely unacceptable. We've heard practitioner after practitioner talk about this. The system is bursting at the seams. So if 24 red flag children who've either got cancer or suspected of having cancer are waiting a year, what does that tell you about the rest of health and social care? So I, again, thank Colin. I thank the Commissioner for bringing the report. But I think the challenge for us all is that when it comes to equality around health at the point of need, we are failing children and young people. Gormagov.
Thank you. And I call Pam Cameron.
Thank you, Mr Speaker. And can I begin by thanking the member Colin McGrath for tabling this very important matter of the day, and indeed thank the Children's Commissioner for her report. In the words of the Northern Ireland Children's Commissioner, these waiting time figures published are terrifying, and the consequences of them is having a profound impact on a child's health outcomes, emotional and mental well-being. This review, carried out by the Office of the Commissioner for Children and Young People, is very appropriately titled More Than Just a Number. And behind every statistic, Mr Speaker, lies a child and their family or carers. They all deserve much better. The review found that earlier this year, 1 in 5 children and young people in Northern Ireland were waiting for a first or review appointment with a consultant. The conditions range from cancer services to speech and language therapy, from scoliosis to autism assessments. 17,194 children and young people were waiting more than 1 year, and 510 for more than 4 years. One of the most unsettling figures detailed is that 24 children are waiting a year for their first cancer appointment. That suspected child cancer cases are not being addressed for over a year is a travesty. What message does this send out about how we value our future generations of young people? The report also makes 17 key recommendations that we all must examine very closely. One of the foremost recommendations is the call for a full review of child services from today's publication, and I believe that this could not come soon enough. There needs to be distinct, targeted and sustained focus on the current barriers to waiting lists affecting children's lives. We need to promote lasting solutions that place health and well-being of every child at the centre of acute, elective and community-based health services. The much-needed health transformation in Northern Ireland extends to all aspects of our services, not least in children's health and social care. This report is another stark reminder of the task ahead. Thank you.
Thank you, and I call Alan Chambers.
Thank you, Mr. Speaker. I welcome the publication of today's report. It's no doubt uncomfortable reading, but it is a valuable review of just how serious the situation we are facing. I was also glad to hear some of the commentary earlier this morning that the Health Department participated fully with the preparation of this report. There are other departments that perhaps could have been less willing to engage. So I welcome the relationship between the Northern Ireland Commissioner for Children and Young People and the Department of Health, and I fully expect that between them progress will be made on the report, as well as transforming and rebuilding paediatric services. But to be clear, our waiting lists were exacerbated by COVID, but they were not caused by COVID. This report makes it clear that the problem has been deep-rooted for several years. The Minister has repeatedly made that same point when he has spoken on the issue in this House. Last year, he inherited a truly appalling and intolerable waiting time crisis. There was no one single reason for it, but many factors have contributed to it. A failure to workforce plan, a failure to identify and close the opening gap between demand and capacity, a failure to transform services. In 2016, the Department published a 2016 to 2026 strategy for paediatric healthcare services. But within months, the executive collapsed, and it was 3 years before patients had a minister in place again. In June, the Minister published his elective framework, and I'm glad that so much of it, not least the immediate actions, are already been widely implemented. But to truly fix our waiting times and to put them on a sustainable footing so that we never again find ourselves in this position, it will take long-term investment, and everyone in this House knows that. Thank you, Mr. Speaker.
I'm going to call Paul Bradshaw.
And thank you to Mr McGrath for bringing this matter of the day today, and I welcome him back to Health Committee this week. I also thank the Children's Commissioner for her report on waiting times. I know that we, as the Health Committee, will be looking at that. The fact is that this is the latest general failing of an unreformed service. Just continuing to throw money at a system which does not work will simply leave us with more appalling instances of non-care. Remember, there are other health services in Europe which simply do not have waiting lists. The very idea that anyone, a child or indeed an adult, should have to wait any time at all between being told that they may have cancer and being given the details of what form may take and what course of treatment is necessary is unacceptable in many places. So why is it acceptable here? The reality is that the families left in this dreadful situation had two options. The first was simply to wait for the system to respond, going through all the uncertainty that brings and with the consequences it brings for the family's collective well-being. The second was to find the money to go private. Mr. Speaker, we don't want a health service where people are having to find the money. We want it to be free at the point of access, because there is no access if there is also a need for people to go private. It is not free. We do not have a health service based on NHS principles if 24 children have had to wait a year to find out about their prospective cancers. What will it take for us all in this chamber to grasp that transformation must proceed, and it must proceed quickly? What will it take for public debate to move on to make issues like this an absolute priority? How long are we meekly going to tolerate a health system which is not set up to deliver on the original pledge of being free at the point of access? Thank you.
I'm going to call Jim Allister.
Mr. Speaker, nothing is likely to touch any of us more than the death and the suffering of children. And therefore, this morning we rightly focus upon a very acute issue affecting a section of our community, but not unique to that section, because I think if we look at the whole range of cancer services for all age groups, we will discover quite a chilling situation. But as we focus on the position on children, it is truly shocking to hear the statistics that Mr McGrath laid out and that this report lays out in regard to this. And I do have to say this, and perhaps it's a little tiresome of me to say it again, but Yes, COVID has been an aggravator, but COVID is not the cause of our problems in the health service. The cause of our problems in the health service is gross, calculated underinvestment. You know, I think back to the years when Michael McGimpsey was Health Minister and the deliberate political cutting off of funding to make a political point, to make a point that he wasn't capable. It was his incompetence. And yet the reality was that health was being starved of funding. We're reaping that, and more since today. And I'm going to tiresomely remind this House, since devolution returned in 2007, we have seen a reduction of between 1,500 and 2,000 beds. It's not just the physical beds, it's all the staff that go with them across our health service. And then we are surprised that things are as bad as they are. This has been a crisis fundamentally made in Stormont. It was Stormont that cut out those beds from our health service. It's beds across the whole sector. So I do say to this House, yes, we rightly all lament the situation that we're facing in our health service, but let's be big enough to face up to the fact that these institutions have not served the health service well.
Thank you, Nicole. Jerry Carroll.
Speaker, thank the member for bringing this matter today, and thank the Children's Commissioner Cooley Zuma for the report. Mr. Speaker, the news that 17,000 children and young people, which amounts to 1 in 5 of them, have been waiting more than a year to see a consultant or a health worker gives serious cause for concern and raises many questions about the health impact that is being felt by young people who are unwell and in most cases unable to speak to the veracity of the pain and discomfort that they are going through. Young members of my own family have unfortunately experienced this scenario, and too many people in my own constituency and across the north as well. And today my heart sincerely goes out to them, today especially. The fact that so many are waiting on treatment is a shocking indictment and a continual reminder of how our health system is failing people who need health treatment. To be clear though, the failure is not on the part of our health workers, who not only have done an outstanding job in an unimaginable situation, but who are continually overworked and underpaid, once again, as the latest pay offer shows. Mr. Speaker, the failure lies in the fact that so many people, in this instance young people, lie on waiting lists, but the cruel reality is, if they or their parents had money, they could get access to private treatment in a matter of weeks. This is the failure that the Executive has not only allowed to continue, but has continually thrown money at the problem, reinforcing and funding the private sector system, reinforcing and funding a two-tier health system, whilst claiming to aspire of a health system for all. Repeatedly throughout the pandemic, Mr. Speaker, I have raised the fact that there exists beds, staff and facilities in the private sector that should be taken into public ownership for the fight against COVID, primarily, but also other conditions. Though I am always dismayed and puzzled when asking the Minister in an Assembly question about the exact capacity of the private sector, to be told that it would be too burdensome for the Department to get that answer to myself and other members. To me and anybody else, this would suggest that there are many in existence, and you look around you, around Belfast and elsewhere across the north, they're popping up private facilities left, right and centre. So the Minister and the Executive must now ensure that measures are taken to alleviate the waiting lists by acquiring the resources to treat people who are in need. That means paying our health workers properly to retain them, stop throwing tens or hundreds of millions of pounds in the private health sector, plug the gap of thousands of workers that aren't in the NHS, make sure safe staffing legislation proceeds, but also to do away with euphemisms like transformation or reconfiguration, which can often be code words for reducing, cutting, stripping back and not investing in our health service. And if we do that, then I think we'll be on course to deal with these and other waiting lists. Thank you.
Thank you. And I call Jonathan Buckley.
And can I thank Mr McGrath for bringing this morning? It's a very, very sensitive issue that should and deserves to be debated on the floor of the Assembly. And I thank the Northern Ireland Commissioner for Children and Young People for conducting this review of child waiting times. And sadly, I think for every member it will send a shiver down all of our spines as to the state at which our cancer services have got to. And sadly, I did speak on the issue of cancer waiting times and what I seen as a pending cancer crisis in Northern Ireland during the midst of the very severe lockdowns, because I was concerned. I had constituents come to me, whether that be young people who were unable to get the treatment they required, but also indeed all age groups that were really suffering as a result of a close down in many aspects of our health service due to COVID-19. I was accused of scaremongering when I called it a cancer crisis, but I stand by that today, because these figures are indeed at crisis point. We need to deal with the issue, and that's through the reforms that were in place. And I think it's a number of factors that the Assembly does have to address. One is, and I know it's something that some members don't like to talk about, I know it's something in which some representative health professionals don't like to talk about, but the lack of face-to-face GP appointments is having an impact on our current cancer crisis. I remember whenever we had a briefing from the health chiefs at the committee, and they talked about arriving at A&E, the late presentations during the midst of the severe lockdowns, and how that indeed was having an impact. And unfortunately for many of those that presented late, their inability then to get the appropriate treatment led to very difficult conversations. Just last week in my own constituency, I attended the funeral of a young one-year-old that unfortunately died of cancer-related illness. And you know, there's nothing more touching than a child that is suffering in pain with issues such as cancer, and we must redouble our efforts to address this issue, and that is through reform, members. And I look at some of the recommendations in the proposal: a full review of children's health system and appoint a Deputy Chief Medical Officer dedicated to children's health. That's something we can all get behind. To establish a single point of entry in our health service for children, I think that's something we can all get behind. The solutions are there, members, but we need to grip them. We need to grip them now, and we need to tackle this cancer crisis head on to ensure that we deliver best service for the people that we represent. Thank you, Mr. Speaker.
Thank you, and that concludes this matter of the day. Members, please take a ease for a moment or two to move on to the next item. Thank you. Okay, members. Moving on. Members, I have received notice from the First and Deputy First Minister that they wish to make a statement. Before I call a Minister, I do remind members that in light of social distancing being observed by the parties, the Speaker's rulings that members must be in the chamber to hear a statement if they wish to ask a question has been relaxed. Members do still have to make sure their name is on the speaking list if they wish to be called, but they can do this by rising in their places as well as notifying the business office or speaker's table directly. I remind members to be concise in asking their questions. It's not an opportunity for debate per se, and long introductions won't be accepted. I call the First Minister.
Thank you, Mr. Speaker. In our pathway out of restrictions published on the 2nd of March, the Executive made commitments on how we would approach our decision-making. We undertook that our decisions would be made on 4 overarching principles. Our decisions would be evidence-based, necessary, proportionate and sustainable. As our social contract, we said that we would regularly and carefully consider what mitigations are required and for how long in order to reduce transmission. We recommitted to the strategic priorities that we had set ourselves at the start of the pandemic, and at the front of our minds has been the health and well-being of our citizens, our societal and community well-being and our economic well-being, and the revitalisation of the economy. In our pathway, we set out the steps that we could envisage taking, and since March, we have worked through these carefully and cautiously across key themes. The pathway illustrated the steps for home and community, education and young people, culture, heritage and entertainment, sports and leisure activities, worship and ceremonies, travel and tourism, work, retail and services and hospitality. And we envisaged that these steps would bring us to a place where there might be a few remaining issues for the Executive to address. Throughout this year, the Executive has taken regular stock of the situation and the available data and impacts on our people in line with our key principles. Between the 1st of April and the 31st of October, 84 easements of restrictions have been delivered or agreed. We have, as we promised, moved through the pathway out of restrictions carefully and cautiously at all times. We've been driven by the data and also the impacts which restrictions have had on our economy, our people and families, and the wider societal impacts. We have been following very closely the decisions taken in nearby jurisdictions, but at all times our decisions have been focused on delivering the best outcomes for people here. We understand that some people will have wanted us to move more quickly, while others have been content with the careful and cautious approach. We hope that we've built confidence on the part of our people to exercise safer choices for themselves, and we've been very grateful for all the steps that have been taken to adhere to the public health advice. COVID remains with us. Unfortunately, that is a fact of life, and we need to continue to find ways to manage this situation. Our case numbers and other key indicators remain very high, with an average of more than 1,200 positive cases per day over the past 7 days. Almost 350 confirmed COVID patients in hospital, with 33 in intensive care. And we're now entering into the autumn-winter period where, as we know from last year, COVID thrives. Last year we did not see a significant flu season, but we cannot guarantee that it will be the same this year. Indeed, we must plan on the basis that we will see a flu season this year. At this time, 82.3% of our citizens that are aged 12 and over have received at least one dose of vaccine, and our vaccination rates are very good, but there's still room for improvement. The vaccination rate for 30 to 39-year-olds is at 79.5%, and this falls to 75% for 18 to 29-year-olds. For those who have not yet had their first jab, please do so as soon as you can. Every person who takes the jab makes a difference to themselves, their families and their communities. Everyone who takes the second jab further builds their own protection and those around them, including potentially vulnerable loved ones. And the booster jab is being rolled out, and we will continue to promote this because it makes a difference to how we will get through the autumn and winter. Too many families have lost loved ones to this dreadful disease. There are family members and friends who are still grieving, and many of our citizens continue to feel the impact of the pandemic. We must all do what we can to control the spread of COVID. We cannot put this highly enough. Every jab matters. Mr. Speaker, in relation to the decisions that we took on the 7th of October, we have looked carefully at what can be done now, and a number of easements were made on the 14th of October. We've also looked at restrictions which can be lifted at the end of October. In preparing for the Executive discussions, our officials liaised closely with key sectors, and we were very grateful for the support and attendance at those events by the Chief Medical Officer and the Chief Scientific Advisor. We have listened carefully to the views of the hospitality, arts and culture sector, to our business community leaders and to the faith leaders. Our decisions were taken in the context of COVID-19 data and mindful of the economic and societal benefits of opening up what we can do and when we can. For the record, from the 14th of October, the Executive agreed further relaxations around the numbers permitted in private dwellings and a move away from the maximum number of people allowed to gather from 15 from 4 households to an overall cap of 30. And the requirement for audience members to be seated when watching performances in indoor venues would be removed. The regulations in relation to large house parties and raves remain in place and are still not permitted. The Executive has also signalled its intention to introduce a further package of relaxations from October the 31st. Over the next few weeks, further work will be carried out with the sectors to prepare for those appropriate mitigations to be put in place in advance of the regulations being lifted. From the 31st of October, the requirement to be seated in hospitality to drink and eat food will be removed. The restriction on indoor dancing will be lifted. The need to maintain social distancing in hospitality settings such as pubs and restaurants will move to guidance, and nightclubs will be permitted to reopen. These relaxations rely on the adoption and implementation of measures that will help reduce the transmission of the virus and allow people to gather more safely in settings that would otherwise be considered higher risk. Extensive engagement has taken place with the arts, entertainment and hospitality sectors, and there has been a positive response to taking additional steps to ensure the safety of customers, staff and the wider community. It is strongly recommended that venues and events organisers require individuals to demonstrate their COVID status through proof of vaccination, negative lateral flow test or natural immunity by way of a positive PCR test within the previous 180 days. Some venues are already implementing these measures to help keep people safe and provide assurances to those attending their venues that all appropriate measures are being taken to protect them. Mr Speaker, in respect of the autumn and winter COVID contingency plan, we start with the need to keep sectors open to the fullest possible extent and hopefully in totality. Our schools and further education sectors are back, and we will want to protect that along with protecting our health service. We want to keep our business and leisure sectors open, and we want to minimise impacts on citizens over the coming months. We have the best chance of doing this if we all continue to follow the basics and if as many people as possible take the vaccines. Members will see a new public information campaign around the end of this month, which will build on the need for all of us to keep making safer choices. This is part of our social contract. Washing our hands, limiting our contacts where we can, self-isolating when we have symptoms or when asked to do so, giving our contact details to help with tracing, and using the outdoors when we can and letting fresh air in when we can't. While the importance of personal responsibility cannot be overstated, through our autumn-winter plan we have retained some baseline measures. These include the retention of a legal requirement for face coverings in crowded indoor settings, the retention of a focus on flexible and hybrid working to reduce the number of social contacts that take place in work settings, recognising that employers are well placed to engage with their workforce on the model that best suits their business, the continued legal requirement for risk assessments to be carried out in certain settings, and for visitor and attendee details to be recorded to support the work of the Test, Trace and Protect system. The baseline measures reflect advice from SAGE that early, low-cost interventions may forestall the need for more disruptive measures at a later stage. In the event that case numbers rise sharply or hospital pressures become unsustainable, the autumn-winter paper identifies a number of potential contingency measures, which include more focused communications to emphasise the risk and the need for everyone to act immediately, the potential to deploy COVID status certification in higher risk settings if considered appropriate and necessary, a strengthening of arrangements for self-isolation for close contacts, and a reimposition of a legal requirement for minimum social distancing in prescribed settings. We are very mindful that the COVID pandemic has been with us for 19 months, and we appreciate that it has been incredibly difficult for everyone. The vast majority of people continue to do the right things, and we are thankful. There are some basics that we need citizens to continue to do. And we want to explain why we are asking this of you. We understand that the vaccine programme has given us all hope. We ask you to remember that each act of personal adherence to the public health advice, however small, makes a big difference. So we want to set out what we are asking of you. To stay safe, you should, 1, get the vaccine when you are offered it. Wear a face covering in crowded or indoor settings, wash your hands regularly, and cover your nose and mouth if coughing or sneezing. Self-isolate and take a PCR test if you have symptoms. Take regular tests if you don't have symptoms to reduce the risk of spreading the virus. Meet outside if you can and open windows when indoors. Keep your distance from people not in your group and work from home where practicable, or do a mixture of home and office-based working. Throughout this pandemic, we have adopted a cautious approach to the relaxation of restrictions, as we have sought to carefully balance the health and well-being of our citizens with societal, community and economic considerations. The autumn-winter plan is a continuation of this approach. The efforts that have been made by so many in recent months to drive up vaccination rates and step up with compliance with mitigations do seem to be working. It is vital that we don't let up. We must maintain our focus and collective endeavour. All of us have a part to play in keeping transmission under control. Together, we can keep ourselves and each other safe. If we all do our part as organisations, employers and individuals, we can look forward to an autumn-winter period with fewer restrictions than at any time during the pandemic. Thank you, Mr. Speaker.
Thank you, and I call the Chairperson of the Committee for the Executive Office, Sinead McLaughlin.
Thank you, Mr. Speaker, and can I thank the First Minister and the Deputy First Minister for the statement this morning and for the contingency plan. The committee has been consistent in its message that the introduction or removal of restrictions needs to be evidence-based, and there needs to be clear messaging around what we all should do and shouldn't do. And I think it's fair to say that messaging from the Joint Office is not always clear nor consistent. We've also heard from young people and community stakeholders that planning for recovery should be inclusive and participatory. Can I ask the First and Deputy First Minister with whom you have engaged in the design and development of this contingency plan? Thank you.
Thank you, Mr. Speaker, and can I welcome Sinead McLaughlin to her new role as the Chair of the Executive Office Committee and wish her well in that capacity and look forward to engaging with her and with the members of that committee. In respect of messaging, I do agree with the member. It's important that we can have clearly communicated and understood messaging, and where that can be achieved with consensus and a unified approach, of course, that is something that we want. It's something that the First Minister and Deputy First Minister, both of us, seek to do. Not always easy in a five-party coalition, and other ministers from other parties will engage in their own positioning in a public way, which at times can undermine that collective nature of the Executive. But be assured that within the Executive Office, both I and the Deputy First Minister strive to have that unified approach and effectively communicating it. In terms of the engagement that has taken place, we have an Executive task force which covers a wide range of the areas where there is engagement with a whole range of stakeholders in the development of the plans, and that then comes through by way of advice to the Executive, and then we take decisions based upon the advice. So in terms of that engagement, it takes place right across society, whether that's been in relation to places of worship. There's a forum to do with faith leaders when it comes to the economic aspects. There are a wide variety of stakeholders within the hospitality sector, and there's ongoing work that takes place whenever we come to formulating our plans. That's been vitally important in terms of the collaboration that exists between government, public sector organisations, and then our ability to communicate to the citizen. And that togetherness is what has allowed us to make 84 different easements now. We have lifted restrictions over the past number of months, to the point at which by the end of this month there is only a couple of areas that are going to be left by way of regulation, as we've moved into a guidance space where we continue to provide the best advice.
Thank you, Mr. Speaker, and many thanks to the First Minister for this statement this morning. Could I ask the First Minister, would he agree with me that getting vaccinated is the best way to protect yourself, your family and other people? And would he encourage everyone to get vaccinated?
Mr Speaker, a key to the success of where we have been over the past number of months has been the rollout of the vaccination programme. On Thursday at our executive meeting, we're going to get an update in terms of the next phase of that, and as the plan indicates, we're going to continue to seek to encourage those that haven't been vaccinated to do so. There will be a very small number of reasons why some people may not do it for medical reasons, and we respect them to do that. But where somebody doesn't have an ethical concern or a medical reason as to why they wouldn't do it, then we would encourage people to take up the vaccine. And those that do have concerns can speak to their own GP, and they may be able to get reassurance from them to overcome any of the difficulties that they have. So I continue to encourage the uptake of the vaccine to do it. I myself have said that publicly. Indeed, at the weekend, I supported the flu vaccine uptake, going to my own local practice to do that. And that's going to be important as we head into the winter, that we seek to maximise the uptake on the flu vaccine so that our hospitals aren't overwhelmed with what have commonly become those seasonal pressures.
Call down Dodds.
Can I thank the Minister? What is the message for businesses and employers who still have staff working from home but who would like to return to a level of normality?
Well, can I thank the member for that question? And I know it is one where businesses have been seeking further advice in respect of it. The message around working from home was one that was never in regulation. It is one by way of guidance and reflecting as we have eased restrictions in the changing environment. It's right that that has evolved, and so the contingency plan, as I indicated in my statement, outlines where we are now in respect of that, and the plan does say, for the record, that we are retaining a focus on flexible and hybrid working to reduce the number of contacts that take place in work settings, recognising that employers are well placed to engage with their workforce on the model that best suits their business. So, Mr Speaker, that is an area where I know, along with the Junior Minister, I met with Citibank, for example, as one organisation, but there are others who have recognised the need to have members of their workforce to deliver both their business, but also for the individual to be back in the office learning from their colleagues. And they made the point that there are people who have been recruited within the past 18 months and they have only ever worked on their own at home, and these include apprentices, and they're not then learning from their colleagues, and there is a critical business need, but also for employees to be able to get that. So the contingency plan recognises that evolving picture, and I trust that that gives confidence to businesses to engage in that way.
John Stewart.
The First Minister and Deputy First Minister for this plan today. First Minister, you say should case numbers rise sharply, that one of the measures might be to introduce a COVID status certification. Whether this is mandatory or optional, could I ask how long such a certification scheme could take? And given the cross-cutting nature of such scheme, what preparatory work the Executive Office has done on this to date?
Mr Speaker, can I thank the member for this question? The contingency plan does reference the issue around the certification. It also indicates that the Department of Health has been developing the technical infrastructure that would be needed for its deployment. The plan does, however, recognise that, one, the Executive hasn't taken a policy decision for its use. Two, there would need to be an evidence base to do that. And in seeking to get that evidence base to facilitate those discussions, on the 18th of August, I and the Deputy First Minister corresponded with the Health Minister, outlining in detail what it is that the Department of Health does need to provide the Executive to do that. And for the record, let me just quote one of those paragraphs. Whilst our officials, this is in TEO, are able to assist with the scoping exercise in relation to the potential usage of a domestic vaccine passport across various sectors here, they are not in a position to lead on the development of any technical solution, nor are they in a position to determine if it is public health policy that the Executive should adopt. Mr Speaker, it went on then to indicate where this lies within the Department of Health, and it gave examples. When it came to the international travel technical solution, Department of Health introduced that without recourse to the Executive, and also when it came to changes to self-isolation for those fully vaccinated, that was a Department of Health-led policy that was then brought to the Executive, which we subsequently adopted. So the evidential basis on which the Executive would then need to have that discussion does sit within the Department of Health. It is for the Minister for Health, should he wish to introduce such a vaccine passport scheme, to come forward with a paper for the Executive then to consider.
I call Paula Bradshaw.
Mr Speaker, and thank you, First and Deputy First Ministers, for the statement today. In the paper you talk about the potential contingency measures which may be introduced if hospital pressures become unsustainable. First Minister, yesterday we had 347 people in hospital, 24 of whom were on ventilators, 2 up from the day before. How much worse must the pressures on our health and social care workers become before you bring these measures in? Thank you.
Well, Mr Speaker, in respect of how we're managing this within the health service, we do know that there was a critical care surge plan that was developed over the summer. That plan, understandably, seeks to avoid the use of the Nightingale, for example, and stepping it up, because it then has significant consequences when it comes to elective procedures being carried out. So that plan is continuing to be reviewed. The issue around the Nightingale would remain an option in the event of an extreme surge. So the health service is continuing to monitor the availability of its capacity. It is seeking to have an integrated approach so that the health service isn't cancelling elective care procedures, because that was something that had to happen in the previous waves. It hasn't had to happen this time. It has had some knock-on impact, but there is a regional approach that the Department of Health has now been taking so that it can better manage the issue around elective care. So we continue to be advised by the Department of Health in terms of the pressures that they are facing within the health service, and that's something that we will get regular updates within the Executive.
And can the member Colm Gillerny be brought on screen, please? Can the member pose a question?
Gormayagat John Corlia, August Gormayagat Gujianaya, Fuin Nafragra Gujianam Shaw. Thank you to the Minister for his answers up to this time. Minister, you referenced there the public messaging campaign that would go along with this autumn-winter plan, and I do recognise and support the need for good, clear public messaging. Can you outline what the public messaging will be and how this will be brought forward? Gormayagat.
Mr Speaker, there's a series of platforms in which we're seeking to communicate with the public, mainstream media, social media, and trying to target the messaging to the type of individuals within society that we're seeking to do. So in the statement I had outlined the kind of key areas that we're going to continue to ask citizens to provide their support with us on. So that messaging will be around the wearing of a face covering in those crowded indoor settings, common sense when it comes to regularly washing your hands, covering your nose and mouth. That will also have a positive impact on the seasonal colds and flus that we experience, and we're asking people to put that into practice. Continue to have regular testing if you're going into your places of work, even when you're not displaying symptoms. Sometimes a lateral flow test can detect if you have COVID where you're asymptomatic, and that's something that we're going to continue to encourage people to do. And then to follow that advice around self-isolation and getting your PCR, continuing to do the track and trace, providing that information. So we will be communicating that effectively. At the end of the month, there's going to be a programme where we'll be rolling out that type of communication and making sure that that message gets to citizens, and of course through the other channels that we use in engaging with the various sectors and organisations. That work will continue through the COVID Task Force team.
We call Paula Bradley.
Thank you, Mr Speaker, and thank the First Minister for his answers so far. First Minister, in your statement it says extensive engagement has taken place with the arts, entertainment and hospitality sectors, and we know they were massively impacted during the pandemic. Can I ask what feedback there has been from these sectors since the recent relaxation, particularly indoors?
Can I thank the member for that question? And I know this is an area that she raises regularly with me in her role as chair of the relevant committee that covers arts and entertainment venues. There has been very constructive work with the hospitality sector, with events, and that has allowed us to move restrictions that were in regulations into a guidance format, because there is the confidence that those mitigations that we're asking organisations to voluntarily put in place. And the feedback has been that those organisations with large events, they have done that, and then they have effectively ensured compliance with it. So we had a 99% compliance figure was given to us in terms of the update around how these events are taking place, and those organisations, they're taking that decision. It's ultimately a commercial decision that they will take, and they have denied individuals gaining access to that. That's not something that we have mandated, because I do believe that that's something ultimately for businesses and commercial organisations to do. So there has been extensive engagement with all of those different sectors within events. That allowed us to move, for example, on the 14th of October, the ability to stand within indoor venues, because that did have an impact on their viability. So because of that constructive relationship, because of the willingness of those organisations to proactively put in place mitigation measures, that partnership approach has allowed us to move away from regulation into a guidance format. And as we get to the end of this month, I'm confident that those sectors will continue to work with us and allow further progress to be made for their sustainability.
And can I welcome and call the new member, Eileen Riley? Alder Road.
And I thank the First Minister for his answer so far. First Minister, while our vaccination rates are relatively high, the take-up is lower among our younger people. How can the Executive ensure that more people, particularly in the younger age groups, be encouraged to take up the vaccinations?
Mr. Speaker, let me join in welcoming the member to her place and wish her well in this role as a member of this Assembly. I, like the member, continue to share that concern about wanting to increase the vaccination level. I've said on the record, I don't believe an overtly coercive type approach is actually the best way, and indeed there would be some admittedly anecdotal evidence that sometimes the harder you push people who are resistant, the more resistant they become. I believe that the best advice that we can give to people is to listen to your scientific experts, listen to the medical experts, then have conversations with family and friends who have received the vaccine, and that will hopefully inform those individuals to make a decision then that they feel comfortable and confident to do. So I would continue to encourage and promote those that haven't been vaccinated, who have no reason to object to the vaccination, in order to do that, and encourage them to take it up.
Thank you. And I call Pam Cameron.
Thank you, Mr. Speaker, and can I thank the First Minister for the statement to the House this morning, and welcome the easements that are in place. And while recognising there will be ongoing concern about how the health services will cope going into the winter months, in terms of vaccination rollout, Mr. Speaker, the First Minister will be aware that there is a reluctance among some, not least pregnant women, with the ethnic minority groupings, and also people who are concerned around the ethical nature of vaccines, or people who are questioning that. Can the Executive Office work with the Department of Health to ensure that misinformation is addressed speedily, so that we can ensure that those who can take a vaccine are encouraged to do so quickly, and not just the COVID vaccine but also the flu vaccine if it's made available to individuals?
Thank the member for that question, and I would encourage those who do have health concerns about taking the vaccine to engage with their GP. I know our general practices have been doing an excellent job in terms of making sure that the vaccine has been rolled out, and speaking to people to follow up on those who haven't received it, and then providing them advice. So for pregnant women, I would encourage them to speak to their health professionals in respect of that. We do have myth-busting advice that's available to people for some of the claims that have been made, and this is an area where at the Executive we did have a discussion, for example, on the ethical issues around the vaccine, and those concerns where one of the vaccines, where there was a belief that it had been developed or had its origins in an aborted cell fetal line, and there are vaccines where that isn't the case, where they've been synthetically developed, and that overcomes where there may be an ethical concern for one particular type of vaccine. There are others that should provide the confidence to people to address those, and people should seek authentic sources of information. We're all fully aware that when it comes to social media, that we need to ensure that we're going to the right sources to get that information, and there's extensive advice that's available on our government websites that should allay a lot of the concerns that some people have.
Thank you. I call Steve Aiken.
Indeed, the First and Deputy First Ministers for providing this information for us today. And just referring to the previous comments made by the First Minister, I'm glad to see there's a new public information campaign that's been run out. But First Minister, you'll be fully aware of the issues around the anti-vaxxers and the COVID deniers who are out there as well. What more concrete things could we be doing? And would you call on all members of this Assembly, indeed everybody in public life, to go out there and tell everybody to get vaccinated, because we have to do this, because we're heading potentially to another outbreak?
Well, thank you, Mr. Speaker. Nobody can deny, or nobody credibly can deny that COVID doesn't exist. It does. And when you look at the statistics in respect of then the impact that the vaccine programme has had, again, nobody can deny that when it comes to reducing the impact around serious illness, the need for critical care, whenever we compare to the current number of transmissions that's taken place and the correlating hospitalisation rate, it is at a much significantly lower level than what it was when we didn't have the vaccine and we didn't have the high levels of the community being vaccinated. That evidence is there, and again, nobody can deny that the vaccine does not reduce your risk of serious ill health and indeed fatality. That's, in my view, cannot be disputed by anybody credibly. And so on that basis, we do encourage people to continue to take up the vaccine. I have outlined now on a number of occasions the basis on which I advocate for people to do it, and where people have concerns, they should go to health professionals, talk to them, see if those concerns can be addressed, and make sure that you're getting your evidence and your advice from official authenticated sources of information, not going to social media and those who proclaim to be experts in this area when they're far from experts. And indeed, the advice that they can give can be wholly counterproductive, and is something that I would very much caution people about whenever it comes to getting advice in respect of that.
Call Ciara Ferguson.
Thank you. Does the Minister agree that we must do all that we can to keep the pressures off our health service and health staff over the autumn and winter period?
I absolutely do, and I know that with the Deputy First Minister we visited health professionals in the Royal Victoria Hospital. We discussed with a number of their lead clinicians the pressures that they're facing, and there is no doubt that our health professionals have faced huge demands, both physically and emotionally, over the past 19 months, and we need to give them support in seeking to minimise as far as possible the pressures that they're going to face over that winter period. And the best way to do that is to follow the steps that we have outlined, take that personal responsibility seriously. We don't want to go back to where we were, because going back to where we were also has an impact on our health service. That's something that I heard very clearly whenever I was in the emergency department. There are more people who are presenting themselves with conditions that are much more developed than otherwise would have been the case, because people were afraid to come into their hospitals. They weren't able to access the health care that they wanted because of restrictions that were in place. The levels of mental health is at a level which should cause us all concern because of those lockdown measures. People that were isolated. Whenever I look at the incidences of domestic violence that took place, again, restrictions had a negative impact on people that were stuck in their homes. So, lockdown is not a solution that is free of consequences. It has consequences, both physically, mentally, and that then is now being manifest in the pressures that our health service is facing. So, let us work together in the measures that we have outlined in terms of the steps that we as citizens can all take business organisations can take, that will play its part in seeking to help the health service and those health workers during the winter period.
Paul Frew.
Speaker. First Minister, you tell us that the Health Minister has failed to bring forward suitable evidence to suggest that a domestic COVID certificate system would lead to better health outcomes, even though he has said that he supports one. But has he brought forward any equality impact assessments on the damage it could cause, discriminating against people and refusing them entry to services and hospitality and access to goods, with all the horrendous and atrocious harms that that will bring?
Mr. Speaker, this is an area where I share concerns that the member has articulated, and I've raised it at a number of the executive meetings, that in taking a decision around the introduction of such a scheme, either in its rollout on a voluntary basis but making it available, that requires for there to be equality impact assessments, human rights assessments carried out. If it was to be introduced in a mandatory form, that would require regulations. That must have a full equality impact assessment. It must have human rights considerations taken into place. That hasn't happened. And therefore, to ask the executive to take a decision on this in the absence of such information, I don't believe is a sound basis for an executive to take that decision. And we have communicated that to the Minister for Health in respect of that. We did so as recently as the 4th of October, whenever we outlined the types of information that would be required in order for the executive to have that kind of discussion. We also communicated this directly. Minister Mallon raised it in correspondence with the Executive Office, and again in October, the paragraph that we cite on that, and let me just for the record state it, given that policy responsibility for COVID vaccination certification lies with the Department of Health, the Executive would require that a paper be presented by them detailing the public health evidence alongside which areas may benefit most from a COVID certification scheme, including information on what can be achieved within cost and time constraints whilst meeting commitments in respect of data protection, equality and human rights. Those are issues that we've outlined consistently to the Minister of Health that would need to be addressed in order for the Executive to have proper consideration of such a scheme being introduced either on a voluntary or a mandatory basis.
Stuart Dixon.
Mr. Speaker, thank you, Minister. Minister, overwhelming scientific evidence shows that ventilation is vitally important in dealing with this current pandemic. The Scottish Government recently has introduced a £25 million grant to support businesses, factories and other buildings to deal with ventilation issues. It's unacceptable just to prop doors open with fire extinguishers. Buildings are not always easy to ventilate. The sum total of your statement says that you're exploring CO2 meters. What more can you do, and will you give consideration to a similar grant to that which the Scottish Government has done in relation to delivering high-quality ventilation over the winter period?
Mr. Speaker, the member is absolutely right to raise this issue, particularly as we move into winter, and then people will understandably close their windows and so on because it's much colder. So he is right. The statement does reference it, but within the contingency plan there is a dedicated section around ventilation where we lay out in more detail the work that is being taken forward by the Executive's COVID task force, and a number of the areas where that includes is around providing further advice and support to businesses to help them check their ventilation levels and introducing carbon dioxide monitoring where appropriate. Also enhanced easily accessible messaging specifically on ventilation and what is good practice and what is not, and then exploring options for the targeted deployment of CO2 monitors in key areas of the public sector estate. He rightly points to financial support that Scotland is providing. This is an area where we have had some discussion that, is there the ability to provide financial support in order for some of these measures to be introduced in terms of working with businesses, and also across when it comes to the public sector estate, that will be more easily accessed. But he is right, ventilation is an important part of this, and the COVID task force is taking forward proposals in respect of this issue.
I call Rachel Woods.
Mr. Speaker, and I thank the First and Deputy First Ministers for coming here today. I am still contacted by constituents who are clinically extremely vulnerable, who are immunosuppressed or who cannot take vaccines, worried about relaxations. So can I ask if within this autumn-winter plan is there any part or section of the contingency measures that deal with those who are CVE or immunosuppressed to ensure their safety? And also if the First Minister has any information if there's an intention to approve vaccines for those who took part in the Novavax trial in the Executive.
Mr. Speaker, on the last point, I don't have that information, so I'll undertake to come to the member in respect of that. I, like her, have the same constituents who, whenever relaxations have taken place, have contacted me and indicated that they feel that those relaxations are then putting people who are more vulnerable at risk. I can understand that concern. It would be a concern that I would have if I was in that same position. This is all about trying to get the right balance. It's all about providing the best possible advice to people in order that that informs the decision-making process that they are then going to take, and that includes making sure those that are more vulnerable than others are getting the right advice in respect of that. So I absolutely understand the concerns that people have whenever it comes to relaxations being lifted. This is why the Executive has had a very difficult job in trying to get the right balance and taking its decisions that affect all of our citizens.
Call Jim Allister.
For a statement that tells us nothing new, this statement will take some beating. But could I ask the First Minister, why does this Executive think it right to give unrestrained access to nightclubs while continuing to restrict the visiting of family members to hospitals? Surely he must know of many cases, as I do, of very distressed families who are told, sorry, one person, one visit per week. And yet it's open house when it comes to nightclubs. Where's the logic in that?
Well, on that latter point, I absolutely agree with the member. Whenever it comes to getting access to loved ones, only last week I visited a close friend of my family whose husband passed away at the age of 93, who had had a stroke, and for 1 full month no one was allowed to visit. Only at the point in which it became clear that he was going to pass away were family members allowed to visit. I think that isn't acceptable. And there is a disparity across our health trusts as well when it comes to the approach that is being taken. We have some health trusts that are providing more visitation for families compared to others, and I don't understand why that disparity has taken place. The Department of Health has provided clear advice as to what's expected of trusts, but the member in making this connection between nightclubs and what's happening within our health services misses the point that nightclubs has been governed by regulation. What the member is referring to within hospital visitations is not covered by the law. That is a matter which is subject to guidance by the Department of Health. So there is a clear distinction, and that's not unique to the Department of Health. There are guidance being provided within departments to across all of the arm's length bodies that they're responsible for, whether that's Department for Communities and providing guidance to the sporting organisations, or whether it's within education that provides guidance to schools. All of those are matters of guidance. I encourage executive ministers to keep those very much under review to make sure that they are proportionate, that they are necessary, and where they're not, they should be being lifted. So that is the distinction between the two. I know the member will welcome the fact that from April we have lifted 84 restrictions. We are down to now, at the end of this month, where we only have a very small number of restrictions that are being governed by law. The rest is by way of guidance. That has been a very successful approach taken by this executive, and whilst I know the member often doesn't want to give credit at times to this executive, but I think it would be churlish not to acknowledge that we have made significant progress in the easing of restrictions, and he would be the first to be critical of this executive had we not got to the point to where we are at the end of this month.
Jerry Carroll.
Thank you, First Minister. You've stated the cases remain very high, and that's obviously very concerning. So I want to wonder and what they ask really, if you have abandoned your plans, your reckless plans to ensure all restrictions are lifted by the end of the month, and if you and the executive get their way, what is your assessment of what the NHS looks like this winter?
Well, Mr. Speaker, this is not in any shape or form reckless in terms of the approach that we have taken. We have followed health advice throughout in terms of the decision-making process. What the member fails to acknowledge is the points that I made earlier, that there has been severe impacts upon citizens across our society as a result of the type of lockdown measures that he would seem to want to advocate for. He ignores the mental health consequences, the domestic violence that has taken place. He ignores the delayed detection of people that have cancer, which is now manifesting itself. So if the member is going to advocate for the type of lockdown that we had before, he needs to accept the consequences that then have flowed from that. Where we are currently is far from where we were in the earlier stages of this pandemic. At one point, we had over 800 people in hospital. Today, it's in and around the 350, and that's where it has been stubbornly for the past 6-7 weeks. The hospitalisation rate in terms of those that contract COVID is significantly diminished from where we were previously. So to present the current position and to compare it with previous occasions is to deny the facts as to where we are in managing this pandemic. So these are all balanced decisions that the executive has taken. The member has raised his position. I've put on the record his failure to acknowledge the devastating consequences that happened from those previous restrictions.
Can I call Trevor Lunn?
Thank you very much, Mr. Speaker, and I thank the First Minister for a very useful statement. I wanted to ask for just some clarification around gatherings in indoor domestic settings, because we seem now to be allowed up to 30 people from an unspecified number of households to gather indoors. But at the same time as we're banning house parties still. An indoor gathering could be for many reasons, but the type of ones I'm thinking of, I'm not that familiar with them these days, but it could involve indoor dancing, which isn't banned apparently, and music and drinking. So at what point does a gathering like that become a house party? And how would anybody distinguish?
The member is right to raise this point, and whenever this regulation was changed, but the retention was going to be in for house parties, I asked that question, what does that mean? And we had to look to the regulation, and it just defined it as a gathering of more than 30 people. And so that is the basis on which it is capped at 30. And there is a distinction between what is a house party, which is now just defined as being any gathering of more than 30, and then a rave, which is very clearly connected to loud music and so on, and that is defined in regulation. So that's why it is at 30. I think there are very limited circumstances whereby you would have more than 30. I certainly wouldn't want to ever have more than 30 in my own private dwelling. But he does raise an issue around this. There will be those who have very large private dwellings, and they are caught at the minute by this restriction. And it may be for a gathering of people that are engaging in house worship, for example. A prayer study, and people have made representation for me on that and says this is not like we're not dancing, we're not doing all of those things, but yet we're still limited to 30. So I think it will be very few, but nevertheless I think it is an issue that we need to continue to keep under consideration. And in respect of, Mr. Speaker, the remaining regulations and the guidance, obviously there is a monthly requirement for the Minister for Health to carry out an assessment as to the justification for continuing to have this legal framework, and with that will coincide executive consideration of what our baseline measures are and what our guidance are, and we will seek to have that in conjunction with that periodic review that the Minister of Health has to do whenever it comes to the arguments around and justification of retaining the legal framework.
Members, that concludes the ministerial statement. Members, please take your ease for a moment or two before we move on to the next item on the agenda. No. But we can't. We're just one short of a quorum, but we don't need the quorum until we put the question. So, depends on how long you speak and how long it takes a member to come. Okay. So the next item of business is a motion from the Committee for Finance to extend the committee stage of a bill. Clerk, please read the motion.
That in accordance with Standing Order 33(4), the period referred to in Standing Order 33(2) be extended to the 28th of January 2022 in relation to the committee stage of the defamation bill.
Thank you. And I call the chairperson of the Committee for Finance to move the motion.
So moved.
Thank you. The Business Committee has agreed that there should be no time limit on this debate. I call the chairperson of the Committee for Finance to open the debate on the motion. Steve Aiken.
Thank you very much indeed, Mr Speaker. The second stage of the defamation bill was successfully concluded on the 14th of September 2021, and the bill was referred to the Committee for Finance at that time. The bill deals with important issues in respect of free speech and defamation. It includes a number of provisions which some may indeed find contentious. The committee stage is currently due to conclude on the 2nd of November 2021, which will not afford enough time for stakeholders to respond to the call for evidence or for the committee to consider the clauses of the bill and the necessity for relevant amendments. It is therefore requested that, in accordance with Standing Order 33(4), the period for the committee stage of the bill be extended to the 28th of January 2022. The committee is cognisant that there will be considerable pressure on plenary business at this time, owing to the volume of executive legislation. However, the committee will therefore, of course, endeavour to conclude and report on the committee stage well in advance of this date. I commend this motion to the House. Thank you, Mr Speaker.
Members, the question is that the motion standing on the order paper be agreed. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. That's page 5. The next item of business is a motion from the Committee for Communities to extend the committee stage of a bill. Clerk, please read the motion.
That in accordance with Standing Order 33(4), the period referred to in Standing Order 33(2) be extended to the 14th of January 2022 in relation to the committee stage of the Private Tenancies Bill.
And I call the Chairperson of the Committee for Communities to move the motion.
So moved.
Thank you. The Business Committee has agreed that there should be no time limit for this debate. I call the Chairperson of the Committee for Communities to open the debate on the motion.
Thank you, Mr Deputy Speaker. I rise to request members' support to extend the committee stage of the Private Tenancies Bill to the 14th of January 2022. At the second stage debate on the 13th of September, I highlighted that this bill proposes welcome changes and the committee supports the aims. But as everyone in this House knows, the devil is in the detail, and the committee has identified a range of important stakeholders it needs to hear from in the 4 key areas, that being tenancy management, rental payments and deposits, property standards and security of tenure. Mr Deputy Speaker, the need to extend is twofold. Firstly, there is a matter of logistics. We are currently in the committee stage of 3 bills: the Charities Bill, the Private Tenancies Bill and the Betting, Gaming, Lotteries and Amusements Amendment Bill. We are progressing all 3 at once in planned order to ensure a balance of thorough scrutiny with a strong chance at completion of all 3 in this mandate. To that end, the committee is working at pace and will be meeting twice a week from the start of November until the committee stages of the bill are completed. We are well progressed with the Charities Bill and start deliberations next week. The call for evidence is in progress for the Private Tenancies Bill and closes on the 29th of October, and the call for evidence for the Betting Bill launches today. Secondly, the committee needs to be content that it has sufficient time and space to undertake thorough scrutiny. The members of this House raised many issues and matters of concern during the second stage debate. In fact, I think every key clause was touched upon in that debate, which clearly shows the depth of scrutiny needed. The committee will not lose sight of ensuring we do the best we can with the bill for those within the private rented sector, but particularly the individuals and families who make their homes within that sector. Some examples of comments made at the second stage make the committee very mindful that the level of scrutiny required. I will highlight a few of them for now. No specific legislation has yet been put in place to protect private renters, many of whom have been pushed into the sector by the lack of social housing stock. A good quality, affordable and secure home upholds many other aspects of life, including health outcomes and educational attainment. Until such times as we can build adequate levels of housing, we will continue to see people going to the private rented sector, and housing rights attest to the fact that a disproportionate number of calls to their advice line come from the private renters. Mr Deputy Speaker, we have all had constituents come to us in despair after being served with eviction notices by private landlords through no fault of their own, and without any realistic prospect of being rehoused any time soon through the social sector. So I ask this House to allow the committee additional time to scrutinise the bill so we can do our level best to ensure it forms a solid way forward for tackling outstanding matters in the next mandate. We will not hesitate to seek clarifications and propose amendments if needed. Mr Deputy Speaker, a very busy time lies ahead for us in the next few months, and therefore I ask that members agree to this extension to allow us to give the bill the attention it deserves and to plan our work to deal with other bills and our wider workload in parallel. Thank you.
Members, the question is that the motion standing on the order paper be agreed. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. The next item of business is a further motion from the Committee for Communities to extend the committee stage of a bill. Clerk, please read the motion.
That in accordance with Standing Order 33(4), the period referred to in Standing Order 33(2) be extended to the 20th of January 2022 in relation to the committee stage of the Betting, Gaming, Lotteries and Amusements Amendment Bill.
Thank you, and I call the Chairperson of the Committee for Communities to move the motion.
So moved.
The Business Committee has agreed that there should be no time limit in this debate. I call the Chairperson of the Committee for Communities to open the debate on the motion.
Thank you, Mr Deputy Speaker. I rise to request members' support to extend the committee stage of the Betting, Gaming, Lotteries and Amusements Amendment Bill to the 28th of January 2022. At the second stage debate on the 27th of September, I highlighted that this bill marks the start of the process to bring about important and long-awaited amendments to the 1985 order, which has remained largely unchanged since it was enacted 35 years ago. As a result, it is clear that gambling legislation here is very outdated. The House is aware that the Minister is taking a two-stage approach to reforms, including this bill, which unfortunately will not establish a new regulatory framework, but will amend parts of the 1985 order. Mr Deputy Speaker, the committee has already identified a number of key areas and stakeholders from which it wishes to take evidence. To understand the impact of gambling-related harm, the impact of the bill on the local gambling sector, on local government, on sports organisations and groups, on local support organisations for gambling-related harm, and on current treatment and prevention services. I'm not going to repeat everything I said a few minutes ago regarding the private tenancies bill, but there is the need for this extension. Firstly, the logistics, as I've said, we are currently in the committee stage of 3 bills, and we are progressing all 3 at once in a planned process, and will be meeting twice a week from the start of November. The committee needs sufficient time and space to undertake thorough scrutiny of this bill also and ensure it achieves as much as it can. We know that we will likely be hearing as much about what is not in the bill as what is in the bill, and we have all heard the Minister say that this bill is about what is achievable and realistic within the existing statutory framework, as many of the challenges cannot be addressed through our present system of regulation. As with the private tenancies bill, the members of this House raised many issues and matters of concern during the second stage debate for the committee to consider. Widespread views were expressed, with some focusing on the bill's shortcomings and missed opportunities not to do more, and others recognising it as a starting point for more widespread reform in the next mandate. Mr Deputy Speaker, it is very clear that the committee has a tall order ahead of it with this bill, so I ask this House to allow the extension, to provide the committee additional time to scrutinise the bill, so we can do our very best to ensure that the bill before us achieves as much as it can do. As always, we will not hesitate to seek clarifications and propose amendments if needed. Thank you.
Members, the question is that the motion standing on the order paper be agreed. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. The next item of business is a motion from the Committee for Justice to extend the committee stage of the bill. Clerk, please read the motion.
That in accordance with Standing Order 33(4), the period referred to in Standing Order 33(2) be extended to the 28th of January 2022 in relation to the committee stage of the Justice, Sexual Offences and Trafficking Victims Bill.
Thank you, and I call the Deputy Chairperson of the Committee of Justice, Sinead Ennis, to move the motion.
Moved.
Again, the Business Committee has agreed that there should be no time limit on this debate. I therefore call the Deputy Chairperson of the Committee for Justice to open the debate on the motion.
Gurmaget last Concordia, and I apologise at this stage, this is all starting to sound very familiar. Deputy Chair, the committee stage of the Justice, Sexual Offences and Trafficking Victims Bill began on the 14th of September 2021. The bill contains 22 clauses divided into 4 parts. Part 1 aims to strengthen the law on sexual offending to better protect children from sexual exploitation. It also creates a new offence of upskirting and downblousing. The bill will also implement a number of the recommendations contained in the Gillen report and its review into the law and procedures in sexual offences in Northern Ireland. It includes provisions to extend the current lifelong anonymity of the victim of a sexual offence, provides for the anonymity of the suspect in a sexual offence case up to the point of charge, and excludes the public from hearings of serious sexual offence cases. Parts 2 and 3 of the bill include provisions relating to trafficking and exploitation and prevention orders, and these clauses make minor adjustments to existing provisions and aim to improve effectiveness. The current practice of providing support and assistance to adult potential victims of slavery, servitude or forced compulsory labour, where there is no element of trafficking, will be placed on a statutory footing. The bill was introduced to the Assembly on the 5th of July, just before summer recess. This meant that the second stage debate could not be scheduled before September. The Justice Committee was conscious of the limited time it would therefore have available, assuming the bill passed second stage in September, to consider this important piece of legislation and ensure it passed through all the necessary stages before the end of the mandate. For that reason, the committee agreed on an exceptional basis to call for written evidence on the bill following its introduction to the Assembly prior to second stage. The call for evidence was issued through media notices in the main newspapers and the Assembly website, and the committee also wrote to a wide range of key stakeholders and organisations seeking views and comments. The deadline for responding to the call for evidence was the 24th of September, although submissions continued to be accepted up until last week. The committee intends to undertake detailed scrutiny of the bill and will take oral evidence on the key issues brought to our attention to ensure the legislation is as robust and effective as possible and any current legislative gaps are fully addressed. In addition, the committee has been advised of potential amendments that the Minister intends to bring forward, including in relation to the rough sex offence, and to widen the scope and strengthen the current law on the abuse of positions of trust. Although not included in the bill as introduced, they are important matters that are likely to also be raised by stakeholders in the written and oral evidence received on the bill, and which the committee has undertaken to consider. At the meeting of the 7th of October this year, the committee discussed the timetable for this bill and agreed to seek an extension to the committee stage until the 28th of January 2022. This timeframe is necessary to provide the committee with adequate time to undertake the detailed scrutiny that the bill requires and provide maximum flexibility to complete the committee stage of the other bills that are currently with the committee. Work on the bills has also been balanced with other work the committee is required to complete and any issues that may arise unexpectedly. I can assure the House that the committee will endeavour to report to the Assembly on the Justice, Sexual Offences and Trafficking Victims Bill earlier if possible. The extension until the 28th of January, however, provides us with the required maximum flexibility to manage the heavy legislative programme that we have to complete and to prioritise work on particular bills at certain times if that is necessary. I commend this motion to the House.
Member, the question is that the motion standing on the order paper be agreed. All those in favour say aye. Contrary, no. The ayes have it. The ayes have it. The next item of business is the introduction of a Domestic Abuse Safe Leave Bill, and I call Ms Rachel Woods to move at the first stage.
I beg to introduce the Domestic Abuse Safe Leave Bill.
Clerk, will you please read the long title?
A bill to make provision for an entitlement to be paid safe leave for victims of domestic abuse and for connected purposes.
And that constitutes the bill's first stage, and it shall now be printed. The next item in the order paper is a motion on the stability of institutions and referral to the Assembly and Executive Review Committee. I'll ask the clerk to read the motion.
That this Assembly affirms the importance of the stability of these institutions in order to deliver for the people of Northern Ireland, refers to the Assembly and Executive Review Committee under Standing Order 59(3)(b), consideration of the matter of replacing the current cross-community voting system, which is based on community designations, with a weighted majority system free from designations, to be used in place of cross-community voting in the circumstances specified in the Northern Ireland Act 1998, or when a reformed petition of concern is invoked, and agrees that the committee should report on the outcome of this consideration to the Assembly before the end of this mandate.
responsible for the motion seeks to amend their own motion, they are invited to address both the motion and amendment within the time allocated. But 15 minutes for the second amendment has been added to the overall time for the debate. So I now invite you. Sorry. Oh, yeah. Your amendment. You have 10 minutes to propose both the motion and your amendment, and 10 minutes to wind on both. I now invite you to open the debate on the motion and upon amendment number 1.
Thank you, Mr. Speaker. In bringing this motion and amendment today, my Alliance colleagues and I are seeking clear affirmation from all members in the importance of the stability of these institutions in order to deliver for all the people of Northern Ireland. In this mandate, we have already suffered a 3-year collapse and are again under the threat of another collapse due to politicking of some over the results from Brexit and its progeny, the Protocol. Threats to bring down the political institution are happening at a time when we have the worst patient lists, as highlighted today by the news of the number of our children waiting on first appointments for serious illnesses such as cancer. We have more citizens living with pain and an exhausted and a demoralised health service workforce. We are not delivering effective care or respite for people with disabilities, older people and their carers. We have people on benefits who are living in poverty, having to choose whether to heat or eat. We have a broken system that needs a stable government, a government committed to delivering for everyone. Our economy needs a government to lead the way, to take opportunities, and instead we have political bickering within a mandatory coalition that is no longer working or acceptable to the public. The Executive is failing to deliver effective government. Ministers block legislation that could help to make the lives of citizens better. Why is this legislation being blocked? It's being blocked because it can be blocked. It is blocked because the mandatory coalition does not work. The designation system is not working. It forces parties that have contradictory political aspirations to have to work together. The resolution to a broken system is to fix it. Therefore, on behalf of the Alliance Party, we welcome the work initiated by the Assembly and Executive Review Committee to consider the matter of replacing the current cross-community voting system, but we need that report to be produced before the end of this mandate, preferably before the pre-election period starts. AERC has been tasked to investigate designations, but at its last meeting there was an issue and designations was relegated into the too difficult box. Instead, a collection of external academic reports are to be collated and provided for whoever may be on AERC in the next mandate, effectively kicking the can down the road. When I stated in the meeting that the issue of designations was already decided as a priority, I was told there is not time. There is time. Where there is a will to ensure the votes cast for every elected representative in this House will be treated equally during every vote. If this impacted your party, time would not stop changes from being made. Given alternatives to designations can stabilise this institutions, we must find time. Alliance has made it clear we respect democracy, we respect these devolved institutions. This is why we are trying to find ways to stabilise the institutions, so we do not have another collapse and failure to deliver. We can do this by removing designations from the processes. I respect everyone's right to their political opinion, but why should we continue to base our political process on the protection of two opposing political opinions? I'm not giving way through this, sorry, I just want to get it out. People in Northern Ireland enjoy free elections and can vote for representation, and for that elected representative to enter the system, to make decisions, to cast votes in an equal system where every vote is treated the same. However, this House provides a type of democracy where only Unionists and Nationalist votes carry the same weight for some votes. Every time a cross-community vote takes place, my vote is treated differently. It is time all of us who respect democracy replace the cross-community voting system based on political designations with a weighted majority system, free from designations, to be used in place of cross-community voting in the circumstances specified in the Northern Ireland Act 1998 or when a reformed petition of concern is invoked. It is astonishing that cross-community voting continues to treat cross-community parties such as Alliance, the Greens and People Before Profit as less than those who are nationalist or unionist. In 1998, when the Good Friday or Belfast Agreement was signed, not too many people thought that there would be a significant growth of non-aligned parties, but here we are. Mr. Speaker, I find cross-community voting insulting. By not counting my vote in the same way as a unionist or nationalist, it is demeaning. Just because I am not a nationalist or a unionist, I am considered to have lesser value in this House. I look to all of you. Is this really how you see me? If this House used my gender, my race, my sexuality, my marital status or my religion to treat my voting rights differently, I could engage a solicitor and sue this House for discrimination. This House treats my vote as different to the rest of you on the basis of my political opinion. Members, why are you allowing difference, discrimination and damage to happen each time a cross-community vote happens? In the Code of Conduct for MLAs, under Section 8, we are all required to uphold the principle of equality. The published code states, members should promote equality of opportunity and not discriminate against any person, treating people with respect regardless of race, age, religion, gender, sexual orientation, disability, political opinion, marital status and whether or not a person has dependents. Yet in this House, because of the designation system, my vote does not carry the same weight as a unionist or nationalist. How is this upholding the Code of Conduct? Let's consider the types of decisions that treat my vote of less importance. For example, cross-community voting is used for the election of the Speaker, changes to standing orders, approval of the budget, and any vote subject to the petition of concern. Equal participation in politics enables the advancement of all human rights. It plays a crucial role in the promotion of democracy, the rule of law, social inclusion and economic development. It is essential for reducing inequalities and social conflict. It is also important for empowering individuals and groups and is one of the core elements of human rights-based approaches aimed at eliminating marginalisation and discrimination. Yet in this House, every time a cross-community vote takes place, my vote and the vote of all of us placed into the category of others are not counted with the same value. I ask all unionists and nationalists, is this fair? If you were denied the right to an equal vote because of your political designation, would you be happy or would you challenge the blatant unfairness of the process? I turn now to political stability. By removing designations from the Assembly and how this House works, will create the ability for stability. After an election, parties would negotiate a government as in most other societies, but contentious votes would have to be carried out on a two-thirds majority in order to stop domination of one party by another. Such a majority would effectively guarantee cross-community support and enable all elected politicians to have their vote treated equally. We need to prevent the cycle of crisis that have affected progress in our devolved institution. We also need to deliver fair representation for those 111,000 people who gave their first preference votes for parties that were not unionist or nationalist in 2017. With reference to the joint office of First Minister and Deputy First Minister, we do need to look at that office and how it is elected. Without designations, there is an opportunity to deliver something better and more reflective of the whole community. Some have talked about returning to the original Good Friday Agreement. But while the Good Friday Agreement is preferable to the changes brought in by successive agreements, it was of its time and it is no longer adequate to deal with the changed demographics of who we are today. It does not reflect today's society. Returning to the consocialism of the Good Friday Agreement does not reflect who we are. The agreement didn't foresee the collapse of these institutions. But we should be building on the intention of the Good Friday Agreement, such as building consensus, delivering a fair and equitable government and allowing all of us elected to this place to have an equal say in all decisions. The Good Friday Agreement, the Belfast Agreement states, we acknowledge the substantial differences between our continuing and equally legitimate political aspirations, and that this place should be operated on a cross-community basis. Under the section on safeguards in Part 5, it states, there will be safeguards to ensure that all sections of the community can participate and work together successfully in the operations of these institutions, and that all sections of the community are protected, including either parallel consent or by a weighted majority. If we are to meet the terms of the Good Friday Agreement, then we have to ensure all sections of the community can participate. Alliance acknowledges if we are to take forward changes in time for the next mandate, the UK Government will need to make the alternative changes as soon as AERC have provided their report on the alternative to designations and on the issue of the First Minister and Deputy First Minister. Members, let's make good government. I ask the House to vote for this motion and the Alliance amendment. Thank you.
I now call on Colin McGrath to move amendment number 2.
So moved.
Thank you. The Assembly should note that the amendments are mutually exclusive. So if amendment number 1 is made, the question will not be put on amendment number 2. You'll have 10 minutes to propose amendment number 2 and 5 minutes to wind. All other speakers in this debate will have 5 minutes. And I invite you to open the debate on amendment number 2.
Thank you, Mr Deputy Speaker, and I welcome the opportunity to introduce the SDLP amendment to the motion before us today. These institutions are a delicate system of checks and balances which are necessary because the society which we represent is diverse and divided. It's delicate in its own way. Since the Good Friday Agreement was drafted, a growing number within our community are becoming unhappy with the polarised and divided politics in the north of Ireland. However, it can be somewhat utopian to believe that we simply scrap every guideline or every rule to have a simple majority-based voting system. The bottom line is, if we were to simply operate a majority-based voting system in this place, that same growing number of people who are unhappy at how we do business now would regrettably not be long becoming unhappy at the new way that things would be done. Our politics in the north is akin to a house of cards. It's finely balanced, it's intricate and it's precise. Remove one element of that very structure and we threaten that the whole thing could come crashing down. It was my own colleague and former Deputy First Minister Mark Durkan who once said that there is an ugly scaffolding that supports the institutions here. That is a fair summary, and they were wise words because very few of us like the way that we do business here, but in our heart of hearts, the majority of us know that it is the only way to do business. Now, that is not to say that there are elements that we do that we could change and do differently and refine, but that would be helping us to remove the scaffolding, and I'll expand on that in a little moment. If we look at the motion as it is presented and the amendment, and indeed our own amendment to that motion, I think we need to look at the spirit of them, and they are saying that there is a problem that needs remedied. I do note that the Alliance amendment of the Alliance proposal changes from refers to the committee to welcomes the work initiated by the committee, and I think that that may be to tidy up the fact that the AERC is already engaged in this process, and therefore we do not need to actually refer matters to that committee because it is already considering those matters. However, I do accept that the motion and the amendments allow us today to have a general conversation on these issues. In terms of making a decision in this place, we have several options that are open to us. We have parallel consent, qualified weighted majority, or a simple vote. And it is my understanding that during the significant talks process to construct these institutions, the parallel consent methodology was used, and given that it served the talks process and the construction of these institutions well, it seemed reasonable to use that methodology for making decisions here. It is also worth noting that all parties involved in the construction of these institutions were happy with that method at the time. And given that there are a number of options available, the SDLP is comfortable with AERC exploring them and coming back to us with a report on their findings before the end of the mandate. One element that we have included in our amendment that differs from the substantive motion and the Alliance amendment is that we would like to see the AERC give real consideration to how we appoint the First and Deputy First Minister in this place after an election. We need to press the reset button back to the methodology established as part of the Good Friday Agreement. That methodology was seriously undermined by the St Andrews Agreement. Now, let's be clear. When it comes to the appointment of ministers in this place, it is done by déhont, which is based on the strength of the parties when they return to this place after an election. But prior to St Andrews, the appointment of First Minister and Deputy First Minister was achieved by parallel consent. What was critical is that this place got to decide who was the First and Deputy First Minister. Instead, St Andrews' agreement has reduced that methodology to a crude algorithm. That disenfranchises the representatives that are here in this room. Now, did St Andrews' agreement provide a better method? Well, Mr Deputy Speaker, let's reflect upon the 3-year absence of these institutions recently. Let's ask our nurses who had to take to the streets to demand a pay rise. Let's ask any principal of any school whose funding was dwindling and the capacity to manage their schools was being hamstrung. Let's ask those who were so reliant on who are so reliant on our welfare system, who were facing the ravages of a Tory government because there was nobody here to take the decisions. And let's think for a moment, Mr Deputy Speaker, about our current situation, where we have one party threatening to pull down these institutions. And why? Because they can. We have a system of appointing a First and Deputy First Minister that serves the whims of a single party in this place and not the collective society that we all serve in our communities. The system that we have at present for First and Deputy First Minister results in not just a party having a veto on a choice of minister, but a veto on these entire institutions. For parties that maybe represent less than 25% of the people of this place to hold the other 75%, and by default all of society to ransom, is wholly unacceptable and needs reviewed. If people think that the system that we have at present is perfect, then our amendment is not for you. But if you can look your constituents in the eye and say that dithering, inaction, collapse and stalemate is truly unacceptable, then you have an obligation to support our amendment. Mr Deputy Speaker, there is much about our institutions that are good, and indeed they stand as a testament across the world to how division can be overcome. And yes, there are imperfections, and these may take a lifetime to overcome. But at the SDLP, we are happy that some of those considerations can be reviewed, and therefore we are happy to support the motion, its amendments, and also to offer our amendment to the House.
I call Minister McHugh.
Thank you, Deputy Speaker. I speak today as the Deputy Chairperson of the Assembly and Executive Review Committee. On the 12th of May this year, the ARC agreed its additional priority work topics for the remainder of this Assembly's mandate. Whilst the review of the Statement of Entitlements for an Official Opposition had already been agreed as the Committee's top priority in terms of a full review exercise, the Committee believed that there was value in identifying a number of additional topics that were both complementary to the review and would lend themselves to the preliminary work. Agreement was reached following a consultation exercise with executive ministers, political parties and independent members to gather views on possible work streams for the ARC to progress. The then Chairperson and Deputy Chairperson also met with the First Minister and Deputy First Minister to discuss the various proposals submitted. Now, following much analysis of their responses, the discussion in committee, designation and the appointment of the First Minister and Deputy First Minister was ultimately selected as the ARC's first priority work topic. 2 secondary topics were also selected for preliminary work. And at the outset, it was acknowledged that there was limited time remaining in the mandate to progress this area of work. The committee therefore agreed to carry out scoping work on the topic, resulting in a body of preliminary research and evidence and possible review. Terms of reference for the next ARC to progress. It's possible that recommendations to this effect will be included in the ARC's legacy report. Now, I will make some brief comments on behalf of Sinn Féin. The power sharing arrangements set out in the Good Friday Agreement were necessary to avoid any repeat of the systematic abuse of power by unionism in the decades following the imposition of partition on the people of the island of Ireland 100 years ago. Now, any review of those arrangements must be grounded in a commitment to equality and democracy. Recent comments, very, very recent comments from the two main unionist parties opposite, however, both very, very undemocratic and anti-equality in many respects. Sinn Féin accepted and worked the provisions of the Good Friday Agreement over this past 23 years. And in stark contrast to this position, the UUP and the DUP are now refusing to tell us that they would nominate a Deputy First Minister or if the people decided that Michelle O'Neill will be First Minister. Now let me be absolutely clear about this. You shake your head, but I've heard it in radio, people dancing on the head of a pin whenever they were confronted with that very question. Would you nominate a Deputy Minister? And they refused to do it. So let me be absolutely clear. The people, not any unionist party, will decide who is the First Minister in the next mandate. The days of gerrymandering, of second-class citizenship and unionist domination are over, and they're not coming back. The committee needs to continue to do its work as already set out, rather than reacting or pandering to unionist opposition to a progressive Republican First Minister.
I call Paul Frew.
Thank you, Mr. Deputy Speaker. And again, whilst I've only joined the Assembly and Executive Review Committee, I've only attended one meeting, I think. I certainly see the merit in it, and I certainly see the fact and the potential that I will enjoy a committee like that, because it looks to reform. And I have been saying for many years in this House, and most recently, of course, since we've come back, about the need to reform. About the need to reform how we do things in this House, and the fact that we need to do things better, even on an individual basis, on a collective basis, and the way our systems work. We need to do it better. Because we do feel, or people, with regards to that, when the apparatus is not fit for purpose. One thing I've learned in my time in politics is that democracy is very fragile. But it also has to be agile. And it shouldn't be the case that one party can bring down an assembly. One party can leave an executive or a government and bring down an assembly or a parliament. It just shouldn't be the case, but it is the case that sometimes a government needs to fall if it's not fit for purpose. That's just the agility that democracy should have within its menu. So that doesn't scare me one bit, Mr. Deputy Speaker. I'm all for reform. I am all for the exploration of looking at reform in a collegiate way to try and make things better. I understand, after saying that, of the travel that we have taken and encountered upon. And I know that for some people it's sensitive. Some people it will be the Good Friday Agreement or nothing. For some, they'll cherry pick when a political opportunity arises. And that has been the case in the past, even for the parties who supported the Good Friday Agreement. But we should strive always to deliver positive change to our people. So if we want to deliver positive change to our people, why should then we close our ears and turn our face away from positive change and reform within the Executive and within the Assembly? I speak here knowing that this Assembly has given up its power with regards to the health regulations. And I believe this Assembly should look at getting that power back. Because power shouldn't reside at the executive level. Power should reside at the elected Assembly or Parliament. And that's something I think we should be looking at and concentrating our minds upon. But let me make it very clear, Mr. Deputy Speaker, the DUP is up for reform. In fact, we've been fighting for it for decades. In the 2011 Assembly Election Manifesto, and I will read to put on record, Mr. Deputy Speaker, we the DUP, believe that in the long term, the best means of governing Northern Ireland would involve a voluntary coalition, an executive and weighted majority voting of around 65% in the Assembly, resulting in an end to community designation. This system could provide for both an executive and an official opposition, which would be consistent with normal democratic institutions, while accepting the particular circumstances of Northern Ireland. This should be the long-term goal of all the parties in Northern Ireland. However, we must be realistic about the ability to achieve in the short term. Whilst voluntary coalition would undoubtedly improve the performance of devolution in Northern Ireland, it would be a mistake to assume it is the panacea of all the problems that we face. No, I won't give way just because we haven't. It's the spirit, the proposer of this motion didn't give way, and I feel that that's a bad form, but I think that has to then be consistent throughout. We said this in 2011, and I think we have to improve. We have to look now at what we can do in this short period of time. The problem I see with the reform that we require and the proposer requires is that it's a race against time for this mandate, and there's practical problems around that time appreciation whenever there's so much legislation that we need to pass for the benefit of our people. But that doesn't mean that we shouldn't explore it. And that doesn't mean we should strive to achieve it. So I support reform, and so does this party. Thank you.
I call Robbie Butler.
Deputy Speaker, I rise to speak and affirm my support for these institutions. I am a devolutionist, and I voted for the Good Friday Agreement along with over 71% of the people of Northern Ireland and over 94% of the people in the Republic. I believe that these institutions, when working correctly, are the best vehicle for delivering for the people of Northern Ireland. The Good Friday Agreement set the foundation for a new and inclusive Northern Ireland where people from all backgrounds and identities could feel safe and have their identity and rights of self-expression protected. As key architects of the Good Friday Agreement, the UUP is proud of the peace which it delivered and the effective cessation of others trying to achieve political aims through violence and terrorism. The foundation set out by the Good Friday Agreement was legislated as the Northern Ireland Act 1998, which is not a sacred cow, nor is it a holy text. It is merely legislation that can and has been amended from time to time. We have shown our appetite to explore change to the Northern Ireland Act where the changes are productive, where they're positive, and where there is meaningful benefit. We are adamant that the petition of concern mechanism does need to be reformed, given the excessive use of it in previous mandates. We also demonstrated our appetite to change things in this chamber by forming the first ever opposition along with the SDLP in the previous mandate. And if I just lean back a little bit into the negotiations in and around New Decade, New Approach, we established with the SDLP and the Alliance Party, we constructed an alternative suggestion which only elements of it made it to NDNA, but the full working document didn't make it into the text, which is, I suppose, regrettable. This motion asks for consideration of the cross-community support mechanism, and whilst removing the need for designations completely as the proposer wants it, it is potentially not the best solution, but certainly is something to be looked at and to be considered further. I would add a word of caution in that the cross-community support mechanism, as laid out and its intention in the Northern Ireland Act, and it is threaded through the entire Act, was put in place to protect minority voices within this chamber, and that may not have been what happened at times, but it is the intent that it was there. So in terms of when we're reflecting on it and speaking about it, I think we need to be fair to those who authored it, and that the intent was good. Any tampering of this mechanism must be done very carefully, with acute cognizance of respecting and protecting people's identities. Ms Armstrong's amendment, in her own words, does raise a few questions in my mind, to be fair, not least the fact that it's not materially dissimilar to the original motion. For instance, if we could get some clarity on the statement that says that votes designated as others are not treated equally, and just since we've returned under New Decade, New Approach, I don't think there's been any instance where that has been the case. So the clarity would be there had been no petitions of concern or no cross-community voting in that time. After, you can come back to it maybe in the wind, if that's okay. Furthermore, calling for the Government to amend the Northern Ireland Act accordingly before the AERC report is started is perhaps presumptuous, which is picked up in the amendment, if you could speak to that in the wind. The report may find that the mechanisms we currently have may be better than any alternative suggested. Finally, the suggestion that political designations perpetuate division needs clarified in regard to that, if that's possible. And just to reference Mr. Melissa, the Deputy Chair of AERC, in terms of the Ulster Unionist position, this is not just our ambition to replace the Democratic Unionist Party as the biggest party, but it's our ambition to be the biggest party in this chamber, and that is why we'll be competing for First Minister.
Order, members. The Business Committee is arranged to meet at 1 p.m. And therefore I propose, by leave of the Assembly, to suspend the sitting until 2 p.m. The first item of business when we return will be questions to the Minister for Health and then questions to the Minister for Communities. After question time, we'll return to this debate, where the next speaker scheduled to speak is John O'Dowd. The sitting is, by leave, suspended.
This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed.
Okay, members. Okay, folks. The sitting is resumed. Members, it's time for questions to the Minister of Health. Questions 5, 8 and 11 have been withdrawn. Sinead Bradley is not on her place, so I call Padraig Delargy.
Can I ask the Minister for Health for an update on the HSE staff recognition payment for those working in the independent sector?
Sorry, you just need to put the number.
Sorry. Question 3.
And I thank the member for his question. Mr Speaker, members will be aware that earlier this year I announced a special recognition payment of £500 and that will be made to Northern Ireland's health and social care workers. Payments to the statutory sector employees commenced in July, but unlike the statutory sector payments whereby my officials were working with a small number of employers, the independent sector has a much larger employer base. In addition, workers within the independent sector are much more transient than the statutory sector, and developing a set of standardised eligibility criteria has proven to be more challenging than first initiated and thought. Likewise, the development of a payment mechanism, particularly in circumstances where an employee has moved between providers or has moved out of the sector completely, has proven problematic. I met again with my officials last week to get a full update on the latest progress and to emphasise the need to see the payments processed as quickly as possible. Officials have in recent days had further detailed discussions with trusts, the Health and Social Care Board and BSO in relation to the delivery and accountability mechanisms of the recognition payment to the independent sector, and I am glad to report that work has now almost completed. My officials have also held recent discussions with a number of major care home and domiciliary providers and the voluntary sector providers to ensure that the proposed delivery mechanisms are workable, deliverable, accountable and auditable. The engagement with the sectors has been very positive and we will continue to work closely with all involved. The recognition payments will be paid to the independent sector staff as soon as possible.
Supplementary, Padraig Delargy.
Yeah, Minister, thanks for that. And you've pretty much answered my supplementary already, but I did want to make sure that all agencies had been contacted. I've been contacted by quite a few people in my constituency who weren't sure who contact hadn't been made with, so could you just confirm if all agencies have been contacted at this point, please?
And I thank the member for his point. In regards to the sections that are left, we have been engaged with Community Pharmacy, the British Dental Association, Optometry A&I, British Medical Association, a number of the major care home and domiciliary care providers at this moment in time. We have a small pilot out in regards to the documentation that we intend to use, and we hope to have feedback from those initial sectors and those initial groups that we've engaged with by the end of this week to make sure that the documentation is workable for them, but also provides us with the information that we need as well.
Colin McGrath.
Mr. Speaker. Mr. Speaker, I appreciate that absolutely everything has to be done correctly and by the book, but this announcement was made back in January. Staff are contacting MLAs almost on a weekly basis because they've been promised this £500, and we today don't even have a date as to when this is going to happen. Can the Minister please give us some indication of when this payment is going to be made? Because I know that many of my constituency were hoping to have it for Christmas.
As I've already said in the initial answer, it is proving more challenging, especially for the independent sector, than we initially thought because of the large number of employers. But we need to make sure, I think as the members indicated, that we will have to be sure that this is public money and it is spent, is accountable and it is audible as well. It is taking longer in this section than this sector of the employee and the workforce than we had initially anticipated. But I will say in the first tranche, and I know when we announced this payment there was also additional requests then made and subsequent requests made to make sure it wasn't taxable. So we went back to ask for more money as well. That was provided by the executive. There was also a number of requests and cheques made by trade unions and other organisations that any payment made would not have a knock-on effect on to benefit payments in regards to what is especially a low-paid female workforce as well. So all that took time even before we got the initial payments out to the health and social care sector, which was a very small employer base that we were able to work with. We're pushing on as hard as we can to get this payment out as soon as possible. And I know the member has a number of AQs. I want to reassure him that the money is there for it. It's not a case of that this has been delayed deliberately in any space. We want this money out as well.
Well, Mike Nesbitt.
The Minister confirmed that his officials with responsibility for other recipients of the payment, including primary care, pharmacy, dental and ophthalmology, are fully linked in and working to deliver the payment ASAP.
And I thank the member for the point. I think in response to the initial question I made, that we are engaging and we have engaged. I met with officials again last week to make sure that they were fully plugged into everything that needed to be done to make sure this payment gets out there. And as I said, in a previous statement there, that this payment is taxable. So we need to make sure also that anybody who receives, any employer that receives this money, is making sure that the majority of it, if not all of it, in regards to how it actually gets to those it is meant to be for, and it doesn't stay in the employer's bank account for any time or any period longer than it actually has to.
Paula Bradshaw.
Minister, can you confirm whether those working in independent hospitals who were commissioned to deliver, for example, diagnostic or elective care surgery, whether they will be eligible? Thank you.
I thank the member, and I think that's covered in our FAQ on the special recognition payment, which includes eligibility criteria. As set out in that FAQ that is online, those who meet the qualifying criteria are eligible for the payment. In this case, at least 1 month's continual service in the independent sector in Northern Ireland between the 17th of March and the 31st of January is required. Former independent sector NI staff who retired between that period are eligible, providing they meet the qualifying criteria. In regards to the specific work group that the member's inquiring about, we have to make sure that those individuals who are also working in that sector are not also trust employees as well, so that it's only a single payment they receive. But I'll get clarity for the member on that cohort.
Earlier, Patsy McGlone. Call Patsy McGlone.
Good evening, John Corley, Cash 3, question number 3.
And I thank the member. Trusts have developed and implemented dementia services recovery plans, which have ensured continued access to a range of services during the COVID-19 pandemic, using technology and other innovative approaches to ensure arrangements are in place to access diagnostic, condition management and support services to both service users and carers. As a direct result of the COVID-19 pandemic and the increased vulnerability of many within that patient cohort, there has been a reduction in the numbers of patients facing memory clinics, which has had a direct adverse impact on waiting time. Virtual clinics have been trialled for a subset of individuals, and this option is being kept under review. The rollout of the regional dementia care pathway will contribute significantly to raising standards across all trusts and that includes addressing delays in dementia diagnosis. A regional steering group has been established to have the oversight of implementation across all 5 trust areas and to ensure there is a consistency of approach and shared learning. That work is supported by a regional stakeholder reference group and an integrated care partnership-led locally implementation groups, which are multi-agency and also include people living with dementia and their carers. The expectation is that the pathway will be rolled out across all areas, subject to the availability of the necessary funding, which the member will be aware will be significant.
Supplementary, Patsy McGlone.
I thank the Minister for his answer. Just referring to a previous response that the Minister made in reply to an AQW from my colleague, Cara Hunter, it showed there's great disparity in waiting times between trust areas. What can his department do to rectify those big disparities between various trusts?
And I thank the member for that point, and that's why I was specifically referenced the dementia care pathway, which is about making sure there is that continuity across all trust areas. That includes a regional steering group as well, so that we can bring members from all trusts into the one place, so they can learn from each other to ensure that there is that consistency approach. That work, as I said, is also being supported by a regional stakeholder reference group, which includes those with dementia, their carers and those with lived experience. So it's something that we've been able to utilise during the pandemic, but we've also seen how that can ensure there will be a consistency of approach across Northern Ireland, which, as the member is well aware, is geographically a very small footprint when it comes to these levels of services.
Call Sinead Ennis.
Dementia is an awful, cruel illness, as we all know, and as the Minister's outlined, there are measures to help, and the regional dementia care pathway is one, but so is supporting those with dementia who are in the community. So I just want to ask the Minister, what can your department do to support dementia-friendly communities?
And I thank the member, and as she will know, the regional dementia strategy, which was actually developed as far back in 2011, addressed a wide range of issues, and that drew on best practice here and elsewhere. That strategy made recommendations aimed at improving the services and support arrangements. To date, we've implemented a significant number of programmes to improve services provided to and the experience of those living with dementia. In 2016, the Delivering Social Change Dementia Programme Phase 1, Still Me, was launched. That programme included a package of dementia projects, and at that point there was funding of £6.25 million. My department has also previously provided funding to support the rollout of actions from the Delivering Social Change Dementia Programme. That's included 10 dementia service improvement leads, 10 dementia navigators and 44 dementia companions. So there has been work already been done in the community, and that's part of the reform of the adult social care system, that new strategy that will bring forward as well.
Nicole George Robinson.
Mr. Speaker. I thank the member for his question. The JCVI has advised that the groups 1 to 9 prioritised in Phase 1 of the COVID-19 vaccination programme should be offered a booster dose of the COVID-19 vaccine. JCVI advice states that the COVID-19 booster vaccine dose should be offered no earlier than 6 months after completion of the primary vaccine courses, and that's the full 2 doses. The 6-month interval between completing the primary course and the booster dose will drive the timeline actually for eligibility and delivery. The various health and social care trusts began booster vaccination programmes in care homes in the week commencing the 20th of September, and trusts have also begun further vaccination of frontline health and social care staff in line with JCVI guidance. As of midday today, 29,836 booster doses have been delivered, as well as 4,123 third doses. GPs will shortly begin calling their patients who received their second dose 6 or more months ago, with 220 community pharmacies across Northern Ireland starting the booster programme with frontline healthcare staff who are not directly employed by a trust. And it is hoped that the majority of eligible people will have received their booster by the end of this year.
George Robinson, supplementary.
Thank the Minister for his answers. Can the Minister give me an assurance that there will be a sufficient supply of booster vaccines available, as concerns have been expressed to me by health professionals and constituents in my area that there may be a shortfall?
I can assure the member there's no shortfall of booster doses vaccines that will be available. The criteria that we're currently work for may seem more stringent than we first used, because we're going back to those first 9 priority groups rather than the mass vaccination programmes we've seen. But we're also working on the 6-month timeline, so when we were seeing those small numbers coming forward in the initial vaccine programme, it is now they that are eligible for the 3rd dose as well. So I can give the member that assurance that we haven't concerns in regards to supply of vaccines for booster doses.
Well, Kelly Armstrong.
Thank you, Mr Speaker. Thank you, Minister. Minister, can you confirm when 16 and 17-year-olds will be offered a 2nd dose, given this is clearly recommended for the Delta variant, and parents are telling me that they cannot access COVID certificates without a 2nd dose?
I thank the member. 16s and 17-year-olds, as the member is aware, has been offered the 1st dose, and I would encourage all those who are eligible to come forward at this minute in time. With 50% of those who are eligible and actually have come forward and received their 1st dose. JCVI are currently monitoring the implementation of a 2nd dose, and once we receive that guidance from them, whether it's necessary to proceed and when it's necessary to proceed, we will do so. There should be no delay or challenge in regards to that age group if they've received 1 dose and actually accessing proof of vaccination as well, but I'll clarify that with the member too. What I will say as well in regards to that certification, many countries don't require it for under 18s, so it may be worth checking as well whether that's actually necessary at this minute in time.
Call Aisling Riley.
Minister, considering that the flu and the COVID-19 vaccination programmes are happening at the same time, can you provide assurance that staffing requirements for these programmes won't take away from the delivery of the already heavily under pressure GP services?
And again, I thank the member for raising what is a very critical point, and I welcome her to her place. I will say what we actually experienced last year, Mr Speaker, in regards to the rollout of the flu vaccine programme, we saw a massive uptake as actually how GPs delivered it. We've seen it actually over the weekend, where GPs have taken over, multi-storey car parks, and they're delivering up to 1,200 flu vaccines in one day in one sitting as well. So we've seen a change in how that has been approached, that we're actually seeing those mass vaccination programmes rolling out at GP level as well. I would have liked to have been in a place where we were delivering flu and COVID booster at the same time concurrently, and we could have made use of that efficiency as well. But we're not in the place, as regards to, in the answer to Mr Robson, we're not in the place where we have those same large numbers coming forward for the booster dose. So we've went ahead and started the flu vaccine programme because we are aware of the benefit that comes from that. And again, I would encourage anyone who's not just eligible for the COVID booster to come forward and get it, or the 1st dose or their 2nd dose, but also anyone who is now eligible for the flu vaccine to make sure they come forward and get it as well, because those criteria have also been expanded as well.
Alan Chambers.
I welcome the continued and very important role that community pharmacy is playing in the booster programme. Is the Minister satisfied that with so many community pharmacies engaged, over 200 I believe, that the booster still remains a very accessible service right across Northern Ireland?
And I thank the member for that very specific point. And I think, as I said in the initial answer, over 220 community pharmacies have come forward in regards to being able to supply and deliver the COVID booster programme, which is about half of the community pharmacies across Northern Ireland. So that ineligible leaves it very accessible for the majority of people in Northern Ireland actually to go to their local community pharmacy and receive that booster dose. And what I will say to the member as well, over the past 18 months, we've seen a real partnership approach in the working of not just the department and community pharmacy, but also community pharmacy linking in with primary and secondary care and supporting what has been a very challenging time across the entirety of our health family. So again, I want to place on record my thanks to community pharmacy for delivering what is the next phase of our vaccination programme, and that is the delivery of the booster vaccine, but also them also delivering the flu vaccination as well.
Palm Cameron.
I thank the Minister for his answers so far. Minister, could you maybe update us on where the schools vaccination rollout programme is at the moment for the over 12s?
I thank the member for that point as well. Our school programme should be commencing within the next number of weeks. We already have commenced actually vaccinating in the special schools as well, because of the criteria that was laid out by JCVI in regards to those eligible cohorts as well, and those more vulnerable cohorts. So that piece of work is ongoing and will commence. And as previously advised, those eligible cohorts and the eligible group to 12 to 15-year-old are able to receive their vaccines because of the expanded advice that was actually given from JCVI, which was supplemented then further by the advice that we received from all 4 CMOs. So, as previously advised, persons aged 12 to 15 with specific underlying health conditions that have put them at risk have been offered 2 doses of the Pfizer BNT162b2 vaccine, and the original group included children with severe, as the member was aware, neurodisabilities, Down syndromes and underlying conditions. That age cohort has already started to be vaccinated, but our main school programme will be commencing within the next week as well, using our school vaccination teams. And I would encourage parents who have children eligible in that age group to make sure they get their children brought forward to complete the appropriate documentation and get their children vaccinated as regarded to CMO and JCVI guidance.
Sinead Annis.
I thank the member for her questions. There is clear evidence that our unscheduled care system has been under increasing pressure over the past number of years. These pressures are most clearly seen at our emergency departments, which act as a bottleneck for all patients who are unable to access the care they require. The significant challenges facing our elective care, cancer and mental health services are increasingly leading to patients presenting at emergency departments as their conditions worsen, and that leads to the need for urgent care. Many patients are also presenting with more advanced or complex needs, particularly those with chronic disease. And the impact of the pandemic, together with the wider systemic pressures that we are facing, has led to a situation where each of the major emergency departments across Northern Ireland are now operating significantly above capacity. The Health and Social Care Board is currently working collaboratively with the Public Health Agency, Northern Ireland Ambulance Service and the 5 provider trusts to improve waiting times at our emergency departments. That's by enhancing flows through the system and to facilitate timely discharge. An audit of our emergency departments' patients' pathways will be conducted to better understand and address issues for patients. My department has undertaken a review of urgent and emergency care. That will be published shortly and will be taken forward in an elective care framework, and is investing in what has already been done in the No More Silos action plan. So the expansion of evidence-based ambulatory emergency care and rapid access services will also help to mitigate some of the pressures on urgent and emergency care created by long elective care waiting times. Each of these initiatives will help to reduce waiting times by improving hospital capacity and flow and developing services that enable patients to be discharged once medically fit. However, I would reiterate that the issues that we are currently seeing in our emergency departments cannot be resolved by one-off non-recurrent funding. What is needed is recurrent investment over a number of years to bring forward meaningful change.
Supplementary, Sinead Annis.
And I thank the Minister for that response. Minister, in recent months we've heard shocking accounts of lengthy waits and lack of seating and other resources in various emergency departments, and clearly people waiting lengthy periods to be seen need at the very least to have somewhere to sit, and they need to have access to refreshment. So can I ask the Minister, what steps has the department taken to ensure that those waiting lengthy times to be seen in emergency departments don't have to sit on the floor?
And I thank the member for that point. Our patients waiting shouldn't have to sit on the floor. It would be unacceptable for them to do that. But we have the challenges as well, where our waiting rooms in our emergency departments are also still maintaining social distancing measures, as is the same footprint across all our health and social care facilities. So it does put additional strains on the footprint that they're actually using. I am aware a number of our hospitals where we have our main emergency departments have increased that waiting area by the utilisation of additional facilities, and I'm thinking of Altnagilvin in particular in regards to the additional working capacity that was actually put in place there to make sure that that didn't happen.
Paul Thomas Buchanan.
Mr Speaker, Minister, I've listened to a number of initiatives that's going forward on this particular issue, but is the department doing any work with our GP surgeries in order to try and get them opened up so that we can get face-to-face appointments again with our GPs? Because a number of constituents who are in contact with our office can't get a face-to-face appointment, and therefore they're going to the A&E to be seen there. And I think that would help to free up the A&E departments if we could get the GPs opened up again.
The member for that point, it's important that people can access GP services when they need to do so. GP practices are open and will continue to provide both face-to-face appointments and alternative consultation options for patients as appropriate. Even prior to the COVID pandemic, primary care services were coming under increasing pressure. For the week of the 8th of October, the average number of patients actually presenting to primary care were 99 in regards to 1,000 of the population. So nearly 1 in every 100 of the population in Northern Ireland was presenting to a GP to be seen or to be triaged as well. So there is considerable work being done within our GP practices, general practice telephone first consultations as well, and that allows patients to seek timely medical advice from their GP. And it's the GP who decides how best to meet the need of the patient. Where a face-to-face appointment is appropriate, that will be arranged. The member will also be aware that I've invested recently or announced the investment of £5.5 million in regards to our GPs to support them over what will be a challenging number of months, because as we've seen, as I said earlier, in regards to community pharmacy, we've also seen a greater collaboration working between primary and secondary care, and I think something we should build on and work to actually deliver that one system health approach in Northern Ireland that actually serves all our patients.
Call Roy Beggs.
Mr Speaker, it's also important that there is an effective GP out-of-hours service to prevent people presenting at the accident and emergency centres. So can the Minister provide an update on the efforts to stabilise our GP out-of-hours service?
And again, I thank the member for the point, because I think it also highlights that it is one health service trying to support all patients, no matter where they present or how they present. And I'm aware of the continuing pressures faced by GP out-of-hours service across Northern Ireland, and that's with the demand and the increase in difficulties actually filling GP shifts. An effective out-of-hours service is a priority for me and my department, and we continue to work closely with the Health and Social Care Board on the out-of-hours providers to address the current challenges. Service improvements continue to be introduced. That includes adjusting the skill mix of clinicians, increasing levels of nurse triage provision, employing more nurse practitioners, paramedics and pharmacists, and increasing the flexibility in shift times. My departments also continue to work closely with the Health and Social Care Board on out-of-hours providers and key stakeholders to address the current challenges in out-of-hours services across Northern Ireland, and to redesign out-of-hours services, and that is aligned with No More Silos, which was the project taken forward as to how we actually improve and start to fix our emergency departments and how people present to them and where they present. And that aim is to have a more stable, sustainable and integrated service that will better meet the needs of the population, and that includes consideration of a regional model for delivery of the service as well.
Well, Mark Durgan.
Despite the recent investment in Altnagalvin that the Minister referred to in the earlier answer, the emergency department there still isn't fit for purpose in this day and age. There isn't sufficient space to deal with the volume of patients, nor an adequate layout to deal with the vulnerability of patients, and it's making life even more difficult for the great staff team there. Is the Minister aware of any further plans that the department has to invest more in Altnagalvin Emergency Department?
The member will be well aware of the financial pressures on my department, not just in single-year resource budgeting, but also in the capital improvement that we need to do. We've been underinvested, not only in that resource side, but also the capital side for more than the last 10 years. So there's a lot of work that needs to be done across our footprint. I think it's valued at £1.2 billion. The last time I looked, with 600 million worth of essential maintenance currently outstanding, and that's before we get to some of the critical investment in our capital footprint that we need to do. So the steps that we took in increasing the waiting area at Altnagalvin more than a year ago now was necessary at that point. So there's a continuing brief in regards to, and a continuing watching brief in regards to what can be done with the resource that we provided to make sure that we are delivering for patients. But we do need a longer term investment in not just our workforce but also our capital structures as well.
Call Matthew O'Toole, and the member may not get a supplementary.
Question 7, Mr Speaker.
I think that the member for his question, and I recognise that the subject of continuing healthcare continues to attract significant public interest both in Northern Ireland and in other jurisdictions. As members will be aware, the policy of continuing healthcare was updated as of February this year with the aim of creating a fairer system where all individuals needing to avail of residential or nursing home care services will be subject to the same charging policy. This followed a public consultation which was undertaken in 2017. The new policy of a single eligibility criteria question is the same criteria as has been adopted in Scotland, a clear benchmark by which to assess if someone's principal needs can be met outside of a hospital setting, whether that be for social care or health care. In regard to the provision of continuing healthcare assessments, Circular Care Management Provision of Services and Charging Guidance was introduced on the 11th of March 2010. This outlined the responsibility of health and social care trusts to ensure that appropriate assessments of needs for individuals are carried out, and that includes those with continuing healthcare needs. In light of the new policy, it remains the responsibility of trusts, as outlined in the aforementioned circular, to ensure that assessments are carried out as appropriate.
I have a very brief supplementary, please.
Mr Speaker, in February this year, Minister, you said that single eligibility criteria, that single eligibility question would be implemented. Is it being implemented now? Because this is clearly one of the crises on our wards. People are backed up and aren't able to get home, even when the care assessment says that they should be.
And I think the member, my department has set up a working group, and that involves the key stakeholders to develop guidance to underpin that new policy, and that will ensure there's clear information available on how the new single eligibility question will operate. That group's made up of representatives from the trusts, the Health and Social Care Board, Department of Health, and also stakeholder representation from AGNI. Work is progressing on the development of that guidance, with 2 meetings having taken place to date, and I expect that working group to report in the coming weeks.
That ends the period for a list of questions, and I call Tom Buchanan.
Thank you, Mr Speaker. Minister, 2 weeks ago the report was published into the mother and baby institutions, modelling laundries and workhouses in Northern Ireland. It recommended the funding of comprehensive support services for victims and survivors for the duration of the investigation process and in the longer term. Can you then give us an update as to what funding will be made available to the victims and survivors services for the delivery of these services?
I thank the member for his point, and again it was a very emotive, important piece of work that the executive took forward. I met the commissioning group who completed the report with the First and Deputy First Minister on the evening of its publication, and their very clear ask was that that work be prioritised. There's a report now from the working group, cross-departmental working group, to be brought to the executive as per the recommendations of next steps. I am aware one of the recommendations coming out from the working group was the TEO lead on this, such as the recognition that the women and the survivors of these homes deserve, but also the cross-cutting nature that it will see across all executive departments having a responsibility, and also, I think rightly so, the executive of Northern Ireland playing their part in acknowledging the hurt and pain that was caused to those women and their children.
Supplementary, Tom Buchanan.
Thank you, and I thank the Minister for his response. But Minister, can you give us any indication of a timeline as to when the monies will be available to deliver these services to these people?
And I thank the member for his report, or for his supplementary in regards to that. Again, the recommendation from the working group has to come to the executive. It's a TEO, Department of Health cross-department piece of work that has been taken forward. One of the recommendations from the working group was the TEO should lead on the implementation of actually acknowledging the victims and the women who were so badly treated, but also bringing forward the payments, as well as they have done in the historical institutional abuse system as well. So there is that continuity of understanding and of recognition that they are treated equitably and fairly, as has been done in other cases.
Dolores Kelly.
Thank you, Mr. Speaker. Could I have an update, Minister, on Bandside medical practice in Portadown?
And again, I thank the member, because I know this is something she has taken a keen interest in her constituency, and I recognise that this has been an unsettling time for patients of Bandview and has been particularly difficult during the wider uncertainty created by the pandemic. I would like to thank them for their patience and ongoing support for the practice and its staff as the Health and Social Care Board worked to secure a new contractor for the practice. I'm delighted that the Federation support units, acting on behalf of GP federations across Northern Ireland, took over the contract from the 1st of September 2020 and now provide general medical services to the patients that were of the former Bandview medical practice list. The practice is now known as Beechwood Family Practice. This is the first time in Northern Ireland that general medical services are being provided by GP federations. And in August, the Health and Social Care Board and the Federation support units wrote to the patients of the former Bandview medical practice to make them aware of those new arrangements. The practice has a new medical team in place and a new practice manager in post. The Health and Social Care Board is currently arranging to meet the Beechwood Family Practice to ensure that they have the appropriate ongoing support to ensure the success and ongoing delivery of that practice.
Supplementary, Dolores Kelly.
Thank you, Mr. Speaker, and I thank the Minister for his keen interest in this practice, because it has been on a matter of controversy for over 5 years, and under his tenure, at long last, we have got a solution. I'm not very optimistic in the answer to this question, but there's increasing accommodation needs in Portadown Health Centre in general, and obviously with return and of hopefully face-to-face GP practice and multidisciplinary teams being rolled out, it'll be a greater problem. So I just wonder, is that at all on his plan over the next year or two?
I don't have the Capital Works budget plan with me, but I'll write to the member in regards to that. But it is also worth, I think, repeating, Mr. Speaker, in regards to the new setup that Bandview has actually seen with the GP Federation support unit actually coming forward and taking on this practice to make sure there is a continuity of support for the patients there as well. But in regards to the capital bill, I'll write to the member with that detail.
Call Diane Dodds.
Mr. Speaker, and thank you to the Health Minister for his answers. Mr. Speaker, people living with a tracheotomy can access public transport. They can travel on buses and trains across Northern Ireland. But I have a young constituent who has severe health and learning difficulties. And the Education Authority are using her trachea as an excuse not to transport her to school. Can you tell the House what advice the PHA has given to the Education Authority on this particular issue that allows them to discriminate against my young constituent and deny her an education?
I thank the member for raising what is a very sensitive issue with me today. I don't have the answer with me, as the member may be aware, because it is a very specific constituent matter. I will write to her or meet her in regards to this issue, in regards to what steps need to be taken to either come to a solution, an equitable solution, to ensure that her constituent is not discriminated against in regards to accessing either transport, should it be through the education system, or public transport as well. It's not an issue that has been raised with me before, but I thank the member for bringing it to my attention.
Thank you.
Ms. Dodds, supplementary.
Yes, thank you. Sorry, another COVID-related issue. As you imagine and as you know, there is a multiplicity of them in every constituency office. But I had occasion to attend a family funeral at the weekend, and the funeral undertaker in Lurgan approached me because he's very concerned at the massive mental health issues that are being built up in our community, because loved ones cannot attend and be at the bedside of those who are at end-of-life care. This varies across access and visiting varies across trusts and varies across trust residential and care facilities. Can the Minister tell the House what he is doing to bring some resolution to this particular issue? and allow families to have time with their loved ones in a very, very difficult and emotional time in their lives.
And again, I think the member she will be aware that there is guidance that came from the department to all trusts to make sure there was a standardised approach across all trusts. I'm aware that there has been some deviation from that, but I will advise the member that in regards to the publication that we put out as Visiting with Care, a pathway which was actually published on the 7th of May, it's available on the department's website, and that pathway provides a staged approach to restrictions that apply to visiting in care homes and other facilities. I will inform the member and inform the House on receiving further advice around how residents with capacity may be facilitated and also supported in regards to visiting in other facilities. I have agreed through recommendation and further advice from the Chief Nursing Officer, I have agreed to the implementation of the recommendation that we move to the next step in gradual easing, and that will take place from tomorrow, the 20th of October. And again, the pathway will be reviewed in mid-November, and our public health officials will further review the data and recommend further progress on the pathway if merited, and further the potential for additional easements over the 2021 festive period for visiting will also be considered.
Colin McGrath.
Mr. Speaker, we heard today harrowing news about the numbers of young people who are waiting for a first appointment with a consultant. Would the Minister agree with me that we are failing our children?
I'll agree with the member that we're failing most of society in Northern Ireland in regards to our waiting lists. Today's report by Nicky, which my officials have been engaged with in its publication and its production, was really about highlighting, and I think it does highlight, the challenges across the entirety of our health and social care system in regards to how we're letting down a large number of patients. I've said it before, from this place and in other places, that more needs to be done. We need more recurrent investment. We need support of our staff currently there. We're now paying the price of 10 years of underfunding as well. But I will, and I'll say to the member that in regards to the recommendations, we'll work with the Commissioner for Children and Young People in regards to the recommendations that she has made. But there's also a large amount of work that has already been undertaken through different avenues to address some of the needs that have already been highlighted in the Commissioner's report.
Supplementary, Colin McGrath.
Mr. Speaker, the report and the media reports today have referred to 24 young people that have been waiting a year with a red flag diagnosis with cancer. That must be some of the most distressing time for parents, children and families. Would the Minister undertake that today, or at latest tomorrow, if there are children with a red flag case of suspected cancer, that they will see a specialist in the next 24 to 48 hours?
And I think the member have already asked all trusts to review those waiting times to make sure that there is an accuracy to what has been reported in the timeline of where the information may have been supplied to the Commissioner and where we currently are today, because current information coming from at least one of our trusts would show that there are no children waiting, and that's within the Belfast Trust area. But I want to seek that reassurance from across all our other trusts as well. What I will say to the member in regards to Children's Cancer Services specifically, the current cancer strategy, which is out for consultation, has a large section in regards to how we look after children with cancer in regards to the numbers that are present in Northern Ireland, but also teenage and young adults who are now transitioning from children's service into adult service and how they are also supported as well. So I would encourage the member, his party and all those who are concerned in regards to this, get involved in the consultation response to make sure that it is fit for purpose, that it meets the needs of all those across Northern Ireland. One of the first events I attended as Minister was actually one of the public consultations in regards to the development of the strategy before it went out for consultation. And what was very clear that day was the voice of young people, and they made it loud and clear that they felt their voice wasn't in the consultation, and that's why they are there now, because it is an important cohort that we have to support, not just those children who are going through treatment or have received a diagnosis, but also their parents and those who care for them as well.
Call Kelly Armstrong.
Thank you, Mr Speaker, for letting me in. Thank you, Minister. Minister, I recently met with Arts Community Network, who are delivering a programme on behalf of the PHA. The PHA's equality and monitoring forms took that group 37 hours to fill out online. I'm just wondering, is there a way that the Minister could review those monitoring forms to ensure that they're efficient?
I'll ask PHA to review those forms and how accessible they are, but I'm sure the member will also be aware some of those equality questioning forms are also crucial in regards to the monitoring and the work that we do, as well as a department, to make sure that we are meeting the obligations that are on us as well, and the PHA will be undertaking those same duty of care obligations as well. So I'm unaware of the specific forms that the member is referring to, but I'll ask PHA to have a look at them to see if there's any way they could be simplified as possible. I'll not give a commitment that they can be because of the information that they probably are collecting.
Supplementary, Kelly Armstrong.
I'll try to be very quick. The forms do ask for anecdotal evidence, and that's what's taken so long. But the problem with the forms also is when they asked people who are disabled who are attending the course for development how disabled they are, it's quite a negative way forward, and it's if we could review that to treat it more positively.
No, and I thank the member for that, because the multitude of forms that are out there, and the member's fully aware of that. Language is important, and especially when we're dealing with applications from groups who are applying to what are very challenging rules, challenging funding schemes, and if it is about equality questions, they should be appropriately phrased in regards to that. But I thank the member for again drawing that to my attention.
Members, time's up. Can members please take your ease for a moment or two?
Order, members. Members resume their seats. We now move on to the rescheduled questions to the Minister for Communities, and I call Dolores Kelly.
Speaker, question 1, Minister.
Thanks very much. And again, apologies about last week. It's just really the Department for Work and Pensions administer the winter fuel payment scheme on behalf of my department. Given the difficulties last year, I instructed my officials to seek the necessary assurances that there will be no reoccurrence of the delays experienced last year on this year's payments. The delays experienced in issuing payments last year were linked to a new DWP IT system, which was used for the first time to make the winter fuel payments. DWP officials have advised that a number of enhancements have been made since then to the system and will ensure that payments will be made promptly to those qualifying claimants. Most winter fuel payments will be automatically paid to qualifying claimants during November and December, with all payments being made by the 14th of January 2022.
I call Dolores Kelly for supplementary.
Thank you, Deputy Speaker. I thank the Minister for that reassurance. But does the Minister share my concern about the rising cost of fuel itself? Week on and week in, we're seeing a rise of £30 plus. So I just wonder, in terms of a support scheme for particularly vulnerable people, has the Minister considered establishing such a support scheme in light of the rising costs of fuel?
Yeah, well, the member will know that I introduced an additional heating payment scheme last year, so an additional payment That was at a cost of £45 million, and obviously under the COVID recovery monies. We are obviously in the midst as well of a reduction, as people will know, in the universal credit, £20 increase, which sees almost £110 million being reduced as well as part of that. Obviously, the Westminster Government, in the midst of this reduction ahead of the Tory Party conference, has announced 500 million. But in effect, in terms of Barna consequentials for here, in terms of cost of living difficulties, only amounts to around £14 million. Of course, I will be making the bid, and I feel that that full amount of money should be coming to my department in order to alleviate pressures over the winter period. So we're currently in discussions with the utilities regulator, with those in the sector who support families, to look at what we can do this winter to create those additional supports. That's on top of the discretionary support schemes and also the affordable warmth and other schemes that we do around fuel poverty. And again, of course, we want to look at more because of those sharp increases in fuel costs and because of the reductions around universal credit and other pressures.
I call Kelly Armstrong.
Thank you, Deputy Speaker. Minister, thank you very much for your answers so far, and I'm glad to hear that you're working on that. But given the pressure on homes as a result of the financial crisis, are you working with the community and voluntary sector to ensure support for oil clubs, for instance, are promoted to winter fuel recipients, or that the Consumer Council's price checker comparison information is available offline, for example, in libraries?
Well, we've been doing very good work with the community and voluntary sector throughout the pandemic, and we're continuing to do that. I had established the Emergencies Leadership Group, which involves the sectors at the grassroots and also at a regional level across the north, and we're continuing to meet to look at these issues. I have recently, through the Community Support Programme, which is funding that goes out to local councils, that also supports the independent advice sector and those particularly that deal with debt advice and those who are in financial difficulties. And as recently within the last week, I have increased the support of an additional £3 million going into the Community Support Programme. As I've said, that I will be making the bid for the full £14 million once it's confirmed. We haven't got that confirmation yet from Westminster, but once it is, and obviously I'm already trying to look at a scheme now in terms of having that rolled out as quickly as possible.
I call Andy Allen.
Deputy Speaker, and can I thank the Minister for her answers thus far. Can the Minister advise whether she's given consideration to establishing a departmental-led fuel poverty task force made up of sector experts that can assist the Department in developing solutions to support those in fuel poverty and prevent many more from falling into fuel poverty?
Well, there's a lot of work being done at the moment. It's not through the creation of a task force because we already have groups in place. Obviously, we have the Anti-Poverty Co-Design Group who are developing the strategy at the moment, also looking at the gender strategy and obviously the impact on fuel poverty on women and children particularly. So we're looking at the recommendations that will come forward and they will be presented to the Executive in terms of being endorsed and implemented. We're also renewing the fuel poverty strategy, so we're engaging with a lot of those stakeholders and groups as well. And of course, we're waiting on the work with the Department of Economy around their strategies in terms of energy being completed as well to ensure that our strategies align. So I'm more than willing to engage. I know my officials have ongoing engagement with key sectors looking at these issues and to bring schemes and policies forward, and we'll continue to do that. But of course, if there are other suggestions or gaps in that, more than happy to look at it.
I call Paula Bradley.
Thank you, Mr Speaker, and thank the Minister for her answers so far. Minister, it has been discussed in this chamber several times around our homes and the need for insulation. And without that necessarily insulation and the work being carried out in our homes, it doesn't matter how much money we give for payments for heating. It's not going to make a button of difference when homes are cold and damp.
Well, no, it's not, and that's why we're doing the insulation scheme within the Housing Executive in terms of properties. Members will also be aware from the Housing Statement last year the huge financial challenges which impact on the Housing Executive and their ability to even maintain the current properties they have. You will know from the assessment report that was done by an external assessor that we could lose half of our housing stock unless that investment challenge is dealt with. I have taken that on. I've given a commitment to this chamber that I will be presenting recommendations on a way forward before the end of this mandate. That work is underway in terms of getting the Housing Executive into a sustainable footing. We have done part of that in terms of the corporation tax, which will make a saving that we can reinvest over £57 million back into those properties directly, because we don't have to pay that in corporation tax over the last couple of years, and obviously that's gone directly into repairs and upgrading those properties. But of course we need to do more. I recently, last week, launched my climate action plan for the department as well, so looking at the huge challenge around retrofitting, not just the 96,000 social housing executive homes, but there are over 800,000 homes across the north. So we need to look at schemes, but again, I need to work with my executive colleagues, particularly in economy and DAERA, and we have groups looking at that, and the big issue will be the resourcing in order to pay for things such as retrofitting. We're also doing some pilot schemes through European ERDF funding in North Belfast at the moment, where we are doing a whole house approach in terms of retrofitting the property and insulating it, new windows, new doors, and we'll be able to give more information on the outworkings of those schemes. I went and visited them recently up in and around the Ardoyne area, and I have to say they're excellent. So again, I'll be able to provide this chamber with an assessment once those schemes have been in place for a few months, and particularly over this winter, to look at the effectiveness of them. Thank you. Within the West Tyrone, there are 1,809 applications on the waiting list for the allocation of a social home. Of these, 1,105 are deemed to be in housing stress, while 219 homes have been allocated over the last year. I am acutely aware of the shortage in the supply of homes, which needs to be addressed. I have set out an ambitious long-term plan to increase the supply of new social homes. However, these plans will take time to come to fruition. And whilst I share the concerns about the numbers on the waiting list for a home, the projected outcomes of my plans is about ensuring the supply of social homes can meet the increase in demand going forward. I am aware that the Housing Executive that the current projected need for the West Tyrone area is for 560 new social homes between now and 2025. The Housing Executive is committed to working with housing association sector to bring forward new social housing proposals to address the identified need, and I am pleased to be able to advise that 179 new social housing units are currently under construction in the West Tyrone area. I am aware that there are several further schemes being proposed, and while subject to change, are planned to be delivered over the next few years.
I call Thomas Buchanan for supplementary.
Thank you, and thank the Minister for a response. Minister, you spelled out the need that there really is within West Tyrone for social housing, and unless the Department is prepared to make it a priority over a 4, 5, 6 year term, yeah, it will address some of the issue in a very slow way. But can I ask you to make this a priority to get social housing built and up and running in West Tyrone for the people that really need them, as you have already spelled out in your answer today?
Yes, well, it is a priority, and that was reflected in the housing statement in November of last year to really show at the crisis point that we're at in terms of public housing. So on the one hand, the huge investment challenges of the Housing Executive and just maintaining the existing stock that we've just been talking about, and also allowing them the ability to build homes again along with other housing associations as well. So we're in the middle of continuing that work. We're working through the options in terms of the revitalisation, and that is about unlocking the ability to build more homes, to be more ambitious with our programme. That will need an increase in investment. I am glad this year that I have got the biggest increase in social housing capital investment than what there's been in the previous 6 or 7 years. So we have got increased money this year to build more homes, and we're on target for doing that. But we need to do more when you look at over 42,000 people on the waiting list. But we can't deal with that unless we deal with the fundamental problems around the revitalisation of the Housing Executive. That's what we're doing. We went out recently in a call for evidence around housing supply strategy, making sure that there is a future supply of homes, looking at the issues around rural issues that there may be, looking at planning constraints and also looking at infrastructure. And I'm working with the Minister for Infrastructure and also local councils through their local development plans, particularly to look at public land where that's being prioritised, but to also look at the longer-term infrastructural needs, so such as waste, water and sewerage infrastructure, and making sure that plans within infrastructure in my department align to ensure that we're building more homes. And the other big thing for me in terms of prioritising it, I agree with you, and I would call on all parties in this chamber today, is to support housing being a key outcome in the programme for government. I know that housing associations in the sector have called for that, and I would hope all parties around this chamber support me in that call to make that a reality.
I call Mervyn Story.
Mr Deputy Principal Speaker. Minister, it's a pity that when I was Minister in 2014-15 that your party didn't approach and have the same attitude about the priority of housing, because your party resisted changes to the financial arrangements that would have unlocked billions of pounds to invest in housing. So now could you tell us where the Damascus Road experience took place? Was it in Conley House, or was it because there's an impending election and now you have to cover your tracks because nothing has been done to provide good quality homes for the people of Northern Ireland?
Well, I've been a housing activist my whole life. I've been a community activist my whole life. I've been campaigning for houses. I actually campaigned on the streets. I've went to court. I fought against the council in which I sat on when I was previously in Belfast City Council for the rights of people to have a home. In a development that they were proposing 6 houses, and we're now looking at the biggest inner-city housing development in Belfast in recent years, with almost 100 homes being built. So I know the importance of building homes, and my party has fought for housing for a long, long time, and we continue to be at the forefront of doing that. So I don't need to be reminded in terms of my activism and need in terms of the support for social housing. There does need to be changes, but it is trying to keep as close to what the Housing Executive was founded for over 50 years ago, to ensure that housing is done on the basis of need, on the basis of equality, to ensure that there is no discrimination built into it, and to ensure that it is a public body building public homes for the greater public good. And that's where my focus is in the time ahead. I will be bringing forward, and I have led on the biggest transformation since the formation of the Housing Executive 50 years ago, and I will be bringing those proposals before the Executive by the end of this mandate, if people don't take down the Executive before that.
Order, order. Can I encourage members, if they still wish to ask a question, to continue to rise in their place to demonstrate to me that someone hasn't already asked their question? And now I ask Aisling Riley.
I thank the Minister for her answers up until now. And the Minister will know that one of the biggest challenges facing workers and families is getting the keys to a new home. And as a new MLA for West Belfast, the delivery of modern and affordable homes is one of my priorities. The Minister has been clear that an important part of her overall housing plans is the revitalisation of the Housing Executive. And can the Minister tell us how that work is coming along?
Yeah, well, the work is progressing. There was obviously the statement that was given in my absence last year as Minister by Carol Nicullen when she was in this role, in terms of the housing statement that set out the future of the Housing Executive in terms of that revitalisation agenda. We have also recently been out for a call to evidence in terms of the housing supply strategy, and I will be going out to consultation towards the end of this year on that draft strategy in terms of looking at housing supply, and that will start to look at issues such as the infrastructure, planning conditions, working with local councils, looking at public land initially, but then other pieces of land as well, in terms of making sure that there's that supply of homes. As I've said, the revitalisation work is well underway. There's a joint programme board between my department and the Housing Executive. I meet with the Chair of the Housing Executive and the Chief Executive on a monthly basis just to oversee the progress of that plan as well. And I meet my officials on a regular basis in terms of its implementation. I will be coming forward to the Executive with proposals on a way forward by the end of this financial year. We're also at the same time looking at an intermediate rent model, so trying to look at the diversity of housing across the board and ensuring that we're offering more choice for people, and of course looking at initiatives such as home ownership and increasing shared ownership schemes And that's why I've invested more this year in co-ownership, and I'd want to develop schemes such as that to give people the opportunity to get their foot on the ladder of owning their own home and making sure that it's affordable as well. So this work is ongoing. As I say, I will be presenting this to the Executive before the end of this mandate for that vital work then to be taken forward in the next mandate.
I call Matthew O'Toole.
Thank you. Question 3, Mr Deputy Speaker.
Thank you. The Strategic Partnership Group for the Lower Ormo and wider university area has met twice, on the 26th of July and on the 6th of September, and has agreed its terms of reference. The group is currently considering an intervention proposal tabled by Belfast City Council. And this proposal sets out 3 main objectives to improve the area, focused on antisocial behaviour, community engagement and cohesion, and environmental enhancement. In considering that proposal, the strategic partnership is looking at shared objectives, and I'm working with my partners, particularly the ministers within the Department of Infrastructure and also the Department of Justice, who also sit on the strategic partnership group, to propose and agree a shared vision which will inform an action required in the short, medium and long term, with a clear action plan being produced as soon as possible. A cornerstone of this work will be consultation and engagement with residents, and we hope to agree a way forward on these plans at our next meeting, which will take place before Halloween. I completely understand the frustration of local residents and will continue to press for action on the ground that could make a difference to their lives. And I recently visited the area in the early hours of the morning a few weeks ago. And when you do visit the area, you can see it firsthand, particularly at that time, the issues that are impacting on residents of all backgrounds and makes that reside and live in that area. So, of course, these issues will require longer-term solution. There's no quick fixes to some of them. But it's getting that action plan that everybody can see and sign up to, and where that's being driven at an executive level as well. Obviously, the longer-term solutions can only be worked in tandem with residents, with landlords, with agencies, and both with central and local government stakeholders as well. So I welcome the commitment from the Ministers of Infrastructure and Justice, as well as the PSNI and the universities, to work alongside me in this approach.
I call Matthew O'Toole.
Thank you, Mr Deputy Speaker. Minister, this strategic partnership group was announced on the 16th of March, purely coincidentally the eve of St Patrick's Day. 6 months on, we don't yet have, as you've acknowledged, a clear work programme or a set of strategic priorities. I agree with you, this is complex stuff, but I also agree with you that this is really serious for the residents, and it's gone far beyond just simple horseplay or good times for students. Minister, can I ask, will you look at the private tenancies bill that you currently have before the Assembly to explore whether there are potential amendments to that bill which get to the heart of one of the core problems, which is the density and mismanagement of HMO properties in the Holy Land?
Well, all of these issues, I need to be working collectively with my other colleagues in Justice and Infrastructure, and that's what I'm doing. There is a proposal that Belfast City Council has sent, and indeed I met with the Chief Executive of the Council yesterday in terms of that proposal. I will need the agreement from my ministerial colleagues in terms of bringing that proposal forward and looking at the resourcing around it. I think that will make a difference. I think the fact that we have come together in a partnership across government in order to have a real focus on this has been a good thing. But of course, I completely understand and I agree that we need a clear action plan. Residents need to see action, and they need to know that even if some are going to be legislative change, that may take a number of years, but at least they can see it down in black and white and that there's actions that are going to be done. In terms of the housing and the changes that are going to be there, we're going to take a particular look at this in terms of what are the changes that we need to make. We need to look at the human rights consequences of all of that. So we don't have time to do that within the existing housing bill, and I've already given my reasons for that. We want to look at things such as letting agents in terms of the regulation and oversight of landlords as well, and to look at the density within the area. We won't have time to do it within the existing bill because all of that preparatory work needs to be done first. But we're starting that work through the Strategic Partnership Group now, pulling in the key people to look at issues around housing, around antisocial behaviour, around cohesion, and actually building a sense of community as well. And hopefully over the next couple of months then we'll be able to give more detail and flesh to the bones of that action plan.
I call Paula Bradshaw.
Thank you, Deputy Speaker, and thank you, Minister, for your answer so far. I'm just wondering about the chasm between the student accommodation, the cost per week, and then the private, these lovely new ones that are coming up. And the reason why a lot of the kids are still there is because it's such a big difference. Just wondering, are you speaking to Belfast City Council or any other providers around the redevelopment of brownfield sites, like we're seeing around the University of Ulster over in the other part of Belfast? Because I think that could be part of the difficulty of getting those kids into more secure accommodation. Thank you.
One of the areas we want to look at is a focused subgroup as part of the partnership group looking at housing. So housing more broadly within that area, but also that would include student housing. And obviously the issue around some of the housing schemes that have come forward, the universities manage and own some of them. A lot of the other schemes are owned by private sector investors as well. There's obviously an issue, well, we don't know all of the reasons. We know that there's been an increase in students going into purpose-built accommodation this year. That could be the result of the pandemic and parents wanting them to be placed there. But it could also be an issue around affordability as well, and that's what we're going to be scoping out around why isn't that the first option for many of the students then that choose to live in the Holy Lands area. So we want to do that assessment. We want to engage with students, but also with their trade unions as well to look at these issues. But as part of that, Belfast City Council will be involved, and of course the existing providers in Belfast particularly that are already managing these accommodations going forward. So that will be part of the work as we're progressing, as well as looking at any policy or legislative change that would enhance that in the time ahead.
I call Nicola Brogan.
Garmagad Lascan Corla, and I thank the Minister for her answers so far. Can the Minister outline the role that the Belfast City Council is playing in addressing the issues around the Holy Lands area, please?
Yeah, well, obviously the Strategic Partnership Group will be focused on the longer-term strategic issues. It will also be a mechanism in which Council and their interagency group at the local level can refer issues that they can't resolve, that maybe need the finance or the policy or the legislative change. Belfast City Council's Chief Executive is a partner and a member of the Strategic Partnership Group also. And obviously they run a group at a council level which looks at the day-to-day operations of the Holy Lands, that looks at preparatory planning around key dates in the year, such as St Patrick's Day, Freshers, Halloween as well. And they coordinate that activity with other agencies in terms of making sure that there are mitigations and plans put in place. They obviously also led on work such as the Buchanan report that was done to look at the longer-term strategic impact, and of course their role in community planning now as well. So we're working very closely with Belfast City Council. They're a key partner now on the Strategic Partnership Group. They will continue to do the day-to-day operations in terms of the Holy Lands in Lower Ormeau area, but will start to then feed up the more strategic difficulties or challenges to the Strategic Partnership Group for us to look at the longer term issues.
Moving on, I call Trevor Clark.
Question number 4.
The most recent PIP statistics published, which cover the period of June 16 to the end of May 2021, show that the average timescale from a claim of registration until a decision is made is 13 weeks. The average time reported is calculated from the point of the initial claim registration and includes the time taken for the claimant to return the PIP form issued following registration, the assessment process and the decision by the Department. Dependent on the circumstances, some claims are processed significantly quicker than this, such as cases where the special rules for terminally ill apply, where clearance rates times is 2 weeks. All processes are kept under constant review.
I call Trevor Clark.
Thank you very much, Mr. Speaker. Deputy Speaker, the Minister will accept that the organisation that has run this has come under much public criticism about the timings and indeed how they have treated some people. And your statistics referred to the 13 weeks. However, and my question wasn't referring to the appeals themselves, but you'll know probably from your briefing that the appeals run into many months. Given that many of these people are a very vulnerable state and are very dependent on this income, what are you doing as a Minister to try and address this, to reduce the length of time these people have to wait to get their payments?
Well, in terms of the question, I mean, the 13 weeks is around the process of applying for PIP and all of that, so it didn't deal. I mean, if we took your question up wrong, then we'll clarify that. But in terms of the processes, I mean, obviously we've had the NIPSO report, we've had other reports that have been done around the whole PIP process. I'm obviously working in terms of the implementation of the recommendations that come out of that. I have also taken the audit function of PIP back in-house from August of this year to really look at how we're managing that contract around it. I've made a policy decision in terms of PIP that we should be bringing all the assessments in-house again. But again, I need executive approval for the financial uplift that I would need in order to do that. In the longer term, what we're trying to do, some of the reason or the big reasons for the delays is the availability of health evidence that's coming forward in terms of somebody's condition. We're trying to work with the Department of Health. We've looked at the Scottish model and other models where they're doing a new approach based around health trusts, where it would be the trust that would carry out the initial assessments. That information would be fed then directly into the department through a data sharing process. So we're beginning to look at those, but obviously health, because of the pandemic, there's been delays in trying to bring that forward. But that work is continuing in the time ahead, and we're continuing to keep this under review and to make changes where we can. The longer term objective is to bring these assessments back in-house and to end the privatisation of the assessments that are happening now.
I call Rob Newton.
Thank you, Mr Deputy Speaker. Can I ask the Minister, I think is well aware of this, that there are people sitting who have made an application, who have been turned down on the scoring system and who have then made an appeal. And many people sitting in dire circumstances with physical injuries, with mental health issues, and not getting any indication from the department.
Can the member come to the question? We're running out of time.
When the appeal will be heard. There is, Minister, a dire lack of communication between the appeal service
member come to the question?
And the appellant.
Well, there has been a backlog in appeals, not all due to the pandemic, but a good lot of it has been due to the pandemic because face-to-face assessments and appeals stopped. And they are gradually only beginning to reopen. We're trying to put additional resources around trying to deal with that backlog as well. But fundamentally, the longer-term issue around appeals and around the assessments is the availability in real time to the medical evidence. So when you look at appeals, and there are high rates of appeals that are overturned in terms of the mandatory reconsideration and then going to appeal, that's because new medical evidence is presented at that stage. We need to find a way of front-loading that at the front of the system, that it doesn't need to go to an appeal, because it's already failed in some ways once it gets to that point. So that's why we are looking at an in-house model. I feel that that is the best way to go forward. I also feel that working with the Department of Health, where the health professionals are, and particularly the consultants and doctors that are treating people with these conditions, the quicker that we can get access to their medical files from their health professionals, we can make a decision and an assessment much quicker. So we're trying to move to that model. Obviously, health have to do a piece of work, and one of the big challenges that they have is condensing all of the systems from health and social care onto one database or platform. That's going to take a while to do, but we're continuing to work with the Health Minister to see if we can bring this forward as quickly as possible.
And that is the end of our period of times for listed questions, and we now move on for 15 minutes of topical questions, and I call Paula Bradley.
Thank you, Deputy Chair. Minister, you had mentioned it earlier, and we also saw it in a statement you put out about the extra 15 million due to the increased costs for new housing. Can I ask you then, has there been any extra money put into the existing housing stock, given we have tenants? I know I have one in my office who's been waiting since May to get the keys of something she agreed to and is now being told it's going to be after Christmas before she can move in.
There has been additional money that's been put into the Housing Executive budget and into their reserves in year. I don't have all of the details and the figures with me. There's obviously also the changes that are being made in terms of the corporation tax where that's going to be clawed back and put directly back into the housing executive as well. I think some of the delays are around the contracts being procured then in terms of contractual issues, and that's had a knock-on effect also. But just from a departmental point of view, they have had an increase in their budget in terms of money going into reserves that allow them to put that directly into the maintenance of properties. So I'll get you the exact figures and send them through to you.
Call Paula Bradley for supplementary.
Thank you, Mr Deputy Speaker, and I thank the Minister for her answer. Minister, we often hear when we talk about health a postcode lottery, but when it comes to housing now we also have a postcode lottery. I recently received figures to do with North Belfast, where you've got Belfast and Newtonabbey 1, and if you live in Newtonabbey 1 you're going to wait twice as long for anything when it comes to being rehoused. Can I just ask you, what can you do to address this disparity that not only across the whole of this country but across one constituency that can be so very, very different?
Well, the big issue firstly is the supply of housing and making sure that we have a supply chain, and that's what we're looking at in terms of the housing strategy. The other issue, when I initially came into the department and looked at the housing development programme, we were seeing in North Belfast as a prime example, it's the highest area in terms of people on the list waiting for a home. But when you looked at the housing development programme, there were other areas that had half the need, but were getting double the homes built in them. Now, some would say that there were issues in the likes of North Belfast around availability of land, around infrastructure, around planning, but that's not good enough. One of the issues I'm looking at the moment and was listed in the housing statement was reintroducing ring fencing. So looking at the housing development programme and ring fencing, particularly those areas of highest need, which includes North Belfast, Foyle, it includes West Belfast, to see if we can look at a focused, targeted piece of work in terms of those areas. We want to increase the supply of homes across the board as well. Fundamentally, we also need to be looking at the housing sales schemes, because every year, on average, for 1,800 homes that we're building, we're losing almost 500 through the Right to Buy scheme. Now, I want to go out and consult on that. It hasn't got approval at the executive yet, and I'm waiting on that approval just to do the consultation to see what public opinion is on these areas. So there's a number of factors that we need to be looking at that were obviously addressed in the housing statement that we're trying to bring forward. Ring fencing, looking at the housing supply strategy, which we will be out to consult on later this year. And of course, trying to be more ambitious in having an increased capital investment to build more social homes in the time ahead as well.
I call Cathal Boylan.
I welcome the Minister's recent announcement about the funding to ensure stability within the social housing sector. Can the Minister outline the benefits arising from that investment?
Yeah, well, I think this was crucial. I mean, we have had a lot of engagements with contractors, with social housing associations, and also with the housing executive as well, in terms of the increase in costs. It's no secret, it's across the board in all capital programmes. Where there's been challenges in terms of when the contract was first given. There's been a huge increase then in costs for materials. So we wanted to meet that challenge to ensure that the housing programme can still go ahead and that we can still deliver on target. So this funding is vital. It's been broadly welcomed by the sector. I know it followed a similar announcement by the Finance Minister in terms of looking at investments around capital infrastructure and de-risking those investments as well. And obviously housing is a priority, so I'm glad that we were able to create this fund to allow those contracted works to continue.
I call Cathal Boylan for supplementary.
Last Colin, could I thank the Minister for her intervention in this issue. Minister, given the volatile cost of building materials, it's important that we keep building houses where they are needed. Can the Minister give us an update on our overall housing plan?
Yeah, I think I covered some of it in the previous supplementary, but obviously one of the areas that we're looking at is in terms of introducing ring fencing again into the social housing development programme, and particularly to have a focus on building more homes in those areas of highest need. Obviously dealing with the Housing Executive's investment challenge, because the critical thing is trying to get the Housing Executive building again and getting them building as soon as possible, but also investing in the existing stock that they have, because we don't want to run the risk that they could lose potentially half of that stock unless we deal with this challenge. And of course, I'm continuing this year. I did get an increased investment from the Executive in the capital budget for more social homes, and going forward, obviously, as part of the housing supply strategy, which will look at the needs and which will start to determine how many homes we need to build, for example, over the next decade. That will have to see alongside it a commitment to an increased capital programme to match that need. And that's something that I will be picking up with Executive colleagues in terms of the budget.
I call Thomas Buchanan.
Thank you, Deputy Speaker. Minister, can you inform the House today as to what steps you're taking to address the gross disparity in the community make-up of the housing executive workforce and the offices in the Western area? And with that, I'm referring to the offices in Enniskillen, Omagh and Londonderry.
Well, I'm not sure what you're actually referring to in terms of the makeup. Is it by backgrounds or what? But obviously the Housing Executive, like any public authority, work the equality regulations and guidelines in terms of their recruitment policies. And that's something that we ensure that they adhere strongly to. And obviously have an ongoing engagement with the Equality Commission and Human Rights Commission. If there's something more specific that you want to talk about that I'm not aware of, more than happy to address that directly with you.
I call Tom Buchanan.
Yeah, I'll certainly write to the Minister on this particular issue, but I have been pressing the Chief Executive of the Housing Executive on this particular issue for a number of years now, with regard to the religious disparity in the workforce, especially within the Grants Office and those three offices. And rather than getting better, it has been getting worse and worse as the years have gone by. And therefore, would the Minister, in light of that, would the Minister agree with me in this House today that in the Western area, that the Housing Executive is no longer an equal opportunities employer?
Well, I would say the Housing Executive is an equal opportunities employer, and it has excelled in terms of the job that it has done in terms of recruitment. It adheres to the law in terms of recruitment matters as well. If there is a particular issue that you need to address with me, that's fine. But I think also, staff in all of our offices and delivering houses are there to deliver a public service for everybody, no matter what background or walk of life they come from. That's a commitment, that's the ethos of the Housing Executive and why it was established, to ensure that there wasn't discrimination in housing and to take the politics out of housing. And that's something that I will defend going forward for the Housing Executive in the time ahead as well. But if there are specifics that you have, yes, get in touch and we'll come back to you directly.
I call Joanne Bunning.
Thank you, Mr Deputy Speaker. Could I ask the Minister for an update on the review of the housing points allocation system, please?
Yes, well, obviously there was a consultation and a review done in terms of the point system. 18 of the recommendations were agreed to and brought forward. Work is ongoing now with the Housing Executive in terms of the implementation of those. Obviously there are system changes, so IT systems and all of that need to change, and that work will be done over the next 2 to 3 years in terms of full implementation. The first phase of that work should be completed by March of next year, and as I say, it will take a further 2 years after that then to complete all of the work to ensure that we can then fully implement the 18 recommendations. The other 2 outstanding recommendations that weren't brought forward at this point are around intimidation points, for example. And I know that some concerns were raised about the recommendations that were being proposed, particularly around domestic and gender-based violence. So we've asked the Housing Executive to reassess that again, to engage and to look at what options, and I'm waiting on, I suppose, options and proposals coming back to me for my consideration. So we'll be able to update more once we have that information back.
I call Joanne Bunning.
Thanks, Mr Deputy Speaker, and thanks to the Minister for that information. I accept what she's saying about the intimidation points, and it's a very difficult area, but without question there are people who abuse that system. And I'm wondering, I suppose, going forward, what she intends to do to try to put a stop to people abusing circumstances where they claim they're being intimidated.
Well, I think the big thing is that a lot of people who have been intimidated feel that we shouldn't be taking away the right to claim points for intimidation because they're going through that traumatic experience. And unfortunately, intimidation happens. It shouldn't, but it does. So we still need to look at what provision we can give. And we're looking at that at the moment in terms of what other options we can look at outside of the recommendation of just removing the points. Because we know that organisations, particularly within the women's sector, had raised concerns as well, even around domestic violence not being considered, and they feel that it should be, and I would agree with that. We also need to be looking at the robustness then of the evidence and of the information and making sure that there's greater oversight of that. So that's part of the scoping work that the Housing Executive are doing as well. So more than happy for you to engage with my officials directly on this matter, and indeed once I come forward with recommendations, more than happy to come back, communicate directly to yourself but also to the Assembly as well.
Could we have Sinead Bradley onto our screens?
Thank you, Mr Deputy Speaker.
And I call Sinead Bradley.
Thank you, Mr Deputy Speaker. The Minister will be aware that the cost of living is rising dramatically, and those living on universal credit are being forced into hardship. Can the Minister give an update on the £20 that was taken off the universal credit recipients, but also could she describe to me the mechanism that will be used to give that money back to those recipients?
Well, firstly, in terms of the cut in the universal credit uplift by the Tories is, I think, disgraceful, and particularly doing it in the midst of a pandemic and as we're entering into the winter months as well. I think there was a recognition when the money was given that the basic rate already wasn't enough, although I believe that they're ideologically wedded to eroding the welfare state that exists. That said, I am glad that the Executive overall, I got support from all Executive Ministers and all parties around that table in lobbying the British Government and writing to the British Government. I also worked with my counterparts in Scotland and Wales, calling for this uplift to be retained, because this is almost £110 million that comes out of the local economy here and comes out of people's pockets. That will increase to almost £200 million if you look at all the legacy benefits that would eventually transfer over to universal credit. So it's a huge amount of money that will be lost, and obviously putting people into greater hardship at a time when we're seeing increased fuel costs and, as you say, the cost of living, issues pertaining to Brexit and also just the winter months as well. We're continuing to lobby for that to be reinstated. Obviously, I made a bid onto the monitoring round, but I was also clear that you can't just cover it for 6 months. You can't just do it until March and create another deadline. That if you're going to cover it, then you need to be looking at the resourcing going into the next financial year and beyond that. But to do that, it's a huge commitment. It's almost £200 million that is going to need to be found from existing budgets. And that will be part of the conversation. I think the focus rightly at the minute is with the British Government, who have removed this, who dictate the finances around this, and obviously we're continuing to apply the pressure. In the intervening period, we're continuing to try and support people.
The Minister's 2
we
minutes
have the
is up.
discretionary fund and all of those, and indeed the debt advisors who can give advice and support.
I call Sinead Bradley for supplementary.
Thank you, Mr Deputy Speaker. Minister, I suppose you've given back to me what I put to you in the question, but ultimately what I'm trying to ask is, have you established a mechanism for paying that money back? I know my SDLP colleagues have been calling for this for months, and I've yet to hear the actual mechanism that will be put in place to make payments to those recipients. Has it happened or has it not?
Well, we would need to build a new system because the payments are made by Westminster. They're paid by the Department of Work and Pensions. We don't have the IT system here. If we wanted to build our own IT system for Social Security, it would be over £1 billion that would have to be invested to do that. Now, we have built extra systems in terms of the mitigations that we pay here that other parts of Britain don't get, but that's at a cost. So to build an additional system is going to cost over £7 million. And to do that, I need the agreement and the approval of the Executive to go forward in terms of there's no point in me building a system unless I get the approval that we're going to continue this payment. We're looking at the plans in order to do that, but I have to get the approval to know that the finance is there to make the payments.
And that is the end of our period of times of questions to the Ministers. I would ask members to take their ease for a few moments before we return to the debate on the stability of institutions. Order members, and ask members to resume their seats. We now return to the debate on the stability of institutions, and I invite John O'Dowd.
Just before I go into the substantive remarks, just to let people know, Sinn Féin will be abstaining on the two amendments and also the substantive motion. We are certainly up for dialogue about the institutions, about how things work and how some of the points Kelly Armstrong raised in terms of how her mandate is recognised. But all that has to take place in an atmosphere where there is equality of opportunity for all in the chamber, and that where previous agreements and long-standing agreements are honoured by all in the chamber. And when you look at the current political atmosphere in which we are working, we have serious concerns about the trajectory and attitude of particularly the two main unionist parties in terms of the Democratic Unionist Party and the Ulster Unionist Party, about their views on sharing power with their nationalist and republican neighbours. And that's the context in which any discussion or negotiation will be taking place. And we don't want to give the impression to anyone that we are going to allow our electorate to be discriminated against. And I've heard and I've listened to Kelly's comments about the mandate not only of the Alliance Party, the Greens and People Before Profit and others, and how that is counted. Personally, I'm deeply proud to be a nationalist and a Republican. I see it as a political philosophy which is forward-thinking and inclusive, which is about the future, being conscious of the past, and that what we want to see in this chamber and in the executive is a working power-sharing institution representing all the citizens of this part of the island. I'm personally, and I've said this in the chamber before, I'm proud to say I shared power with my Protestant, Unionist, Loyalist neighbours, and whatever other descriptions are out there. When I was in the executive, there was 2 Alliance ministers, and I'm proud to say I was in an executive with all the major parties at that time represented on it. And you see, when we reach a stage when somebody on the opposite benches can get up and say, I am proud to say I shared power with Sinn Féin, the SDLP, the Alliance Party, or whoever else gets a mandate to be in the executive, then I think this society will take a huge step forward. A huge step forward. Yep.
Member for giving way, and it's interesting when he talks about how he's proud to be a Republican and that's the way forward. The previous speaker from his party said that Republicans had a progressive agenda. Do you understand how people on this side of the House and the people we represent feel when your progressive agenda includes your party promoting and glorifying terrorists and terrorism?
Members, next minute.
Well, you see, the issue of power sharing and the past is about the fact that we have different understandings of it. My experience of the British Army and the RUC and the UDR and all that other paraphernalia around this state is different from yours. But I accept you have a right to honour that. You have a right to remember the past from your perspective. But I thought you were going to get up and completely shock me and say that your party was proud to share power with Republicans, with the SDLP, with Alliance. But you didn't. Sorry, Kelly, you would have been? Yes, yes.
I would just like to say that this is exactly why this is happening. I respect all of your political opinions. Why am I still a second-class citizen in cross-community voting in this House? Why can we not have equality?
What we have to do, Kelly, is to get to a position where we do have equality. But the Good Friday Agreement, at its point in time, was about bringing to an end a conflict between the two main traditions on this island, nationalism and unionism. And you can shake your head all you want, but that's where the conflict was. Now, has things evolved? Are we in an Ireland of transition? Yes, we are. Without a doubt, we're in an Ireland of transition, where there are many, many different views, and I think that makes this a much richer place to be, and makes this Assembly a more richer and diverse place to be. And that has to be recognised going into the future. But you also have to recognise this. We currently have the Democratic Unionist Party and the Ulster Unionist Party refusing to say whether, under the current agreement, after the next election, if Sinn Féin was the largest party, would they nominate to be deputy? They can't say it. So how can you move forward and change in that position? But let me make this clear. If Sinn Féin is the largest party after the next election, we will be nominating Michelle O'Neill as First Minister. If Sinn Féin is the second largest party, we will be nominating Michelle O'Neill as the Deputy First Minister, regardless of who is the largest party. If we don't have enough votes to take up seats in the Executive, we'll be in the Chamber, we'll be operating the structures of the Good Friday Agreement, and we'll be seeking change. We will not allow anybody, as Kelly has talked about her mandate, we will not let anyone treat our electorate as second-class citizens. And the question for the future is this: how do we ensure no one in this chamber feels they're being treated as a second-class citizen? But until that equation is closed, then I think there's difficulties progressing from the point from where we are now. Thank you.
I call Dolores Kelly.
Thank you, Mr Deputy Speaker. I rise to speak on behalf of the SDLP amendment, but acknowledge that the Alliance amendment to their own motion, which goes some way to addressing many of our concerns. Many speakers have already acknowledged that review provisions were in fact deliberately written into the agreement, both in overall terms and in relation to specific institutions or strands. The SDLP, during those negotiations and publicly during the 1998 referendum campaign, recognised that the provisions and designation in cross-community voting should and would be subject to review. We said then that we hoped that some of the necessary checks and balances might be biodegradable, so that as the environment changed, we could see agreement to have less reliance on what would be seen as more artificial containment of democratic decisions. The abuse of the petition of concern, which was never properly legislated for or operated as per the Good Friday Agreement actual terms, and other examples, have led to wider questions about the efficacy, appropriateness, or indeed the extent of cross-community voting thresholds, or even the system of designation on which these are counted. As I've said, the SDLP is open for review. Indeed, at Westminster, our MPs have tabled an amendment to what is known as the NDNA legislation and was supported by the Alliance Party MP Stephen Farry. And we are open to joint election being endorsed by one or more, either, for example, political consent or parallel consent, or a qualified weighted majority, for example 60% of those present and voting, or 2/3 of MLAs. So if the Alliance Party could support that in this amendment to the British Government, I can't understand why they couldn't support that as a recommendation to the AARC committee as outlined in our amendment. But you know, Mr Deputy Speaker, cross-community voting didn't come out of nowhere. It came about as a result of intensive negotiations after a period of misrule by one party. And the issue in terms of the Good Friday Agreement was to not only to prevent that from happening, but to enshrine the rights of minorities, both now and into the future, whatever shape the jurisdiction. Okay.
As a minority in this House, can the member confirm how she feels that cross-community voting that doesn't count my vote the same is protecting me?
The member's next minute.
Thank you, Mr Deputy Speaker. Well, I want to move on to the Alliance Party's portrayal of themselves as somehow being less citizens, because in actual fact, Mr Deputy Speaker, you will recall, for Mr O'Dowd didn't respect our mandate whenever he said on The View a number of years ago that the other parties didn't matter outside of the two big parties, Sinn Féin and the DUP. So, you know,
Order.
No, I won't take an intervention. That's a matter of record. That is a matter of record. He said nobody else's mandate mattered but his and the DUP's. So can I say, Mr Deputy Speaker, as for the Alliance Party, they were happy. They were happy.
Point of order, and I hope it is a point of order.
Oh, it is a point of order. Is it in order for the House to be misled by the member in statements which are not factual?
I have no way of knowing whether it was factual or not. Your point has been recorded and answered. I call Ms Dolores Kelly.
Well, it's recorded on iPlayer and YouTube, you know, so I might be paraphrasing, but that was the gist of what Mr O'Dowd said. For people were shocked that night, and there was quite a lot of response on social media in relation to it. But I want to go back to Ms Armstrong's portrayal of the Alliance Party being somehow less, because our mandate has been disrespected. I think the mandate of a lot of parties has been disrespected by the power struggle between Sinn Féin and the DUP, who look only to their own constituency and not to the greater good, which is what, of course, the Good Friday Agreement was all about, that we would end the tribalism and we would work together collaboratively for the common good. Seamus Mallon described what happened I think at St Andrews as the balkanisation of the North, and we've seen that subsequently. So really, to go back, the Alliance Party was happy to allow to take the Justice Ministry, whenever in actual fact I think arguably the SDLP should have been entitled to a second ministry at that time. And I think Martin McGuinness, I remember saying to the late Martin McGuinness, no nationalists need apply, and that still prevails in relation to the appointment of Justice Minister. So over the years, over recent years, the mandate of the Alliance Party has counted for much more than many other parties in this House. I think that is a matter of record. And I just want to say, in terms of what happened around this race to be First Minister, we all know it's a joint office. It's a joint office with equal standing. One cannot move without the other, which is, of course, why there's the paralysis around the executive table these days, and no business at all coming to the Business Committee, because there's a paralysis and a mutual veto, which is something that Sinn Féin conceded at St Andrews to the DUP to spur their blushes in going through the lobby to vote for Martin McGuinness as Deputy First Minister. And now it's something that has come back to bite them, and bite them very quickly. So the SDLP is up for review. We're up for review in the best interests of all, and indeed to have collaboration across government departments that's in the best interests of all.
I call John Blair.
Mr Deputy Speaker, I rise in support of the Alliance Party motion and the Alliance amendment. Deputy Speaker, recent elections have demonstrated clearly a heightened interest in a united community where everyone is treated equally in Northern Ireland, but the Assembly continues to represent institutionalised division through its binary and outdated designation system. Recent elections have shown also a significant increase in votes for parties whose members do not designate as either Unionist or Nationalist. The election in 2017, and this is factual, had 11 out of 90 such MLAs. I will in this case.
Wait, can the member just clarify the position of the Alliance Party? When you designate in here as being not Unionist or Nationalist, when some members of your party, including very recently in the media, indicated that they would support a United Ireland, some of them might even be very close to where you're sitting.
The member's an extra minute.
Thank you, Deputy Speaker, and I can clarify that from my own position, which is this. I've been asked many, many times over the years, am I a Unionist or a Nationalist, or Unionist Alliance or National Alliance? The answer is clearly, firmly, proudly, neither. That is the case today, and it will be the case going forward. It is quite simply, Deputy Speaker, undemocratic that an effective veto power should continue for some parties, and only some parties in these circumstances. But simply removing the petition of concern, for example, does not address the other issues where the votes of Unionists and Nationalists count twice, while others count only once. This is why there needs to be a major reform of the voting system in the Assembly. It is untenable to persist with a mechanism that discriminates against up to 25% of voters, while it is tempting to consider minor tweaks also requiring, by the way, a majority of others. They do not make an unfair system fairer. The obvious solution, Deputy Speaker, both in terms of mathematical simplicity and in the interest of fairness, is to remove designations altogether and to require key votes in the Assembly to be passed by other means. Perhaps simple weighted majority, which could be 2/3 initially, but could perhaps reduce to 60% over a period of time. And there are other alternatives, and these are matters for proper and further discussion and subsequent agreement. Given the relative strength of unionism and nationalism and others, this would ensure that key votes had a de facto cross-community majority while removing the veto from any single party. I'm hopeful, Deputy Speaker, that the work of the AERC committee, referenced earlier by Mr McHugh, to commence and bring forward reports will progress at pace, and that those reports can be made available to us as soon as is possible. I believe that this would also improve the quality of governance if these changes are made in Northern Ireland, Deputy Speaker, and help steer away from recurring stalemate and standoff. If we are serious about increasing participation in politics by those from a wider range of background, including those currently underrepresented, and serious about making local politics more diverse, we must stop treating those who aren't traditional unionists or traditional nationalists as second-class citizens without equal voice or equal vote. The reform of the institutions, Deputy Speaker, is a vital part of that. Some have recently talked about taking them and us back to 1998. That will not work either, given how at the start of the lifetime of the Assembly, others were forgotten about at that point also. And that period of the Assembly in its earlier days was not, if truth be told, without times of deadlock either. This is no longer acceptable. Until the designations are removed and until our votes are counted equally, parties like Alliance will continue to be disadvantaged, and so will the people of Northern Ireland who choose to vote for us. Deputy Speaker, I support the Alliance motion and amendment. Thank you.
I call Jim Allister.
Thank you, Deputy Speaker. In opening this debate, Mrs Armstrong made a number of powerful points, which I think would be hard to refute. She does have a legitimate grievance about the fact that her designation is less equal than others. And she is right when she says that the very system perpetuates a division. And that, of course, is the outworking of the very agreement that the Alliance Party were cheerleaders for, namely the Belfast Agreement. And whereas Mrs Armstrong said that mandatory coalition does not work, the sad thing about her motion and amendment is that that issue is utterly avoided. The gaping void in this motion and amendment is there any reference to mandatory coalition, a system which inherently, congenitally, is incapable of working, because it is based on a number of unworkable premises, one of which is that you don't have to be agreed about anything in order to be in government. Hence, no surprise that when in government, we have the dysfunctionalism, the disagreement, the shambles that characterises these institutions. And of course, the other fatal flaw in mandatory coalition is that it denies the electorate the most fundamental right that any electorate has, namely that to change their government. Yesterday I quoted the late Tony Benn and his 5 democratic questions. The 5th one was, speaking of government, how can we get rid of you? If you can't get rid of the people who govern you, you don't live in a democratic system. And that is the very essence of mandatory coalition, provided a party continues to hold a handful of assembly members, they are guaranteed, as of right, a place in government. They remove from the electorate the right, therefore, to vote a party out of government. Across this world, people go to the polls more often than not, inspired by the determination to vote a party out. But in this country, we are denied, because of the iniquity of mandatory coalition, of that basic democratic right. And there will never be stability. There will never be a working system of government in these institutions so long as there is mandatory coalition, because it disincentivises the need to agree about anything, and it fundamentally denies the electorate the right which should be the most cherished, that of changing their own government. So you all sit here cocooned in the knowledge that no matter how big a hames you make of government, provided you hang on to a handful of seats, you cannot be removed. What sort of a farcical system is that? And then we are surprised when some come to this House and say, weep crocodile tears about it not working, about the dysfunctionalism of it, about it falling apart. Of course it's going to fall apart. It's incapable of holding together. The only glue that holds it together is the self-interest of being in government, in the sure and certain knowledge you can never not be in government. And if you then build into that farce the fact that you can only have a government if at its top and its heart you have a party that doesn't even want Northern Ireland to exist, then you arrive at the ultimate farce of why this system of government can never work, will never work, cannot bring good government, and will but continue to bring the dysfunctionalism that is a shame upon this system.
I call Jerry Carroll.
Thanks, Deputy Speaker. I rise to support the motion and the Alliance amendment. Mr. Speaker, it's clear that change is urgently required in this arena, and we will support a report being completed which would initiate that process, not least because of the misuse of the petition of concern to intervene in legislation which does not target one community or the other, but which targets all communities, issues like welfare reform, marriage equality, to name but two. And before going into more detail on that, I think it's fair to say that the proposers of the motion and I probably have different policies and politics and perhaps different views on the record or ability of these institutions to deliver for the people here. I'm obviously not part of the executive. I do not think the executive have done anywhere near enough to deliver for people here generally. And to be honest, I do not adhere to the school of thought that says we must save this executive at all costs, especially when it involves continuing to attack working class people and minorities. I believe the record of this executive and therefore these institutions isn't great, to put it mildly. Time and time again, they have been part of the problem in terms of implementing past austerity, enshrining inequality, and indeed entrenching division. That said, while I might differ, as I said, in the politics to the proposers of the motion, the action points of the motion are something that I can certainly get behind, because they aim to alleviate the entrenched sectarianism that exists in this chamber, where socialist, oppositional and minority voices like myself and mine are constantly squeezed out and forced to the sidelines because of the communalisation of politics in debates where my vote and others literally do not count. The enshrined communalisation of politics perpetuated by these institutions, Deputy Speaker, is something that has helped create a situation where sectarianism thrives and re-emerges in a context of... yeah, I'll go away, yeah.
Is it not lazy rhetoric in some ways to refer to sectarianism in the chamber? Do you honestly believe the tens of thousands of, or the thousands of neighbours you have in West Belfast who go out and vote Sinn Féin are sectarian?
The member's an extra minute.
I didn't say that, so I don't know where the member's getting that point from. The point I'm making to the member that he can't answer is, why does my vote and the vote of the people who elect me, the Alliance, the Greens and others, not matter in debates in this chamber? He cannot answer that question, so that's the question I would put back to him quite clearly. He's no answer to it. Inequality, Deputy Speaker. No, I'll give away. Inequality, Deputy Speaker, a situation where there are now more peace walls separating working class areas than what existed when the agreement was signed in 1998, and where the development of class politics based on unity as opposed to division is constantly undermined by communal competition. It is ironic and also quite farcical, Deputy Speaker, then, to think that mechanisms such as the petition of concern that were apparently set up to prevent sectarian discrimination, because the reality is they have helped entrench sectarianism and discrimination. Worse still, perhaps, is the way that these mechanisms have been used to block progress in issues of rights and well-being for people from all communities. This is clearly wrong, and there are many examples of it, but the added insult to injury is the fact that votes on those issues were not considered from parties who do not designate as either nationalist or unionist, and the point, again, to be emphasised in Mr O'Dowd. It is inherently undemocratic on the one hand, but again, the reality, of course, is that this mechanism does not prevent sectarian discrimination. It actually entrenches it. I don't know where else in the world, Deputy Speaker, you would only allow people with a certain political designation to have a vote on LGBTQ+ rights, on austerity cuts, and in this sense, people from all communities have been let down. I would also simply reiterate the view that the tinkering with voting systems won't bring stability to this place. Petition of concern has not been launched since the executive reformed in 2020, and yet levels of political stability are on the floor, with threats to bring these institutions down daily, and dog whistle support for mobilisations on the streets, which led to riots by some in the highest offices, giving a wink and a nod to them. What we really need, Deputy Speaker, is a new kind of politics, one that rejects the communal and sectarian framework of politics and actually tries to reach out across the divide on the basis of unity. Of a vision based on fighting not one another, but uniting and fighting to challenge poverty, inequality and marginalisation. Unity over division in order to build a better society for people, their health and our planet, and that's what I'm up for in the period ahead. Deputy Speaker, I also want to use this debate as an opportunity to say something briefly about the hypocrisy of those who are waging a somewhat pathetic fight over the First Minister position. The truth is that the First and Deputy First Minister positions have no real difference or no real legal difference, and the DUP have been happy to share power with Sinn Féin for years while implementing austerity with them as joint partners in government. Now, however, faced with a sustained crisis in unionism, they revert to what they know best: beating the communal drum and heightening tensions. They have been doing it for months, and much of the commentary from the DUP and some in the UUP about the First Minister position are simply another example of the chronic opportunism and insecurity that is a result of the crisis that faces unionism. I think working class people on the Shankill Road, Tigers Bay and every other working class constituency deserve much, much better. Thank you.
I now invite Mark Durkin to wind on amendment number 2, and you've up to 5 minutes.
Thank you, Mr Deputy Speaker. We live in a place, whatever people choose to call it, that has transformed over the course of the last 2 decades, but nowhere near to the extent that it's no longer recognisable. There's much here which remains unchanged. Our institutional arrangements were designed to facilitate peace. They brought our citizens some semblance of stability after decades of bloodshed. A carefully sculpted framework, it recognised the need to incentivise cooperation and accountability. That being said, these arrangements were not, and certainly now are not, without imperfection. The SDLP in the negotiations and publicly during the 1998 referendum campaign recognised that the provisions on designation and cross-community voting should and would be subject to review. Inbuilt flexibilities were deliberately written in, and these solutions were never meant to be permanent. However, while it may be premature to deviate from that framework just yet, it is important that we discuss the stability, or rather instability, of these institutions and strive to improve. Ms Armstrong conveyed her and her party's frustration at being less equal than others in here, and I can understand her desire and anyone's desire to challenge and want to change that. But then a wee tweet that I saw doing the rounds from Alliance members earlier would suggest, far from being displeased or dissatisfied at Ussens and Lemons politics, they're almost trying to create a new Ussens and Lemons where all of Ussens are those with any view, regardless of what that view is, on the constitutional question. Certainly.
Can I just ask the member, whenever he sees that there's us's and them's and he's portraying alliance on the outside, that we are on the outside because we don't have the same vote as you have, that I am a lesser person and my vote counts for less when a cross-community vote happens here. Is that not correct?
Members, an extra minute.
As the member has acknowledged in the amendment to her own motion, work is being done on this by the AERC. That this is something that has been accepted, it has been viewed, that does need changed. I've accepted that. I've stated it clearly here today that it needs, that you're right to challenge it and need to change it. No, I think Alliance in particular are content to play that role of victim and do so, have done so with aplomb. So I congratulate the member on that. In terms of the SDLP amendment, the civil rights movement challenged one-party rule or misrule. That was compounded by a loaded voting system which denied due representation to others. Yet the outworkings of St Andrews results in leadership that arguably is not truly representative of those within this chamber, never mind the wider population. Presents a threat of instability and one which hangs as a sword of Damocles over us all. Not just us all, over all. We now know that it can grant unequal power to one party selected by the St Andrews algorithm to freeze or even crash institutions. Evidently, that does not count or respect people's votes or other parties' mandates, in keeping with the spirit of one person, one vote. That's why we tabled our amendment to spell out that democratic reality. In supporting the Alliance amended motion, we recognise the full picture of the problems which now threaten not only democratic credibility but stability. We accept that direction for change is needed. However, that does not begin with the abandonment of the Good Friday Agreement features before alternatives are agreed. Prior to St Andrews, the First Minister's appointment, and yes, that's First Ministers plural, as Mr Carroll reminded us, we do have two First Ministers in a joint office. It seems to have been lost on some for some time and lost on some more recently. I think it's escaped Mr McHugh's attention earlier as well. But it was to be achieved through parallel consent. The SDLP would like to see a return to that methodology, or as alluded to earlier, at least a review to identify alternatives. We're open to a joint election being endorsed by parallel consent, qualified weighted majority, or 2/3 MLAs vote. And Ms Kelly pointed out that the SDLP recently expressed this desire at Westminster in an amendment to the NDNA bill that was supported by Alliance. As such, it should be supported as an AERC recommendation for British Government legislation. Our amendment acknowledges that there are problems which need addressed. The most recent state of paralysis, 3 years of inaction, served only to frustrate, deepen our housing and health crises and inflict more Tory austerity upon our citizens. Put simply, the only thing it achieved was further suffering within our communities. Our aim is to support the AERC in the exploration of this issue and to contribute to greater cohesion and stability which this motion seeks. We would concur that the mechanisms which were once intended as safeguards, such as a petition of concern, have become tools of abuse, holding the parties to ransom rather than facilitating inclusion.
The majority's remarks are closed.
The time will come, Mr Deputy Speaker, when we can remove the ugly scaffolding. That time, sadly, isn't just now. This place is a work in progress, and to paraphrase Heaney, we may let the scaffolds fall when we're confident that we've built our wall.
I now call on Andrew Muir to wind on the motion and amendment number 1, and you have 10 minutes.
Thank you very much, Mr Deputy Speaker. And winding on the motion and amendment, I seek to do two things here this afternoon. One is to make our case for the motion and amendment, and also then is to reflect on the debate, which was, from my viewing, good-natured until a short while ago. The current voting designations and the structures within this place as the Northern Ireland Assembly is, for me, based on a society that was very much different to the one we live in today. And let's recall what life was like back in 1998. Titanic was released in the cinemas. Google was founded. Britney Spears issued her debut single. Jerry left the Spice Girls. And also, most importantly for me, there was very few legal protections for LGBT people in Northern Ireland. There was no civil partnerships. There was no equal marriage, never mind. There was no equal age of consent. It was a very different society. It's a very different time in Northern Ireland. I supported the Good Friday Agreement, and I still do that here today. I was proud to campaign for the Good Friday Agreement, and I was glad to see the yes vote as such a high majority. Certain aspects of the Good Friday Agreement all of us supported, some of which we had concerns on. Some of us were on the other side of the debate, and we argued in relation to that. For me, as a gay man living in Derry in 1998, seeing Section 75 included within the Good Friday Agreement was a monumental change. It was about public policy changing to embed equality of opportunity within the public sphere. It's the first time it ever came on the horizon. And I had hope for the future. But I also realised that the institutions which were established were reflecting a time and a peace process that we were within. And I can remember probably about a year ago the troubles and the issues that were occurring in relation to that. But the rules within the Good Friday Agreement and within these institutions have not been updated to reflect the new modern society. And it's not just Northern Ireland that has these issues. I remember visiting Sarajevo about 3 years ago and meeting up with LGBT organisations within Bosnia-Herzegovina. They live with the same structures as a result of a post-conflict society which very much embed division and inhibit decision-making. And they're a community which wants to be heard and wants to have institutions that reflect the modern society that is evolving in Bosnia-Herzegovina. I'd like to see us do that here today. And if it's not to be today, then when is it? We do need to have change. It really does seem to me, in many aspects of this place, is that the institutions have been stuck in analogue and have yet to move to digital, whilst the rest of society has. The reality here is that not all votes are treated equally within the chamber. Yes, when we have a vote in relation to this, the numbers will count. But when there's cross-community votes, for example, in relation to the budget, or when a petition of concern is tabled, my vote doesn't count the same as others, because it requires a cross-community consent for that to pass. I don't think that's right. The system is also ingrained towards deadlock and perpetrating division. We've only got to see the way these institutions work. To try to get even something onto the executive agenda to actually get things through is very, very slow. And people outside are frustrated with that because they want government to deliver for them. The thing that sticks with me is when my colleague was elected as MP for North Down, Stephen Farry, the first thing I did was, upon being installed as MLA, and it's a great privilege to do that, I was asked to designate. You don't ask to do that in any other job. You're asked what's your name, you get your staff pass, you get shown around the building. Here you have to put down whether you're a nationalist, unionist or other. Yes, no problem.
For those of us who sit in these benches who are very proud to be unionists, and those on the other side who claim to be Republicans or nationalists, do you not understand the confusion that there is for some of us? When you come in here and you don't align as unionists or nationalists, but out there, your members clearly in the public domain, and the member for Strangford can shake her head, but all she likes, but clearly in the public domain declare themselves as being support of a united Ireland. Some members in your party have done that recently.
With respect, it's not a point of order. It's a point of debate, arguably, but it's not a point of order.
I thank the member for his intervention. And I understand the point he's making. Many people in society in Northern Ireland identify as many different things: unionist, nationalist, Republican, loyalist, gay, Northern Irish, whatever. That's fine. I think it's really important that people are able to have those identities and are able to freely express them. The issue is that when you actually come in and you're elected by the people, there's a legal requirement for you to designate as that and for the voting system to be based around that. And that's where the issue we have in relation to how this chamber works and how every single person's vote counts fairly and equally within this chamber. The amendment which we've tabled does acknowledge that the AERC are dealing with this matter. It's a letter we received from the committee at the end of last week. We think it's important that this work is done by the end of the mandate and that change is delivered. We also think, and it speaks to the amendment, that the UK Government legislates in relation to this. There's little point in AARC debating the issue, this House potentially coming to a consensus on that, but then no progress. People want to see action in relation to this. And that comes to the next point, which is just summarising some elements of the debate. In opening the debate, Kelly Armstrong referred to the fact that we can't be kicking the can down the road. I tell you, if there was an Olympic game for kicking cans down the road, the Northern Ireland Assembly would win that. We need to be able to complete this work by the end of the mandate, and we need to be able to give decisive leadership in relation to this. And as was outlined by Kelly, where there is a will, there is a way. We can do things here. We can change things. I'll also come on to, and I'll not be able to go through all the speakers because it was an extensive debate. Paul Frew, in contributing to the debate, made the case for reform. I agree with him. There is need for reform. One clear area of reform is in relation to the St Andrews Agreement. We're now living with a situation, day by day, there's a debate about who's going to hold First Minister or Deputy First Minister, when in reality it's a joint office. We've been clear as a party it should be referred to as Joint First Minister. St Andrews Agreement unpicked some elements of the Good Friday Agreement, and we're now living with the consequences in relation to this. And I'll speak to some elements of what the SDLP referred to in their amendment in terms of going back to what is the factory settings of the Good Friday Agreement. I don't want to go back in Northern Ireland, I want to go forward. And that's very clear. So when I see comments about wanting us to go back to 1998, I don't want to go there. It's not a great place, to be honest. I want us to go forward. But in relation to the yeah. Okay. Yes.
Proceed, Mr. Muir.
Thank you. It's funny how debates sometimes turn to the Spice Girls, but maybe it would be better if they did that a bit more often in this place. The situation is that the process for election of the First Minister, as a result of the changes in the St Andrews Agreement, were done for pure electoral benefit and electoral benefit alone. And we need to be able to address that, because we can't continue the constant instability in relation to our institutions. We're very clear in the Alliance Party. We want the First Minister and Deputy First Minister, Joint First Ministers more like, to be elected beyond the designation system. And strange enough, there's some consensus emerging. We don't agree with the mandatory coalition. We support a voluntary coalition, and also an element which has been lacking in these institutions, which is a thing called collective responsibility. And a comment was made just in relation to the institutions. You know, governments need to be held to account and to be held accountable. And obviously there has to be a consideration within AARC in relation to the issue about designations, and also I understand they're considering FM-DFM. But there also has to be in due course in relation to mandatory coalition and voluntary coalition and the benefits of that. Robbie Butler, and he's not in the chamber at the moment, says he wanted examples where others are not treated equally. And our advice is that since these institutions came back in January 2010, there's been 11 cross-community votes held within this chamber. And what happens in those votes, largely in relation to budget bills, because there's a requirement for that to occur. When those votes occur, myself and my colleagues will vote, but really they don't count unless you can get cross-community consent. And I don't think that's right. I just think that it's important that those votes are actually counted. John O'Dowd also made a point in relation to equality and power sharing. And what I would like to say, and I've got about a minute left to speak, is that you can have all the structures you want. We can reform all the structures here as a result of this motion. I would strongly make the case for that, because we need to have good fit-for-purpose structures. But you also need to come to the structures in the spirit of partnership and power sharing and respect. And that's what we need to do. So we can build and we can have negotiation processes and different deals and all the rest of it. But we also need to come into this chamber in a spirit of wanting to treat each other equally and to be able to work together. And that's crucial. So I would make that point alongside what we're proposing here today. And Dolores Kelly from the SDLP was making the point that in relation to the Minister for Justice, can I say in 2011, when that post was up for election, it was counted as part of the DeHunt mechanism, and there was a cross-community vote for the Justice Minister, and that's for this House to decide the way forward in relation to that. But that was a process that we agreed within this Assembly. I've already covered Jim's support for voluntary coalition and the need for us to be able to consider a way forward in relation to that. But lastly, I'll just touch upon some of the points that Jerry Carroll pointed. Some people may see this as the Alliance Party coming in relation to this, but it affects other parties, and I would urge people to consider the amendments and motion here today. Thank you.
Thank the member. Before I put the question on Amendment 1, I would remind members that if it is made, I will not put the question on Amendment number 2. And the question is that amendment number 1, standing in the name of Kelly Armstrong, Andrew Muir and John Blair, be made. All those in favour say aye. Aye. Contrary, no. I think the ayes have it. The ayes have it. And the question is that the motion standing on the order paper be agreed. All those in favour, that the motion as amended be agreed. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. Thank you very much. Members, take a easy moment, please. Okay, members. Meeting has resumed. Next item on the order paper is a motion on the impact of Department for Infrastructure Planning guidance on rural communities. I'll ask the clerk to read the motion. Please read the motion.
That this Assembly acknowledges that the planning system must be sustainable while also working for our rural communities. Notes with concern the recent publication by the Department for Infrastructure of Planning Advice Note, Implementation of Strategic Planning Policy on Development in the Countryside. Further notes the concerns expressed by the Ulster Farmers Union regarding the new planning guidance. Recognises that the new guidance could have a significant negative impact for many people hoping to live in the countryside, and calls on the Minister for Infrastructure to withdraw immediately the planning advice note and to engage meaningfully with local councils regarding the very real concerns of people in our rural communities.
Thank you. And I call Emma Sheeran to move the motion.
William Buggy, I'd like to move it.
Thank you. And the Business Committee has agreed to allow up to 1.5 hours for this debate. The proposer of the motion will have 10 minutes to propose and 10 minutes to wind. All other speakers will have 5 minutes. Please open the motion, the debate on the motion. Thank you.
Gurmagat, Kincorlia. I should say that we obviously tabled this motion a number of weeks ago in a bid to encourage the Minister to listen to our concerns, which reflected the huge amount of anguish and stress that her plan had caused within our rural communities across the north. So I was of course delighted to see on Friday evening that she made the right call and has rescinded this advice note. At the outset, I want to sincerely thank the Minister for this change of heart, because your prior insistence that the note wouldn't change anything was deeply concerning, coming as it was in direct contradiction to the feedback that we were receiving from planning agents, committee members across the north and senior planners alike. As soon as the plan was issued in the summer and the ramifications of what it was going to mean for those attempting to build a home in their local community became clear, our Sinn Féin team sprung into action. In Mid-Ulster, the constituency that I represent, Councillor Sean McPeak took the lead for us, and as a member of the planning committee there, called for a special one-item meeting, out of which came a cross-party letter calling for the Minister to rescind the note. I cannot overstate the amount of communication I have received in relation to this one issue. Rural housing, as we all know, is in short supply. We don't have enough social or affordable housing in our rural communities, and oftentimes people are paying extortionate rents that they cannot afford in houses that they would rather not be living. Saving for a mortgage deposit is a massive burden on many of our hard-working young people, and the cost of short-term renting lengthens the time it takes to buy or build the home that they want to spend forever in. I'm 29. I'm at that age where random nights out rarely happen, but have been replaced by a full schedule of baby showers, hen parties, weddings and housewarmings. Many of my closest friends are in the process of building or have built their own homes recently, and I've seen at first hand the stress that this incurs. Before they've even had the first fight with their partner about where best to put a wall socket or which colour of kitchen cupboard will date soonest, they have to go through the planning process. Months and months of waiting, perhaps redrawn plans, conversations with architects and DFI road staff, and a new understanding of the term splay. Having been involved in constituency work and activism for years, I've been aware of these issues for some time. I've frequently taken part in site meetings with would-be homeowners who are stressed to the max, trying to find a suitable spot for their forever home and working out solutions to problems between their idea of a house and the planning policy to which planners and councillors strictly adhere. This plan would have added an immeasurable burden to an already difficult, expensive and stressful process. I will.
Thank the member. And the member represents Mid-Ulster, a rural constituency similar to my own in North Antrim, and you make an excellent point in relation to the difficulty and stresses already faced, in particular by young people trying to go through and seek planning permission. My constituents incur the same obstacles, obviously, as you're pointing out, and I can see the impact that this can sometimes have on the sustainability of rural constituencies in terms of the withdrawal of rural services and sometimes the threat to closure of rural schools, resulting in the unsustainability of these rural communities. Does the member agree with me that had this planning advice notice been implemented, that would have compounded those difficulties, and even in my own constituency it would have compounded it even further because of the wastewater infrastructure restrictions that are currently reducing planning opportunities in at least 7 towns and villages in North Antrim?
I thank the member for his intervention, and and I do agree with the point that has been raised, and of course I've worked with constituents that have the same issue, and problems with wastewater is something that we're dealing with all the time. When you refer to the sort of doubling down in barriers that this note would have led to, the change that would have been implemented in relation to dwelling houses built in connection with farms is one of the biggest problems that it posed. The new requirement was going to mean that in most instances the only place that would satisfy the guidance would have been in the actual yard. And as somebody from a farm and familiar with the realities of any working yard and how much that fluctuates over the course of the year between lambing, calving, saving fodder and all of the other seasonal tasks that must be completed, the impracticalities of this need not be spelled out. Furthermore, as pointed out by the Ulster Farmers Union, the hazards on a farmyard are many, and it would be incredibly dangerous to expect a family to dwell within the yard. We can probably all think of examples of sad tragedies that have happened as a result of an incident with slurry or livestock or heavy machinery, and as tractors and yards get bigger, these risks only increase. On top of that, it's almost impossible to get any lender to offer a mortgage for a new building within the confines of a working farm, meaning that this guidance was totally unworkable for farming families. This would have had far-reaching and obvious implications for our rural economies, in that it was removing the viability of family farms going forward, preventing people's ability to live close to their livelihood, and therefore acting as a barrier to young people carrying on the farm. We know that 100,000 people are employed in agriculture across the north. If you prevent them from having homes, how is this going to be maintained? And it's not just active farmers that would have been impacted by the guidance. The change to the definition of buildings that would constitute an infill, the tightening of criteria around clusters, would have ruled out many of the homes that we currently see dotted around our countryside. Our planning policy needs to be sustainable, environmentally friendly and in line with the natural Irish landscape that we occupy. Sinn Féin are clear on that. But it also needs to deliver homes for rural dwellers. People from small countryside communities should have the option of building a forever home and raising a family, if that's what they wish to do, in the community that they come from. Every single week, without fail, I am contacted by at least one, but usually several, families about care packages. A total breakdown in the delivery of community care and the rising costs of childcare have colluded to create a situation where daughters and sons are picking up the slack when it comes to care for elderly or sick parents. Grannies and grandas are babysitting a couple of days a week. Pickups and drop-offs are being done by whoever is available. If people aren't able to build homes near their families, then this ad hoc arrangement becomes impossible, ultimately adding further strain to the health and social care system. Aside from the practicalities from a necessary care perspective, we all know the importance of human connections and how beneficial conversation and relationships are for all our mental healths. Rural isolation, on the other hand, is a massive barrier to emotional well-being. If people can have family members living nearby, able to drop in for a cup of tea of an evening without formal plans, or as we would say in South Derry, call in on your céilí, their mental health will naturally be stronger. If COVID-19 has brought us one positive, it is the introduction of widespread working from home, flexible working arrangements. For many rural dwellers, the ability to work from home meant the escape from a 2 or 3 hour daily commute, extra time with family, more daylight hours to enjoy, more opportunities for exercise and just overall better standards of living. It's also made many think that living near to their home place, as opposed to living somewhere they would rather not be just for the sake of their work, would be a better choice for life. As remote working becomes the norm and there is less requirements to be in city office spaces, we need to ensure that people have the option of building where they would like to. So I am relieved to hear that the Minister has listened to our voices and is now going to consult with councils and planning officials about any change to guidance, which is what was missing from the first attempt of the PAN. I would encourage open and honest feedback around the issues of planning to make sure that it is working for our rural dwellers. I commend the motion. Gormagat.
I call Jonathan Buckley.
Thank you, Mr Deputy Speaker. And to say that I suppose that this is a bizarre debate would be an understatement. I think it's the first one I've ever been to whereby we've already achieved the outcome before we debate the motion before the House. But nonetheless said, I agree and support the sentiment of the motion. There's no doubt an element of an embarrassment towards the Department in relation to this issue, because despite continual calls for a rescinding of this PAN, we were told that that could not happen, both by indeed the Minister and indeed by officials. But it is nonetheless, and I will stand and say I welcome the fact that there has been a change of thought, because this is an issue that not only committee members cross-party found great hassle with, but indeed many of our local councils and our constituents. So I welcome the change in policy, and I think it's now an important moment to step back and see what we can do to ensure sustainable rural development in the countryside. I think this motion today, and indeed the actual subject matter, that being the PAN, is an example of strong cross-party working within committee, because the committee sought from the very beginning to engage, to gather evidence from the relevant stakeholders, scrutinise both the Minister appeared before the committee and indeed planning officials. And I believe that the committee carried out its duty very thoroughly when approaching this matter, and also called on Wednesday past and supported a motion to rescind the planning notice. But it's important that we as a House recognise that the body of evidence that there was against this particular plan, Ms Sheeran has mentioned some of them. Our local councils in particular, very strong representation from the Mid-Ulster Council in relation to this issue. Armagh City and Banbridge and Craigavon Borough Council talked about this plan does not only clarify and re-emphasise the extent of policy provisions, but it represents its change to existing policy on the grounds that it introduces new material considerations for planning authorities in their assessment of development proposals. This type of representation is the same running theme throughout many of the councils that replied to the committee's call for their experiences. And I think this is something that troubled me the most, because while we were hearing from officials, and indeed the Minister, that there was no policy change, there was quite clearly an interpretation from local councils that that change had occurred. And it occurred in terms of CTY 8, PPS 21, because no one can point us to a situation whereby if the Minister and indeed the officials say that there was no change, the fact that CTY 8 makes no distinction between different types of buildings, but yet the PAN attempts to exclude from the term building certain types of building, quite evidently is a change. So that was something that the committee took quite a considerable degree of concern with, and I'm glad, following representations from those organisations, we have been able to all collectively find the outcome that was desirable, because it wasn't just councils. Strong representation from the Ulster Farmers Union in relation to this matter, the effect that it would have on those young people affected by mortgages, and indeed also the impact that it would have on those farming families that wanted to stay within the rural landscape and their local areas. We also had a very strong representation from the Rural Community Network. Yes, I will give way, yes.
Would the member agree that this would have caused huge stress to farmers and their families? And in turn, that would have meant, increased mental health issues within the rural communities as well, which would have a knock-on impact on our health service.
Members, an extra minute.
I thank the member for her intervention. She's absolutely right. There's no doubt that there is a psychological impact on people that can't develop and live on the farms in which they've lived up on, or in fact even stay local in terms of the rural connectivity. And I know the member representing a very rural constituency will know this full well about the benefits of being able to help on a family farm or be near elderly relatives. And this policy, in effect, would have had a great impact on that, because we did actually receive some very interesting statistics and information from the Rural Community Network, who showed us over the course of this past 5 years very little changes in terms of trends, an uplift in the number of applicants in relation to this policy, which did ask the question from the committee, why the PAN in the first place? Because one of the most alarming things that I found from the committee evidence on this was that the last in stakeholder engagement, there wasn't a public consultation on this particular PAN, but the last stakeholder consultation was carried out in 2016, some 5.5 years ago. Members, I did not find that acceptable, because when we're dealing with issues, if we take a look over this past 5.5 years, so much has changed in the realms of planning. We have a situation whereby local councils have taken on a degree of planning powers. Their experiences to date were not taken into consideration. So I do have to say that that is something that did concern me as committee chair, and I know it concerned other members, because if we are going to look at rural planning policy, there needs to be an in-depth stakeholder consultation. And I do welcome, by means of the Minister's statement on Friday evening, that the Department now intends to take that relevant stakeholder engagement now, whether that be with local authorities and other stakeholders, to ensure that we get a sustainable policy that indeed helps rural dwellers and takes into consideration their needs and aspirations. So I support the motion. Thank you, Mr. Speaker.
Thank you. Can we bring Cara Hunter's name onto the screen, please?
Thank you.
Okay.
Thank you, Mr.
Thank you.
Deputy
Invite
Speaker.
the member to make her contribution. Thank you.
Thank you, Mr. Deputy Speaker, and I welcome the opportunity today to speak in what is my first week as a member of the Infrastructure Committee. I welcome the decision from our Minister to instruct her officials to remove the planning advance note on development in the countryside. I know she has listened carefully to rural voices and particularly to her SDLP colleagues, those of us who represent rural communities and rural constituencies. While I know many in our rural communities understand the intention behind the planning note was well intended, that it was simply to help provide councils with certainty and clarity over the current SPPS. And I have heard clearly from the Minister and her officials that there is no change in policy. Yet, notwithstanding that, I recognise and I welcome that the Minister recognises that rural communities felt the plan added confusion rather than clarity. Concerns have been raised and members acted across this chamber. They will hopefully and undoubtedly be grateful that those concerns have not only been heard but been accepted and acted upon. It truly shows the leadership and the integrity in which the Minister for Infrastructure works within her department. And she does so with professionalism and with political maturity, as we have seen so many occasions. As one member of the public commented online that the Minister's action shows depth of character on her part and of course a willingness to listen. Government in partnership, government that listens and government that cares about rural communities is the right type of government that citizens deserve. And I'm pleased today that our Minister hasn't shied away from hard decisions or fair governance, and instead she steps up today as she always has. Thank you.
I now call Roy Beggs.
Mr Deputy Speaker, firstly declare I own 25 acres of agricultural land and farm buildings, and I provide assistance on my mum and dad's farm. I would like to reinforce the view, first of all, that we do need to ensure that we have sustainable development in the countryside. And what does that mean? It means we do have to protect the natural environment, but yet we do also have to try and get the balance by allowing rural communities, rural schools, churches, the entire community to be maintained. So there's a balance in all of that. The decision of the Minister to withdraw the planning advice note of August prior to this debate indicates to me that the Minister has been listening, and I thank her for that, and perhaps has recognised that the concern that there is in the community out there, but perhaps some of the difficulties have been caused by how some have been interpreting legislation and guidance. But nevertheless, in bringing about changes, it's important that there is dialogue and there is understanding and there is consultation, and certainly I wasn't aware of that happening, and it would be helpful if that were to happen before any changes would occur. And in particular, if someone has applied for planning permission in their area under the previous understanding, they will invest it in architects, they will invest it in sites assessment, surveys, and a sudden change would leave all that potentially lost. So PPS 21 was developed to try and get a balance in terms of the need for new homes in the countryside, and yet end what in some areas was unregulated development. There was almost a new home in every field you could see in some areas. So it's important that there is a balance going forward. I noted in the advice given to the committee an interesting graph from the Rural Community Network, which seemed to indicate there was a fairly stable number of planning applications over the last 5 years. I'd be estimating just over 3,500 per year. So certainly I would wish to know what the problem was that the Minister is aware of, that this happened. It's important that there is discussion on this area, but it appears that there was a stable number of planning applications over the last 5-year period. Yep.
Member very much for giving way. I'm sorry I haven't got the document to which he is referring in front of me. He's given there the number of planning applications. Is there a number of planning approvals along with that?
Sorry, my mistake. This was the number of planning approvals. So it was. So that was about 3,500, just slightly over planning approvals each year. So it's important to get an understanding what is the problem. Why did this arise? Now, I am aware under previous planning regulations there was huge variation between council areas, and I picked up comments from my colleagues that there's been differences in how different councils have interpreted even the existing policies. So again, if that is an issue, it would be good to learn of it. I think it would be much better issues had been shared with everyone so we could have a greater understanding of what was happening. And in preparation for today's discussion, I had a look at the planning advice note that was drawn, and I noticed in it there was reference to an emerging issues paper development in the countryside, and there's a web link. That web link wasn't working for me. I don't know if the items have been removed, but again, if there are issues there, I would wish to know what are the issues going forward. It's important that we all understand and we get the balance right between the need to sustain communities and need to protect the public in terms of the natural environment. And we all have seen in areas in the past where almost a streetscape is developed along some rural roads. So there does have to be balance, there is a need for it, but yet there is also a need for flexibility. And in particular, as some others have mentioned, it is important there is flexibility on genuine health and safety reasons, that issues such as slurry tanks, middens should be taken into consideration, so that those applying for sites should not be forced to look adjacent to them. And if there's not suitable sites, there is a need to be flexible going forward. And again, I think that there was provision within that in the past. I hope there will be provision for flexibility going forward. Equally, if sites are serviced via busy farmyards, that's a very practical health and safety issue, particularly new homes may well mean new families and young people. So it's important that sites can be identified which will not have those risk factors to those who wish to live in the countryside. I think this is an issue which I suspect will come back again, and I particularly would highlight the issue of climate change. Many are advocating a very speedy movement towards climate change legislation. I suspect this will be one of the areas that will be affected going forward for climate change, because of the effect of building additional houses in the countryside and of the effect of additional transport required for building houses in the countryside. So I think, I suspect that this is an issue going forward. It would be helpful if the Minister and officials would brief us all on this, and that members will understand that there will be balance in everything that they do going forward, whether it is in terms of building houses in the countryside or seeking climate change legislation.
I call Andrew Muir.
Thank you, Mr Deputy Speaker. There's quite a lot I wish to cover over the next 5 minutes, so I will try to rush through this. A lot has changed since the motion was tabled, and particularly in relation to the statement on Friday evening from the Minister, which stated, regrettably, rather than bringing certainty and clarity, as was the intention, the PAN seems to have created confusion and uncertainty in this case. It's regrettable that we're in the situation we are here today, but hopefully this debate can be constructive in terms of shaping a way forward. The Alliance Party come here today in relation to this debate as clear supporters of PPS 21, like other parties were when it was brought forward. We believe it's important that the SPSS is upheld, and all it takes you to do is take a trip around Donegal to see why. Whilst there are actions being taken in relation to that situation, and the bungalow blight as has been termed in relation to Donegal, it is unfortunately, in my view, too late. Planning and associated area plans, policies and restrictions are in place for the right reasons, and that is to protect the environment. PPS 21 was brought forward in the context of PPS 14, and there was political consensus reached in relation to PPS 21. And reading through the Hansard, you can see the debate in relation to that. My own analysis and the other analysis that you would see was that there would be concerns in relation to how PPS 21 has been implemented over the last number of years. But I come here today to this Assembly to make it clear that the evidence base and the case for action should have been more clearly outlined by the Department. The Rural Community Network, in one of their correspondence within my file, states that the Rural Community Network would question why the Department has issued this guidance at this time, and would be interested to hear further explanation from the Department on the timing of the release of this PAN. The Department need to learn lessons in terms of making the case for change and why the planning advice notice was issued. The way that we have reached to today, and in terms of the withdrawal of the PAN on Friday, has, in my view, undermined the case for PPS 21. And also in the letter from the Minister on the 24th of September, which stated, whilst the PAN had been issued, stated, ultimately the interpretation, relevance and weight to be accorded to all material planning considerations, including this advice, will be a matter for each planning authority to determine in any individual case. I'm clear that by issuing a PAN, but then issuing that note, there's a conflict in relation to the Department's desire to be able to deal with the issues around this. Let me be clear, we're going to be coming back to this. There's a clear issue in relation to how PPS 21 is being interpreted by the district councils. So there will be a need for another plan and advice notice, but hopefully the lessons can be learnt in terms of what happened in relation to this and how we go forward. Yes.
Thank the member for giving way. And on that point, would he recognise that the overwhelming body of evidence received by the committee, with the exception actually of Belfast City Council, whose geographical location meant they were dealing with very little applicants in this regard, overwhelmingly negative as to the PAN's release? So would the member agree with me that it's going to be so important going forward that adequate consultations with those particular councils to ensure that we have an informed, rural and sustainable policy going forward?
Members, an extra minute.
Yes. In relation to the planning function within the department, there is a need for change. There is an issue in terms of systemic fault in relation to our planning system in Northern Ireland. The first quarter of 2021-22, the average processing times for major applications was 53.6 weeks compared to a target of 30. Some regionally significant applications have been waiting over 10 years for determination. Hagan Homes recently announced they're pulling out of Northern Ireland because of the delays in our planning system. I hope personally that the review of the 2011 Planning Act will deliver action, and also the forthcoming Northern Ireland Audit Office report will be a useful contribution. But change is required, and frankly the issue of planning and the reform of the planning function needs to be higher up the priority. There was concerns raised in relation to the PAN, and it's important that they are noted and they are given airing here today, particularly in relation to financing of new homes and also in relation to the clause with regards to health and safety. On the 1st of June 2020, the Minister for the Environment, Edwin Poots, when issuing PPS 21, came to this place, and Hansard records him as saying, "I revised the policy to allow for an alternative site to be used where it can be demonstrated there are health and safety issues or that the applicant has genuine plans for business expansion." It's in the record. So there is clear issues with regards to the PAN, the confusion it caused, but also I think there's a need for understanding amongst members in terms of the context for it and the need for us to grasp the reasons why the PAN was issued. The case for change wasn't made adequately enough, and I think that is a key issue of concern. So whilst we may have this debate today, we may criticise the Minister, however good that may feel. It's not going to resolve an awful lot. Maybe we'll learn lessons, but we're going to have to come back to the same issues and we're going to have to address it. Because if we don't address it, future generations will not forgive us in relation to our environment and the planning process which is meant to safeguard it. Thank you, Mr Deputy Speaker.
Nish Éireamar Cathal Boylan hon Cancha call Cathal Boylan.
I go Margaret Liaskan Boylan Lorch Vaver on Ruin Shaw. I stand to speak in favour of the motion and I welcome the debate. And I'm glad Mr Muir came out with what he did, to be fair, because he's opened up the debate as to where we're at. And because there needs to be a broader discussion in terms of rural planning. But I want to concentrate on the PAN today because that's the subject. But I do agree and there needs to be a broader. But listen to Mr Muir and talk. Mr Madlone was there, Ms Kelly was there when we debated the PPS 21. Now, my recollection of what the members said and what happened at the time are two totally different things, because our starting point was PPS 14, which was it was a poor starting point to go about bringing forward a rural planning policy. So I want to give some detail in this because this is vitally important. PPS 21 and the SPPS, there's a number of caveats within the policy that facilitate single dwellings in the countryside. And if you asked anybody in the countryside, they're saying to us, and have said for a number of years, that it was very difficult to get planning in the countryside. But I do accept some of the arguments around the issue of the PAN in terms of evidence. Because if it was a case that there was a number of houses being built in the countryside and we were being overwhelmed, well then I would accept the debate to bring it to the floor and have that debate. And we certainly had a good debate in the committee the other day. But I want to go back to the PAN because the PAN attacks three elements of the policy. CTY2A, clustering, CTY8, gap and infill, and CTY10, which is farming and dwellings on farms. That's what it attacks. And the member who moved it on behalf of the party, fair play, she outlined every one of those things in terms of interpretation. And I'm not arguing the case where the PAN, it's a case of the policy, they didn't change the policy. It's about a change of direction, because what the PAN was clearly saying was we can't be in a situation where 5 or 6 years ago we transferred planning powers down to a local authority, giving them the autonomy to make decisions, albeit I accept that within the 2011 Act there's elements within it in terms of guidance, if the department brings forward guidance, that they are to adhere to it. But in most cases, the councillors and the planners, the architects, Ulster Farmers Union, Rural Community Network, applicants, all those people are at the front line, the cold face of all this. And they're dealing with these people day and daily. Now, if you're saying to me that there shouldn't be a wee bit of flexibility because planning policy is down to subjectivity and interpretation, if you're saying to me then, and I welcome the ministers, I forgot to say at the start, withdrawing the I welcome that, but I think there's a broader discussion to have. Whether or not I would agree with Mr Muir that we're going to bring another PAN, that's a slightly different issue, but I'll not fall out with the member today. Yeah, certainly.
Remember, accept that the climate change bill, whether number 1 or number 2, will have bearing for everything that happens in Northern Ireland, including where homes are built.
Members, next minute.
Thank you. Well, Mr. Beggs, I prefer to speak on the PAN today, because that's the most important thing. But what we are saying here, and I don't want people to get into this, this is not an urban versus rural issue. Because see, if you look at those caveats, we're talking about infill sites here. We're not talking about open countryside or rural remainder and in the big green open fields. Because if that was the case, if we look at a local development plan, we take 4 or 5 acres of ground on the edge of a town, every town, and you build out. We can't even afford the suit. All the infrastructure. People's crying out over the last number of weeks. So if we get into the broader debate about it, but what I'm saying, Minister, is when you look at the single caveats, we had the debate in terms of farm dwellings. They couldn't get building beside middens or anything else, so the mortgage company wouldn't allow them. So there's a wee bit of flexibility in where they built. That's what happened. That's in terms of single farm dwellings. That was the flexibility. So we cannot be saying we transferred the powers to council and all of a sudden, no, folks, this is the way you've got it wrong for 5 years, so why don't you go to a different direction? We have to work with councils. And I would appreciate the Minister go down and have an... Yeah.
Does the member believe that an effective rural planning policy is important for the vibrancy of our towns and our villages and rural communities?
No, absolutely. This is about sustainability of rural communities. That's what it's about. And if you look at the PPS 21, that's the first thing it says. Sustainable development in the countryside. So let's not turn this into an urban versus rural. These people contribute to rural communities, contribute to GEA, all those associated with rural communities. That's what it's about. And I would hope that the Minister takes the time to engage, and no doubt the committee will have a responsibility to engage as well. But let's go down after 5 years of councils and planners dealing with it on the ground, on the cold face, and let's have a broad discussion on it. Okay, with that, Gurmil Muggett.
I call William Irwin.
Thank you, Mr. Deputy Speaker. I welcome the opportunity to contribute to this debate today, and it is certainly an issue that has been widely discussed out in the wider rural community, local councils, and also obviously amongst those assisting in planning applications from an elected representative perspective and from consultants and indeed architects. The intervention by the Minister through the planning advice note has not been well received across a number of council planning committees. And I know that locally in Armagh, Banbridge and Craigavon Council there has been a number of discussions and the general expressed opinion within the committee has been against the Minister's intervention. Intervention has generally been seen as unhelpful and has in effect created a new policy despite Minister Mallon stating that it is a mere reinforcement of existing policy. I do not conclude that this is the case, and even senior planners are stating that it amounts to a change in policy and it has affected their consideration of applications currently in the system. The fact that over the weekend the plan was retracted is of course welcome, and the immediate effect of that retraction from my own perspective was to receive an update that a constituent's application that had been designed to be refused under the facts of the plan and advice notice would now be approved. That was the impact of this plan and advice note. It is simply not good enough that the Minister showed this much confusion in the first instance in issuing the advice note, as whilst Minister Mullen urged that it was not a change in policy, it very much was a change in policy, as my experience with an application this week has shown, that constituents' plans were in disarray following the Minister's issuing the plan. And indeed, one case officer told me that before the note was issued from the Minister, this was clearly an approval. What this means for all the decisions taken across the province in line with the plan remains to be seen, and it will be up to the Council planning departments and committees to deal with this aftermath, an entirely avoidable situation, of course. Building in the countryside is already rigid in terms of policy and opportunity, and it is difficult enough to meet the requirements for someone wanting to remain in the countryside, and we must always be mindful of the need to sustain rural communities rather than limiting opportunities for rural dwellers and our rural economy. Instead of issuing what was monumentally unhelpful advice, the Minister would, I feel, be best placed in dealing with existing policy shortfalls, such as the fact that the policy around CTY 10 for housing on a farm will not show latitude in house placement. I know that many farming families have been put in very difficult situations whereby planners have insisted that a house has to be located to cluster with existing farm buildings, which has meant mortgage providers won't lend the person money as they would view the house as unsellable, or, for instance, it has a shared access. I've also represented constituents who have been able to demonstrate a much better site close by, much less visible in the surrounding countryside, yet planners will not countenance such an option as it does not sit within the existing policy. I do not understand why the Minister does not focus on these situations and provides advice notes to planners to be able to respond sensibly to applications in such circumstances. There is much better site, if a much better site exists close to the farm, which will allow a young family to access financial aid through a mortgage in order to build their home and sustain the rural economy. Withdrawing the plan was the right decision, and hopefully in the future the Minister can regain focus on sustaining our agricultural industry and rural infrastructure and the wider rural community. I have said for some time that changes are needed on the policy around housing on farms, and even planners have stated that it would be better if a policy allowed a decision to be taken on a suitable site on a farm rather than being forced to place a house beside farm buildings. These are the issues that the Minister must begin to address. Thank you very much.
Members, as this is Deborah Erskine's first opportunity to speak as a private member, I would remind the House that it is convention that a maiden speech be made without interruption. You're very welcome indeed, Deborah. Please continue.
Thank you, Mr Deputy Speaker. I rise to make my maiden speech, and I do so with a great sense of pride that I represent Fermanagh and South Tyrone. Before I move on to speak on the subject on the order paper, Mr Speaker, I would ask that you give me some latitude to pay tribute to my predecessor. It may surprise some when I say this, but standing here today is tinged with some sadness. Because me being here, it means that the Right Honourable Arlene Foster is not. And this House has lost one of its greatest Assembly members. However, I want to pay tribute and thank my party leader, Sir Geoffrey Donaldson, for this opportunity to serve my great constituency of Fermanagh and South Tyrone. Arlene is someone I will forever hold in the highest esteem. She was not only my boss, but a friend, and a friend to many across this province. And I thank her for the encouragement she has given to me in my political career thus far, and for the vision she has for Northern Ireland and its place within the Union. Arlene and the people of Fermanagh and South Tyrone are the reason why I stand here today. And I join with my constituents in Fermanagh and South Tyrone in thanking her for her service and dedication that she has given to both Northern Ireland, its people and the Union. Furthermore, I want to thank the members of the Assembly for their welcome and support in the last few days. You have certainly made my days in the Assembly that little less daunting, and I want to thank you for that. Mr. Deputy Speaker, on the matter before us this afternoon, I want to acknowledge the Minister for rescinding the planning advice notice handed to councils in August. However, it did come after mounting pressure against a minister who had not recognised the impact upon rural constituencies like Fermanagh and South Tyrone until now. The note which her department issued on the 2nd of August brought deep worry and deep concern to my rural constituents. I want to be a voice for my rural community, and I will use my time in Stormont to make a difference for my constituents. I represent the most westernly rural constituency in Northern Ireland. You see, Mr. Deputy Speaker, if progressed, this notice would have displaced many people from our rural areas. In short, in the short time I've been an MLA, I had many people contact me who were concerned as to what this policy would have meant for future generations who'd hoped to live on the family farm. Similar to my colleague, Mr. Irwin, I spoke to one constituent yesterday who told me that if this notice had not have been rescinded, their son would have been unable to build his house and establish a life close to the family farm. We already know the danger that working on a farm can present. Imagine working on a farm during lambing season, being called during the night, making a 40-minute trip one way to the farm because you could not build within the countryside. Or indeed, it could have been worse, the successor of the farm moving away entirely, spelling the end of the family farm. Think for a minute upon the deeper and wider implications that would have on rural schools, businesses, the local economy in the West. Many Assembly colleagues might deem these as minimal impacts to progress legislation, but the consequences of proceeding would have severely damaged family networks and access to support. I speak to rural constituents, and they already find it extremely challenging to gain planning permission on farms in the countryside. To have removed all flexibility for local planners to interpret certain criteria would have resulted in a further blow to rural development. Huge concerns have been voiced at the Minister's initial decision. It's very clear that the position of the planning notice was untenable. The infrastructure community, the Farmers Union, the Rural Community Network and other representative bodies all noticed this. However, it took until Friday before the Minister acted, and I pay tribute to the committee for their work on this, as the stress that was caused to rural families was immense. Our rural communities matter. The way of life in rural area does not deserve to be threatened. I trust the Minister will work with me and rural voices in Fermanagh and South Tyrone going forward, before potentially bringing forward further disastrous policies for my constituency. Thank you.
Agnes Éireann Sir Dolores Kelly, Hon Cancha, call Dolores Kelly.
Thank you, Mr Deputy Speaker. And as my colleague Cara Hunter said at the outset, we acknowledge the leadership shown by the Minister because, as you well know yourself, Mr Deputy Speaker, we did raise some concerns in relation to the planning advice note. However, it came about as a consequence, of course, of PPS 14, which was actually initially introduced by Conor Murphy when he was Regional Development Minister and created a blanket plan on all new houses in rural areas. That created a massive outcry and was picked up by Arlene Foster, who then led on PPS 14, which then led, of course, to PPS 21, which was in June 2010 Edwin Poots' responsibility. So, you know, in terms of how we've got here in relation to rural planning in the countryside, it has a very much a cross-party genesis in terms of interpretation, which I think is something which our Minister sought to address in terms of different interpretations across council areas. And members are right to acknowledge, and indeed the mover of the motion was right to acknowledge, the lack of social housing in rural areas. But the last time I looked, that was the responsibility of Deirdre Hargey, you know. So, and there are still many spaces, I understand, within development plans across our villages and rural areas on which social and affordable housing could be built upon. And I, for over 17 years, Mr Deputy Speaker, had the honour of representing a DEA which was largely rural, and I unashamedly used whatever interpretation and loose interpretation and fought back against planners to ensure the people that I represented had the chance to build a home close to family so they could send their children to the school that many of them went to. They could be there to care for parents or grandparents at that time, and also to see that sustainability across our sporting and church organisations within rural areas. And I know that environmental campaigners at the time, even of PPS 21, which was fairly rigid in terms of its application, were saying it wasn't good enough. So there is a balance to be struck, and that has the eternal argument, and is even much more sharper focus now in terms of climate change and the needs of rural communities. And the two should not, Mr Deputy Speaker, be losers. We should actually be able to create a win-win. And some speakers acknowledge the fact that that there's a slowness in terms of planning applications. I think it was Mr Boylan said that, but that falls back to the time in which the transfer of functions went from this place to councils, where responsibility went to councils but the resources didn't. And then, of course, in more recent years, we saw the voluntary exit scheme, and we saw many of our experienced planners leaving under the voluntary exit scheme, the same as within road service as well, because I was surprised and shocked at how many people that I had built relationships with up over many years in those departments had gone onto the voluntary exit scheme. So it is a challenge, and a challenge in a period of austerity as well in terms of getting enough officers, but it is the responsibility of councils to employ planning and to speed up the process. The biggest difficulty we're faced with, certainly within Upper Bann constituency, and I've referred to it before, is the area plan, Area 1 and Area 2, where some areas are held back in terms of the development under the area plan. Of course, area plan is also a responsibility of local councils and not the department. So there's much work to be done across planning. It doesn't fall at the Minister's door. It falls very much to our colleagues across all of the local councils. And it also falls, I think, in terms of finance and what money we're given to councils through finance, through here in terms of the rates, to allow them to employ more planners to actually get caught up, because we all know the importance of the construction industry to the economy here in Northern Ireland. Mr Deputy Speaker, I'd finish on acknowledging the leadership role shown by our Minister. It took a judicial review for PPS 14 to be scrapped, and for PPS 21 to be introduced, not to be scrapped, but to be amended. And there's no doubt there's work to be done, and we would like to be part of the conversation going forward on how best to marry the needs of climate change and those challenges posed there, and indeed in terms of rural community sustainability. Sorry, I was just on a train of thought there and I couldn't get away.
Okay, I now call George Robinson.
Deputy Speaker, and first and foremost, I'd like to congratulate my colleague Deborah on her excellent maiden speech. Mr Deputy Speaker, the number of concerns expressed to me regarding the negative impact of this planning advice note is very clear to me due to the number of conversations and phone calls I and my office have received. It is very apparent that rural dwellers, architects, farmers and others are united in their concern at how this planning advice note has impacted on rural communities. As there is no change to Planning Policy 21, the question has to be asked why the planning advice note was issued in the first place. Minister, I would suggest there needs to be a fresh consultation carried out with all interested people before issuing a PAN notice which only emphasise, I quote paragraph 12 of the notice, that everything has to be resolved in line with the SPPS. This is why I ask that the PAN should never have been issued in the first place. I firmly believe that there needs to be a positive and sensible approach to development in the countryside. Therefore, it is important that policy meets requirements. There can be no doubt sensitivity must be used with rural planning applications. This should be to provide a positive and beneficial policy which will help people who wish to live and work in the countryside while offering the protection to the environment that is also required. My conversations across a range of interested parties leads me to believe that current policy, reinforced by this PAN, has led to a situation where rural building is almost demonised. People needing or wishing to live in the countryside should be assisted when possible with a change from mindset to refuse to a situation where a positive approach to aid applicants is developed. To achieve this, we need a new consultation. Minister, I am glad that the PAN has been withdrawn and common sense has prevailed, so that rural dwellers in future can be assured of a more positive future. And could I also commend the Infrastructure Committee, led by my colleague Mr Buckley, for bringing this planning issue to a satisfactory conclusion. Thank you.
Agus an éisiarm said in Ira on Fragarha, I now call for the Minister to respond, and the Minister will have up to 15 minutes.
Thank you, Mr Deputy Speaker. And first of all, I would like to thank the members who tabled this motion, and I would also like to thank everyone who has contributed to today's debate. Planning and the issue of development in the countryside specifically has been and continues to be, as we hear today, the subject of healthy debate and discussion. Engagement on this planning issue and planning generally is to be encouraged, and I very much welcome today's debate. All members, Mr Deputy Speaker, spoke about the SPPS at the heart of this, and I think it's important that we take a moment to reflect on its origin. Existing strategic planning policy on development in the countryside is contained within the Strategic Planning Policy Statement. You will be aware that the SPPS was published on the 28th of September 2015, following extensive engagement during its preparation, including public consultation, assembly and committee scrutiny, and it was agreed by the Executive Committee prior to its publication in final form. The important aim of the SPPS with regard to the countryside is to manage development in a manner which, as Ms Sheeran and others have pointed out, strikes a balance between protection of the environment from inappropriate development while supporting and sustaining rural communities. We have also heard today, Mr Deputy Speaker, from Mr Muir and Mr Boyle and Mr Irwin and Mr Robinson that there are differing views on what this means and how this can be best achieved. Subject to acceptable proposals in appropriate locations, the current SPPS offers considerable opportunities for farming families and all other people wishing to live in the countryside. It does this by providing for replacement dwellings, the conversion and reuse of non-residential buildings and dwellings, new dwellings within an existing cluster, infill dwellings, social and affordable housing schemes, dwellings to meet compelling personal or domestic circumstances, dwellings on farms, and dwellings for non-agricultural business enterprise. Following the publication of the SPPS, the Department issued a call for evidence in March 2016 to help inform the scope of a potential review of strategic planning policy on development in the countryside. This attracted responses from a wide range of interests, including local government, environmental groups, business industry, residents groups, professional bodies and individuals. The Department also procured independent consultants in March 2017 to undertake research and provide an updated evidential context to inform the best strategic planning policy approach for development in the countryside. This research involved focused stakeholder engagement, including seminars with council planning managers, professional institutions and environmental interest groups. It also included individual meetings with relevant organisations, including chairs of planning committees and other local political representatives, the Northern Ireland Housing Executive, Construction Employers Federation, the Department for Agriculture, Environment and Rural Affairs, Rural Community Network and the Ulster Farmers Union. This preparatory work and engagement helped inform the decision on the preferred way forward for strategic planning policy on development in the countryside. And on balance, I decided not to commence a review of this policy area. That is because I am satisfied that the current policy approach provided for by the SPPS remains appropriate, robust and fit for purpose for the two-tier planning system. Mr Beggs and Mr Robinson in particular have asked for the reason for the issuing of the PAN. The PAN on the 2nd of August was to provide clarification on the correct meaning and intended application of the SPPS countryside policy and to assist planning authorities in making decisions and bringing forward new development plans. The PAN did not add to or change existing policy, and its advice was consistent with the fundamental regional approach to cluster, consolidate and group new development with existing buildings. But unfortunately, Mr Deputy Speaker, rather than bringing clarity and certainty, as was its intention, the PAN created confusion and uncertainty. And having listened very carefully to and reflected on all of the concerns expressed since it issued, I decided to withdraw the PAN in order to restore clarity to the situation. I respectfully disagree with Mr Muir that the current SPPS has been undermined. I firmly believe that the SPPS does and should continue to provide opportunities for sustainable development in the countryside in general, including for farming families, as Ms Erskine very eloquently outlined, and other rural dwellers, striking a balance between supporting and sustaining rural communities and protecting the countryside from inappropriate development. I consider that all stakeholders in the planning system have an important role to play in achieving this objective in the long-term public interest. However, Mr Muir is right. There is a particularly important onus on local planning authorities to take all possible steps to ensure that in decision-taking and plan-making, they properly and faithfully take account of the SPPS overall. Similarly, in relation to planning appeals and in terms of the independent examination of local development plans, the Planning Appeals Commission has an equally important responsibility. I want to assure members that I am fully committed to ensuring that my department and the wider planning system continues to play its part in managing growth to achieve appropriate and sustainable patterns of development in the countryside that contributes to a vibrant rural community and economy. As to the future of strategic planning policy for development in the countryside, I am satisfied that the current policy approach remains fit for purpose and should work effectively under the two-tier planning system. And as I have said, I firmly believe that the SPPS does and should continue to provide opportunities for farming families, other rural dwellers and sustainable development in the countryside in general. And again, we come back to the fundamental point. Striking a balance between supporting and sustaining rural communities and protecting the countryside from inappropriate development. Members have asked what the next steps will be and have highlighted the importance of continuing to engage with local councils and with our other stakeholders and partners. I will now take stock of the concerns raised and I will undertake with my officials further engagement and analysis on this important policy area, to include consideration of current and emerging issues such as the emerging climate change bills and our green recovery from this pandemic. I remain committed to ensuring that strategic planning policy for development in the countryside is fit for purpose going forward. And I am grateful to members and others, particularly those from our rural communities, who raised their concerns. I value, Mr Deputy Speaker, our rural communities. I want to see vibrant rural communities. And I want to see sustainable development. I said to those who expressed their views that I would listen. I have listened and I acted. Thank you, Mr Deputy Speaker.
Agus nish Ian Sir Declan McAleer on Jerry O'Cur, Legist Barak there in Wallow. I now call Declan McAleer to wind up on the debate on the motion.
Gurmagat Prevlas Kolya, Jack Bumanja, 10 minutes. Members, at the outset of the debate, I came in as Mr Buckley was speaking, and he was making reference to the health benefits, and he also of planning and getting building in the countryside, and he made reference to the fact that it's 5.5 years since there was a last consultation on the rural planning policy, and that's needed. Another one's needed soon. Carol Hunter broadcast in. She welcomed the removal of the PAN. She emphasised the fact that there was no policy change and that the Minister had taken on board members' views and had made the appropriate changes. Roy Beggs spoke. He emphasised the importance of the need for sustainable development in the countryside. He thanked the Minister for listening and the fact that she removed the PAN, and emphasised the need for dialogue and consultation. He also cited the RCN, the statistics in relation to planning approvals over the past number of years, and he highlighted that there may be differences of interpretation amongst councils of plans and policy, but a flexible approach was needed. He also highlighted the pending climate change legislation. Andrew Moore spoke. He said the Alliance supports PPS 21. He pointed to Donegal as an example where there is bungalow blight and that it would be too late, and we don't want to go down that way. And the policies are there to protect the environment. And he made the case. He said that the department should have consulted on the case for action more clearly, and he did make the case that this will be revisited and become a big issue as to how councils interpret PPS 21 and the change in planning policy is required. Cal Boylan spoke. He said there's a need for a broader discussion on rural planning. He went back to PPS 14 and PPS 21, highlighted some of the challenges people experience in regards to planning. He spoke of councillors, rural groups who are at the front line of these decisions, and he welcomed the withdrawal, and he says it wasn't a rural versus urban issue. William Irwin, he said that the PAN has not been received very well across councils. It has created confusion. He said that there already is a very rigid rural planning policy, and appropriate plan is important for the rural economy. And he highlighted the issue that the UFU had highlighted around mortgage implications and the fact that houses may be seen as unsellable if they are forced to build literally on the farmyard. Deborah Erskine spoke, and I want to acknowledge her maiden speech here as well. And I do remember Deborah as a young journalist down in Omagh at one stage a few years ago, so it's great to see you here in the chamber today, and congratulations on your maiden speech. And Deborah acknowledged the rescinding of the PAN, and that she believed the Minister didn't fully take on board the potential impact of the PAN, and that it caused a lot of concerns. She talked about the importance of appropriate planning policy for future generations, keeping them on the farm, and there's a wider implication for rural communities. Dolores Kelly said that the PAN was a consequence of PPS 14 and 21. She said that there was different interpretations across councils, and also spoke about the need for rural housing, social housing in rural areas, and the importance of getting a balance in terms of sustainable rural communities. She also highlighted the challenge for councils in terms of the appropriate resources didn't go with councils when planning powers went to councils, and also the voluntary exit scheme has resulted in the hemorrhaging of a lot of seasoned or experienced planners, and she also highlighted the local area planning issue. George Robinson says that he had heard many concerns from his constituents regarding the impact of the PAN, questioned why it was issued in the first place, and he said that there should have been consultation before any such decision was made. He says that sensible and sensitive decisions must be made in relation to planning in the countryside, and there's a need for consultation. He commended the work of the DFI committee in highlighting the issue. Minister Mallon then responded to the debate. She says it was a healthy debate and she welcomed it. She mentioned that the SPPS was published in 2015 to manage development in the countryside, to protect the environment while sustaining communities. She considers that there was a call for evidence in 2016, and there was further research carried out in 2017 to inform the development of a strategic planning policy. The Minister is satisfied that the SPPS is fit for purpose. In relation to why did she issue the PAN, she made the point that this was to clarify the implementation of PPS 21, that this wasn't in fact a policy change, but she did recognise that this caused confusion and didn't provide clarity as was intended, so withdrew it. She made that she was committed to a vibrant rural economy and rural communities, and that it's very important to strike a balance between protecting the countryside and encouraging development as well. That was she. Going ahead, she said she will be looking at the potential implications of a Climate Change Act and the Great Green Growth Strategy in terms of moving ahead, and again emphasised her commitment to vibrant rural communities. So that was a summary of some of the main bits. There's a few points just want to mention myself before we conclude. I think summing up today, there seemed that there definitely was a clear rejection in the House here and amongst rural organisations and indeed rural representatives of this PAN. It is very clear that it would inhibit planning in relation to farms, infill sites and indeed to rural settlements. I actually raised this a couple of weeks ago during Minister's question time. The Minister made the point at that stage that this was not a policy change, but rather it was guidance. And that's a fair enough point. But Part 2 of the PAN highlights the point that in Section 8 and 9 it says the 2011 Planning Act states that councils are required to take account of the advice contained in guidance issued by a department. So I do think it's really important that we don't want unregulated planning, we don't want bungalow blight in the country, but we want to get a balance between protecting the countryside and enabling people and families to live there, because people and families give the vibrancy and the heartbeat of rural communities. And the point I made here a couple of weeks ago as well is that in the vast majority of cases, this is young couples. This is young couples who want to start life in the country. In most cases, they want to build beside their home place. Farming people, they want to start a life beside their perhaps aging parents, and they want to start a new life there and be there to support their parents on the farm and as they age. And anyone who's a rural representative will picture that person who I'm talking about, because we've all met them on sites before. And we need people living in the countryside. We need them to sustain our schools, our services, our communities, to give that heartbeat to our rural communities, which are under a lot of pressure, with Brexit and lack of connectivity due to broadband and other issues facing those rural communities. And I should say that whilst the Minister may feel that the SPPS is fit for purpose, and that's a fair enough point, but I will make the point as well that under the SPPS 21, it's one plan in every 10 years. And there's many families in the country, especially farm families in the country, where there might be 4 or 5 or 6 siblings in the house, and one plan permission every 10 years, is extremely challenging. So important that there are also those opportunities, for example, infill sites, renovations, personal circumstances and others. But those are really difficult to get, and it's important that that flexibility remains there around the infill site, for example, around the clusters and on the farm. But I do believe that, obviously this is a debate for another day, but I do believe that there are certain aspects of PPS 21 that does need to be revisited. So in conclusion, I'm glad that the Minister has rescinded the guidance, and like other members, commend this as well. I just want to stress that the importance of consulting, particularly with the local councillors and local councils and the wider rural community organisations, because they are at the forefront and they were the first to raise concern about this here, which we are reflecting. And it's important that in the case of any future guidance being issued, or indeed any policy being issued into the future, that local stakeholders, local councils and public representatives in the wider community are consulted. So, thank you.
The question is that the motion standing on the order paper be agreed. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. Thank you for that. The next item on the order paper is the adjournment. The question is that the Assembly do not... Oh, sorry. Sorry, just allow members to take their ease then before we move on to the next item. No, but it's... I was just ready to move to you. No, that's what he... No, this is procedural stuff that has to be gone through, Joanne. Right, members. Item 5 on the order paper. Okay. Oh, sorry. Sorry, the speaker is there.
Okay, members, item 5 on the order paper is the adjournment. The question is that the Assembly do now adjourn and, in conjunction with the Business Committee, have given leave to Joanne Bunting to raise the matter of social housing need in East Belfast. The proposer of the topic will have 15 minutes, and I call Joanne Bunting.
Thank you, Mr. Speaker. I appreciate the opportunity to bring forward this adjournment debate because it's a topic of great import in my constituency of East Belfast. And from the outset, I wish to pay tribute to Carol, Gary and their staff for their sterling work and their approach to addressing the housing problems we bring to them. Would that the Housing Executive had a few more like them. I'm also grateful to the Minister for Communities for her attendance this evening, and I look forward to hearing what she has to say on the subject. By way of background, day in and day out, my office is contacted by constituents seeking housing support as individuals, families and those with disabilities continue to struggle with their current housing situation. Housing is by far the biggest issue in my caseload. My staff and I hear in detail about the way in which individuals are expected to live in accommodation which does not fit or address their needs, how families are forced to live apart or in cramped conditions, how people sofa surf between family members and friends. We hear from those who will endure almost anything to avoid having to go to a hostel with their children, or in the worst case scenario, have simply nowhere to turn and end up living in their cars or on the streets. Simply put, East Belfast has a housing crisis. There are far from enough social and affordable homes to meet the growing demand and need, and there still aren't enough homes being built to come close to alleviating the problem, which will only worsen as the tower block strategy is implemented. So what's at the root of this housing crisis in East Belfast? Ultimately, it boils down to a lack of affordable housing and a legacy of executive stock being sold off and not replaced in similar numbers. However, there are multiple factors contributing to the lack of affordable housing, which in turn increases the need for social housing. House prices are rising, making it increasingly difficult for people to afford home ownership. People are being priced out. East Belfast is one of the most expensive places in which to buy. Of the homes that are being built, many are beyond the reach of a considerable number of people as the escalating costs to build are being passed on to the consumer. East Belfast is in demand, and demand increases the asking price. That's the market. Private rentals are expensive. More people than ever are renting privately. However, private rentals can also be expensive and unstable, resulting in the constant worry of eviction and sometimes relatively short-term tenancy agreements. Furthermore, there are private landlords who will not accept tenants who are in receipt of housing benefit, thus adding to the number of obstacles for some to overcome. Homelessness is on the rise. Many people are being forced out of their homes altogether, and these individuals can have to wait a considerable amount of time for suitable accommodation and in the meantime have nowhere to go. Infrastructure is at capacity and planning is slow. East Belfast is already considerably built up, and so there is limited space upon which to build. Most development opportunities of late have been in Dundonald, where several new private housing developments have been established. But many of these could not necessarily be classed as affordable homes. While there are several other significant planning applications in the system, again in Dundonald, Water Service advises that the area is at around 95% capacity, which impacts on planning decisions and timeframes for building. Frankly, the roads are no better. Getting through Dundonald at rush hour is not a pretty picture. Use public transport, you might say. Get on the glider. But again, even the park and ride is full. Planning and infrastructure are not this minister's problem, but they exacerbate the housing issue and the demand for social housing that she must address. East Belfast is a superb place to live. I would say, most of us in this room would say it's God's own country. But in seriousness, it really is a great place to live, work, visit and raise a family. It's safe, it has great schools, beautiful restaurants, cafes and takeaways. You're in the city, but only ever minutes away from parks in the country. The city centre is easily and quickly accessible. There are reasonably decent transport links. There are greenways, plenty of local and varied shops. It has a strong culture of close-knit communities, active churches and community groups, many sporting clubs and a hospital. Of course people want to live there. Why wouldn't they? That's always been the case in East Belfast. So naturally it continues to be a housing hotspot with soaring waiting lists. In answer to written questions, the Minister advised me that there are currently 2,572 applicants on the waiting list, of which 1,667 are in housing stress. However, the annual allocations amount to only 451. These statistics alone clearly show that the need for increased, good quality social housing is pressing. Whilst the Minister has already committed to ensuring more social homes are built and allocated where they are needed, and that ring fencing of the social housing budget will be reintroduced to ensure that those areas of acute housing need are prioritised, additional action must be taken to achieve suitable social housing, suitable being the operative word. And I want to outline to her some of the difficulties faced by those seeking social housing in East Belfast. Naturally, people have an affinity with the areas in which they grew up, and mostly we all want to be surrounded by family and loved ones for additional security and family support. However, because of lack of available homes, people who grew up in the area are having to move further afield to different areas of choice just to have a chance at being housed, and in so doing are losing out on that family support network. I know from my own office that this is the case for most young single mothers who don't drive and who struggle with not being able to live close to their support network. So they can be on a waiting list for a significant amount of time in order to receive an offer in an area that they require. More often than not, people are having to adjust their area of choice to afford them a better opportunity of actually being housed. It follows that in settled communities there's high demand but low turnover, and so the chances of being housed are extremely slim. So people will opt for somewhere else because there's more movement, but that's not necessarily where they want to be. I would argue then that this can result in a somewhat distorted perception of where the demand actually is, and consequently skews where social housing should be built. From an applicant's point of view, there's no point in essentially wasting your first preference on an area where there's no turnover, high points are required, and the offers are negligible. We also have a dearth of 4-bed properties in East Belfast. Again, in a recent answer from the Minister, she advised that there are only 187 4-bed properties in East Belfast. However, compare that to West Belfast, where there are 547. So larger families are not catered for in my constituency, and as a result, often people have to move out of the East. Families with this requirement who are determined to stay in the East end up being told to change their housing need to a 3-bed property in order to receive an offer faster. All well and good, but then they have to live in overcrowded and unsuitable conditions. So the choice is wait interminably for a 4-bed which may never come, or be cramped. The other advice often offered is that in order to get a 4-bed property, the family should consider private rental. But that's not always an answer for most because of the reasons to which I alluded earlier, including financial pressures. Again, people choosing to stay to 3-bed to ensure they have a better chance at being homed rather than the 4-bed that they need skews the figures for what is actually needed. Then we have the flats that have been allowed to reach such a state of disrepair that some are now uninhabitable, while the decision on their future renovations has been repeatedly delayed. Properties need to be maintained regularly. The Tullycarnet situation is one such example. The Minister will only be too familiar with the Kings Road flats, and I've raised them with her in the past. She'll have received the photographs I sent her showing how the housing executive tenants are expected to live in horrendous conditions in what are now deemed the flats from hell. Tender prices came in too high, so it was retendered. The spec was lowered, but in the interim costs rose again, so the tenders came in too high again. And in the meantime, tenants were moved to other places. Numerous flats are left empty. The damp worsened and the costs grew. But the decision-making process takes so long that everybody's still in limbo, and the condition of the flats degenerated to the point where for some it is irretrievable. I know work has been undertaken to address some of this, but decisions should be made before flats reach this standard. They should remain habitable until the end. The housing points allocation system has been an issue that I've raised with the Minister previously, not least today at question time. Whilst I understand that the use of intimidation points will be retained for those who need them, there are occasions where the intimidation point system has been abused in order for tenants to move from place to place, thus going to the top of the list each time. This then prolongs the situation for other, sometimes vulnerable applicants who may have been at the top of a list for a particular area right until the very last minute. We've all had constituents in dire need who've lost out on a home in this way. Nobody objects to allocation for true intimidation, but we all object to those who abuse the system. And this leads me to my next point, Mr. Speaker. We have the issue of the lack of sanctions for those tenants who misbehave and who are simply moved from one place to another, causing mayhem wherever they go. This too has an impact on need, demand and availability, because often they are housed before others as a result of a threat, but they also can have such an impact on an area that nobody wants to be housed there, so only the most desperate will go. And those that are left, those who reject that offer, are then left with a strike on their record. An area can get a bad reputation because of a few tenants who make all the rest miserable through willfully bad behaviour. But the executive has no real sanction and must jump through many hoops to be allowed to act at all. All of this takes its toll on waiting lists and requests for transfers. These lead on to the position with over 55s. In a recent answer, the Minister advised that whilst housing associations have stock, the Housing Executive has no stock designated for over 55s in East Belfast. As we age, we feel increasingly vulnerable, and many of our ageing population live in fear due to antisocial behaviour in some areas. These designated and specifically designed services are intended to promote quality of life and to help older people maintain an independent lifestyle in an environment that breaks down barriers of social isolation and promotes overall well-being. From experience, many tenants over 55 on the waiting list will not accept a flat for fear there will be noise or ASB, and they worry that they'll regret their decision to move. I trust the Minister will take this on board and give a commitment to providing accommodation in a safe zone, which is a key objective to actively encouraging residents to maintain their independence as they age. The Department for Communities has approved the demolition of 2 tower blocks in East Belfast in the short term, namely Clarewood House and Kilbrony House. The process will take some time because some residents own their own flats, but numerous others will need to be rehoused, and the waiting lists in East Belfast are already extensive and oversubscribed. Furthermore, the majority of those who will be displaced do want to remain in the area. However, that will be impossible if there are no properties available. The numbers built on the footprints will not likely cover the numbers displaced. Another factor for consideration is properties for those with disabilities. Many individuals with mobility issues are currently residing in unsuitable accommodation and are either on the waiting list for a transfer or are waiting for adaptations to be carried out to their property to make it accessible and safe. These individuals are desperate to regain some semblance of independence, yet their housing situation has not been conducive to their needs. So the creation of improved and indeed accessible social housing must remain a key objective going forward. East Belfast needs quality, affordable homes and more social housing. Of that, there is no doubt. We need modern, energy-efficient, future-proofed properties in locations that suit true need and true demand, and this includes for our elderly and disabled population, our over 55s and larger families. I trust that the other East Belfast MLAs in this House will agree that East Belfast is in desperate need for social housing for our constituents, because they deserve the best. I've previously written to the Minister to ascertain what work is being done to identify additional sites for social housing and what action is being taken to address the shortage of homes available in East Belfast. And here tonight, I reiterate again, East Belfast has a housing crisis. Therefore, I implore the Minister to move forward quickly with the sites already identified for social housing. I ask her to assess whether current housing stock on land maximises the potential of that land, and to ensure that the type of accommodation designed for each potential site is suitable and truly reflects the demand, and request that she takes on board the points we all raise here this evening for the good of our constituents in East Belfast. Thank you, Mr. Speaker.
Thank you, and I'll call Andy Allen and just advise members that they will have up to 8 minutes.
Thank you, Mr. Speaker, and can I start by thanking the member for bringing forward this important adjournment debate tonight. It is a very important point, and can I also apologise to the member for not being present in the House at the outset of her remarks. She raises a broad range of important points, none of which I disagree with, and I will touch, no doubt, on many of those as I lay out some of my remarks. Across Northern Ireland, there are some 45,000 individuals and families on our housing waiting list. Behind that are individuals and families living in housing stress, living in conditions that are unacceptable, conditions that none of us would accept ourselves. Tonight, I'll be going home to my house, to my family, whilst I know in the knowledge that there are many constituents who do not have that opportunity, many constituents who are having to rely on the goodwill of their family and their friends, often relationships being pushed to the test in terms of providing accommodation for them. In East Belfast, as the member mentioned, there are some 2,500 individuals and families on the waiting list, and the Minister herself has acknowledged that Northern Ireland is in the midst of a housing crisis. There's no denying that. We all acknowledge that. But what our constituents want to hear, and they need to know, what are we going to do to address that? What are we going to do to help them into social and affordable housing? Housing where they can live with their families, they can have homes where they grew up in the communities. As the member pointed out, East Belfast is a superb place to live. I'm from East Belfast, I am East Belfast. I'm proud to tell people when I've gone the world over, I've told them that I'm a proud East Belfast man. I'm proud of the community that I come from. I'm proud of East Belfast. I do not believe it's acceptable that we have constituents that are being forced to move out of the area in which they've grown up, the area they know, where they've been all their lives. But that is as a result of our lack of building homes. I think 15, 20 years ago, a number of the housing charities were calling on us, this government, to build in excess of the number of social homes that we're building now. At the current rate of house building at this moment, I would estimate it would probably take something like 20 years, and I would pose that question to the Minister for her assessment or the assessment of her department, how long that it actually will take to address the housing crisis that Northern Ireland faces. But I would also highlight some 45,000 people on our housing waiting list. Is that the true reflection of the housing need? Well, I would argue it's not, and I'll tell you why I would argue it's not. I recently tabled a question to the Minister which revealed that there were some 28,000 people in the last 5 years taken off our housing waiting list due to no reply to a renewal reminder. Over that same period, only some 7,000 people reapplied. Where did those other 21,000 individuals and families go? Did they simply give up on a housing system that wasn't delivering for them? Well, I'm sure we could all relate to constituents who've been in our office that we could say they've given up, or they've gone to the private rented sector where rents are unavoidable. And we often talk in this House about the cost of living. And the cost of living is a brutal reality for many people. The cost of heating, energy. But when they're being faced to pay rents that are in excess of £600-700, and they're having to top their social security, or top their housing benefit or their universal credit housing costs up with their social security, it's unaffordable. People are being forced to choose between heating and eating. Is that acceptable? It really isn't. I don't believe it is. There's also the piece of work that seems to be in the system for an age, and that is the Public Land Registry. I've asked the Minister's colleague, the Minister for Finance, for updates repeatedly on that, and I know it's an intense piece of work, but there are various pieces of public land. I've tabled questions to all of the ministers across the departments, and that's revealed that there are countless pieces of land across Northern Ireland that could be leveraged, that could be used to build and support social housing. But there are other problems. There are problems with sewage and water infrastructure. We need to address those problems to be able to build and increase upon the capacity. There are also problems within our planning system whereby housing is not, planning applications are not going through the system anywhere near quickly enough. It's important that applications go through that due diligence process and individuals have an opportunity to feed into that. It's absolutely important, but it's also vitally important that there are any undue delays are weeded out of the system. East Belfast, yes, it's absolutely a thriving community, but communities are being broken apart by individuals being forced to move out of the area. In terms of some of the other questions I would like to pose to the Minister, can the Minister provide any further updates on her housing transformation? There were ambitious plans highlighted in her predecessor's remarks in relation to this, in relation to the transformation of the housing executive. But again, what are the unintended consequences of that? Are we creating a super housing association by virtue of separating the housing executive's two components? Are we going to create a super housing association that will be competing with the existing housing associations, and will that drive up land? There are also issues in relation to the cost of materials, and the Minister has rightly put further injection of finance into addressing that. But is that going to have any knock-on impact in terms of our house building? Also, rightly, the housing selection scheme. The Minister, in the question to the member earlier on today, had highlighted it's going to take some 3 years for the full 18 recommendations to be fully implemented. But the true reality of it is we can tinker around the edges, and there are important changes. I'm not knocking that. But the reality of it is many of my constituents have highlighted to me that points are prizes. Points are prizes. And what they mean by that is 1 point can make the difference between them getting an offer of a home or not. We really need to address this. I'm committed. I'm up to the challenge. I'll work with the Minister and other members across East Belfast to do what we can. I think we're united and we're joint in this approach. Northern Ireland is in the midst of a housing crisis, and we all need to step up to the mark to address that. Thank you, Mr. Speaker.
Thank you, Member, for that. And call Robin Newton.
Thank you, Mr. Speaker. And can I also thank the member for securing the debate on what is a very important issue. And can I pay tribute to the Housing Executive staff, both in the Dundonald office and indeed in the Central Belfast office, who I think do a sterling job and very often, Minister, go beyond the requirements of what they are supposed to do in their job. They are a dedicated team. I wanted to start with, I just posed the question to the Minister some time ago about the number of social housing development programmes in Belfast. And the Minister responded by telling me that the current social housing development programme has a gross figure of 2,215 units to be built in the year 2021-22, and indeed that there were 4,000...
Could the member move closer to the microphone there, please? It's hard to pick up your voice for Hansard.
Thank you, Mr. Speaker. I'm sorry, Mr. Speaker, about that. The Minister said that there were 2,201 proposed new social development units for 2021-22, and that there were 4,291 social units currently under construction. And I then asked the Minister for a breakdown, and I got the figures sent to me, indicating the breakdown between North Belfast, West Belfast, South Belfast and East Belfast. And indeed, when I analyse the figures, I get the situation that in taking the under construction and the proposed construction, the figures come to that indeed the allocation for East Belfast is 12%. South Belfast is 15%. North Belfast is 31%. And West Belfast, 55%. Now, we all know the importance of good housing. And I want to quote from the Shelter organisation, who say that a safe, secure and affordable home is fundamental to a child's well-being and life chances. The foundations and stability provided by a decent home, whether it's a council house, privately rented or owned house, are essential to our children's upbringing. In what they say about the family, families can wait months or even years for better quality, affordable housing. Housing costs are daily, and Mr. Allen made the point, housing costs are daily, weekly, monthly pressure for some families. But there is no choice but to sacrifice essentials to protect their children from homelessness. Families are left staying in what can only be described as poor quality, cramped and inadequate temporary accommodation until they find an assigned place to live. And for parents, there can be a great stigma attached to becoming homeless. Homeless parents are likely to be struggling financially and therefore find it difficult to afford rent, heating, food, clothes, school uniforms or trips. And parents too often must settle. And I think everyone who's a public representative in East Belfast will notice, will have witnessed, will have evidence of, that parents settle for substandard accommodation as they have few other alternative options and feel they must plump at an opportunity before it disappears. And the impact that it has on the children's life and the children's education, it can blight their entire childhood, making it under pressure with no affordable housing. Children living in temporary accommodation who are considered as homeless can miss many days of school year, causing them to more likely to struggle with their education and academic achievements. Further, children may have to move schools, leave behind support networks, pets, friends, close family for rehousing. And East Belfast is a close-knit community. And they do seek the family support that has already been referred to. Further, the removal of a child from educational setting to then place them in another can prohibit their ability to achieve. And the impact that it also has, inadequate housing has on communities. And the importance of good housing, say shelter. The importance of good housing to a community is instrumental in terms of an economic, social and opportunistic drive. Good housing can attract individuals in jobs, roles considered to be key, for example, teachers, nurses, police, firefighters, and so on. And key service providers would be attracted to areas rife with good housing, including affordable housing. And that attraction would be a great economic and opportunistic drive for communities. It's already been referred to that we're looking at a situation, a unique situation, as we demolish both the Kilbrony House and the Clarewood Flats, as confirmed by the Minister. And the demolishing of these East Belfast flats adds to the growing need for housing in the east of the city. And the demolition of the 2 tower blocks was approved. But residents, and I do pay tribute, I have to pay tribute to the Northern Ireland Housing Executive in this, in terms that they have realised the need. Now, they might have needed a bit of prompting, but it wasn't much prompting to set up good communication systems. But even at that, the demolition of the tower blocks raises concerns. For those who own their own flats, it raises concerns about compensation. And for those who want to remain in the area, they have no knowledge at this stage of when the area or where the footprint of the demolished flats will be redeveloped. And I think that, at least the last figures I have, Minister, indicated, I know it is an ever-changing situation, but there were about 100 people living in those flats who will be decanted to 100 houses, 100 dwellings that are not available. In Belfast alone, In Belfast alone, there are a total of 10,800 applicants in severe need of housing, 10,800. During the same period, it was found the applicants in housing stress risen from 7,000 in 2016 to 8,143 in 2020. And indeed, Mr. Speaker, the need for social housing is imperative and can only be achieved when the budgets are there. And the total budget spend of social housing in East Belfast in the last 5 years stands at 31 million. Yet in the past 2 years, the level of funding has only reached 9 million. The total spend on housing is in East Belfast.
Member has 15 seconds.
Thank you, Mr. Speaker.
Thank you, and I call Chris Little.
Thank you, Mr. Speaker. I welcome the opportunity to speak on the need for improved social and affordable housing provision in my constituency of East Belfast, and thank the member for securing the debate today. When we consider the extent of the housing crisis in Northern Ireland, the waiting lists, the financial crisis in education, it's hard to believe that anyone would ever think it's acceptable for this House and our executive not to be in place working together on these issues. Housing is a human right. It affords people human dignity. It's essential for an adequate standard of living and for community cohesion. A Northern Ireland and an East Belfast in which everyone has adequate housing must be a key outcome achieved by this Assembly. Ensuring everyone in Northern Ireland has access to a good quality home is an Alliance Party priority. A safe, high-quality home is essential to health, life opportunities and security. The Alliance Party Green New Deal calls for an ambitious plan for social and affordable housing, including retrofitting social housing with renewable energy sources and insulation, prioritising energy-efficient measures which will provide low-cost and free insulation and home heating, ensuring housing standards provide for sustainable and well-built homes, development of a land register to ensure sites suitable for housing are identified, and the development of an empty home strategy to bring derelict and unused properties back into stock. Alliance also supports the New Decade New Approach proposal to include housing as a specific programme for government priority. Measures to address housing stress that exist for many people in our community must also be included, specifically investment and targets for new social and affordable homes and reduction of the maintenance backlog for housing executive properties. We also support the proposed legislation to reclassify housing associations to enable them to build new social and affordable homes in East Belfast. Mr. Speaker, as an Alliance MLA for East Belfast since 2010, housing has been the single biggest issue on which my constituency team and I work for constituents. I've seen a number of positive examples of social and affordable housing development, including shared neighbourhood programmes and the inclusion of social and affordable housing in the planned flagship Sirocco work development in our constituency. However, like the other members have referenced in this debate today, I have also experienced much and many inadequate housing conditions, unacceptable waiting lists and housing maintenance stress across the constituency. One of the worst examples of which that comes to mind, including the ceiling collapse in one home of a lone woman pensioner, a completely unacceptable situation for anyone to find their home in. Examples of unacceptable damp conditions and other living conditions that we have to improve in our community. I welcome the attendance of the Minister at the debate today, and as other members have sought, would seek updates in relation to the particular need in Kings Road flats at Tullycarnet and the relocation of tenants from Kilbrony and Clarawood House. Also, the Housing Executive External Wall Insulation Programme scheduled for residents in Wandsworth. Happy to give way. Yep.
Thank the member for giving way, and it was remiss of me actually not to mention two other areas, and perhaps the Minister could address these issues in her replies. And that is also that the Clarewood Masonettes, which I understand are under an economic appraisal at this moment in time, and my information is that it is likely to lead to demolition. And also, the Minister will not be surprised when I raise this one, the Knocknagoney Avenue flats and Masonettes, which indeed I understand the Minister has been in receipt of a proposal from NIHE for 12 months now, and we need a decision. In both cases, there are inadequate housing, and both cases provide sites for redevelopment, the provision for other social housing.
Member has an extra minute.
Thank you, and I thank the member for the intervention. I think it is important, and hopefully we can get update from the Minister in relation to some of those specific schemes. As other members have referenced, Mr. Speaker, we have in excess of 2,500 people waiting for accommodation in East Belfast, over 1,000 of which are in housing stress. That will take a comprehensive social housing development programme, including for East Belfast, and hopefully the Minister can tell us more about that programme today. Mr. Speaker, I have also helped with the outcomes of heinous sectarian and racist intimidation in our social housing stock, and that will need the active promotion and delivery of shared and mixed housing to build a more united community. Mr. Speaker, as other members have mentioned, East Belfast is a fantastic place in which to make your home. There is an urgent need for us all to work together, however, in order to deliver the social and affordable homes needed. Eastside Learning Partnership is a great model of cooperation that I think we as MLAs in East Belfast could look to help us to take collective action in response to the housing challenge in East Belfast, and perhaps consider the formation of an Eastside Housing Partnership to ensure that we work together to deliver the quality, social and affordable housing the people of East Belfast need and deserve. Thank you.
Thank you, and I call Matthew O'Toole.
Thank you, Mr. Speaker, and I thank the member who brought this debate. Obviously, I am not an East Belfast MLA, but I am a Belfast MLA. Represent the neighbouring constituency, and many of the issues we're discussing today are as relevant to South Belfast as they are to East Belfast, but there are particular issues in East Belfast, and someone who lives very close to the South and East Belfast border and cares a great deal about how we improve our deal with the social housing crisis that we do face across Belfast. I'm glad this debate has been brought. Indeed, the Kilbrony House, which is being demolished, as has been discussed at Craigie there, is just in fact across the road from South Belfast. It's on the border of the two constituencies, and there is a real social housing problem in the east of the city, as there is in the rest of the city. At times, I think we're sometimes want to play to kind of league table these things. I think the truth is that we have acute need across the city. There are issues in East Belfast that we need to pay particular attention to. Joanne Bunting rightly raised the particular issue in East Belfast, and I discussed this with council colleagues who sit in the east of the city. There's a real issue around disabled access and access to properties that are adapted for people with disability needs. But before I go on to talk about some of the more East Belfast and Belfast-specific issues, it's worth just reflecting on where we are in general, both in this city and across this entire region. We do face a social housing crisis. There was a New Decade, New Approach commitment to prioritise this as an issue. There has been a commitment from the Minister's both successor and predecessor to have a transformational plan on this. Welcome that intention, but it would be good to hear more about how that is progressing, and indeed how the Minister envisages the new programme for government, which we assume will be signed off next year if we're all spared by the electors and we have a stable functioning institutions next year, how we're going to embed that, mainstream that and deliver it for people in East Belfast and across Northern Ireland. So in terms of the challenges in East Belfast, there is, first of all, a particular challenge around rising house prices. As was stated by the member who introduced the debate, it is a popular part of the city to live. Like South Belfast, the constituency I represent, it has many thriving neighbourhoods, but that also means the issue of gentrification, as it's sometimes called, which is a two-edged sword. It can mean investment in an area, it can mean opportunity for people, but it does also have occasionally it does create very acute challenges for established working class communities in terms of the value of property, not just property to buy, but the private rented sector. And that is a real challenge. It's a challenge in communities in East Belfast, and it's a challenge in communities in South Belfast, and indeed in the north and west of the city. But there are particular issues that have been discussed. So we do need to see greater investment in delivering that housing stock in East Belfast, as has been talked about. Particular areas, the Kings Road Flats have been talked about, and other places. It's also worth saying that I will give way, yeah, of course.
Would the member recognise that there is a part of what the housing executive regard as South Belfast, as East Belfast, but in effect, in parliamentary terms, is indeed South Belfast? And that's the area around London Road, Ravenhill Road, My Lady's Road, where the housing is not of a good quality, and much of which is in private landlord rented out quality. Would the member agree with me that it's within his constituency, but it impacts upon the East Belfast, and there is merit, as has been suggested, that there would be a merit in an East Belfast and in that part of the city of South Belfast working group to address this issue?
Well, I completely agree with that point. There is an issue. There is an overlap, as he says, and for statistical purposes, South and East Belfast are gathered together very often by the housing executive in terms of how they do these things. That area of the Lower Ravenhill Road he talks about, there is an issue there around housing that it's dominated, or there's a greater proportion of private rented accommodation, and there are those long-standing issues we know with the quality of the private rented sector. Indeed, we were talking about some of them earlier on today at communities' questions. So I'm glad this debate has been brought to the House. There are particular issues for people in the east of the city. The east of the city is a great place to live. What it would be good to hear from the Minister is how that overall transformational plan is going. It is worth acknowledging there are particularly acute challenges. I don't want to get into the debate about need in relative areas of the place and get into the league table, but it's worth acknowledging for the record there are, of course, very substantial challenges, especially in the north of the city, in terms of the sheer volume of need. But that is in no way to deny that there is very significant need and challenges in the east of the city too, which we should all be putting our shoulder to the wheel in terms of addressing. I suppose what I'm most interested in hearing today is to understand what the overarching executive approach is, how the Minister is taking forward the transformational plan, and also what she would like to see in terms of a programme for government outcome that helps us get to the heart of the acute challenge we face across. We've got, I think, more than 30,000 people in acute housing stress across the north. It would be good to understand from her perspective how she sees what the kind of outcome she wants to see from the programme for government next year, and that's for all of us to be engaged in delivering to address that, because it is a severe and acute challenge for people in East Belfast, across the city, and indeed across Northern Ireland. So, in concluding, Mr. Speaker, I welcome the fact that this debate has been brought by the member. People in East Belfast, as across the city, are entitled to a real meaningful plan in order to address social housing need. It is a great constituency in a great part of the world, but we do need to see a plan in terms of addressing the acute social need that we face. I also should say there is it would be helpful to understand. I don't know if the Minister has an update with her, but what's happening in terms of Sirocco Works. We know that's a big, major strategic development that right up to the Executive Office have been looking at. I hope we're going to see that project developing with speed, because that will take away, hopefully address a significant part of the need, including in Short Strand. But otherwise, Mr. Speaker, I conclude my remarks there and welcome the fact that we've been able to have this debate tonight.
Thank you, and thank all the members for their contributions. And I now call the Minister for Communities, Deirdre Hargey, and the Minister will have up to 17 minutes, if you so choose to use it.
Thanks very much, and again thanks to Joanne just for bringing the important motion and debate, and also for everybody else who's contributed. And I suppose just to talk about, I mean, East Belfast is a lovely place. I live in the market, so just across the river from the east, and many agencies actually think the market is in East Belfast. And I always say there's the bridge, the river that divides us, but the bridge that brings us together. So it is a lovely place. I was actually out in the last couple of weeks in and around that end of Lower Ravenhill, actually with your party colleague, Christopher Stalford, meeting with local community organisation there and looking at the issue of housing infrastructure. I know the Department of Infrastructure was there for that walkabout as well. And I have said that I'm more than happy to continue that engagement with the community to look at the issues there. And I think it is right, the issues there in that part of East Belfast are the same where I live in the market, they're the same in the north of the city, they're the same in Derry and Foyle and in other parts of the north as well. And I think it is important to point out that I acknowledge that there's a housing crisis. And again, that's just not pertaining to East Belfast, that is across the north. We are in a housing crisis. We have serious difficulties that as an assembly, as an executive, as myself as minister, we need to overcome over the next decade. And obviously to look at short, medium and longer term plans to get there. And part of this has been because of decades of underinvestment. That underinvestment, even before this Assembly was created, on the back of the Good Friday Agreement. And it's just been over that period, the building of this crisis. And we can see that in terms of the recent waiting lists as of March of this year. 44,985 people are on the waiting list. 30,926 of those are in housing stress. So the figures speak for themselves in terms of the predicament that we're in. We also know, and I've brought it to this chamber previously, the crisis that we have in terms of the existing stock of the housing executive. I know it was touched on in terms of insulation and other issues as well. We know the Savage report from 2019 that if we don't fundamentally deal with the investment challenges of the housing executive, the remaining stock that they have of over 96,000 homes, they could lose half of those homes, could be lost out of public housing because they can't afford to maintain them. And I completely understand that's the issues that you're picking up in your constituency offices, and I'm picking up those same issues in my office as well around poor conditions. And that's because the money and the investment is not there to do the fundamental works that we need to be done. So that is part of the challenge. I think in terms of the housing statement that was done last year, the main thrust of that statement was saying that we need to deal with that fundamental challenge of getting the housing executive on a firm financial footing, allowing it to borrow, to invest in those properties, to bring the existing stock up to date so that people are living in homes that are fit for purpose, not just for now, but looking at the challenges around climate change, but also to ensure that we're building new homes as well and that they're able to do that along with other housing associations. My focus for that change agenda is to keep what's good about the housing executive as a public housing body, to try and to ensure that that is public, that sense of being a public body is retained, both for the landlord function and also as a regional housing authority. At the moment where we are, we have set up, as I said in question time, a panel between the housing executive and the department looking at how we do that. So how can we, within the legislation and the confines that we have with Westminster, how can we get the housing executive being able to borrow and still having that public body status? And that's some of the challenges that we're trying to work through at the moment. We're working with experts in terms of the legislation, in terms of the finances around that. We're engaging with Westminster because obviously that's where some of the, I suppose, restrictions around these things come from as well.
Sir, you mentioned about keeping the aspects of the housing executive that are good and they're important, but also retaining that public body element. Has there been any scoping out of the ONS impact, as we'd seen with our housing associations back in 2016, as to whether there be any implications for the housing executive retaining that public body element?
Well, that's part of the stuff that we're looking at the moment, Andy, is to look at, I want to keep it as a public body, but have the ability to borrow. And obviously there's a difficulty there at the moment. and we need to allow them to have the ability to borrow in order to invest in the stock, or we're not going to have half the stock, and that's just the reality. And that's not to scare people, but that's the assessment of Savills. We're obviously updating that assessment, and I don't think the situation is going to get better. It's probably going to present a worse picture rather than an improved one. So we need to fundamentally deal with this issue. The programme board is set up. There's a commitment from me that I will present this a way forward to the executive before the end of this mandate, and work is underway. I can't give all of the details now because they're still looking at all of those types of issues. Part of that is obviously looking at the rent and in terms of the trajectory of rent, but it's also looking at an analysis of making sure that it's affordable and that people don't fall into debt and a crisis around affordability as well. So there are some of the analyses that are being carried out at the moment in terms of those issues. We're obviously also looking at the housing supply strategy. Yeah.
Thank the Minister for giving way. And the Minister has made the point about debt and affordability and so on. I feel certain the Minister knows this already, but I think it is worth reiterating. East Belfast has 2 neighbourhood renewal areas. Those include Short Strand, Lower Newtonards Road, Albert Bridge, Beersbridge Road, the Mount Woodstock Road and the Lower Ravenhill. And then it has at the other end of the constituency the Tullycarnet area, where in terms of debt and affordability, housing benefit claimants is on the Northern Ireland average 11%. In those areas, it's 20%.
No, there's a huge issue, and when you look at it even within the private rented sector as well, because not all of those tenants are in social housing, so even the statistics, just going back to your point as well, Andy, in terms of the waiting list, that's not reflective of the real need and issues out there. We know that as well, and we're trying to look at how we can ensure that the waiting list actually reflects the real need. We know that there's particular problems in that in rural areas as well, and we're obviously working with Rural Communities Network and others around the latent demand tests, for example. Are there other ways that we can actually look at that need, encouraging people who do need a home to make sure that they're registered, that they stay on the register as well. So totally recognising all of those issues and trying to look at solutions to bring them forward. And I suppose I am committed from the outset of building more social housing. And indeed, social housing is to the core of my programme and what I'm doing in the time ahead. Last year, there were 2,403 social housing units that were started. This was the highest figure in 10 years. During the same period, there were 1,318 social homes that were completed, exceeding the target of 1,200. And in each one of those houses, I suppose, is a person and a family that we know that fundamentally need a home. In the last 5 years, there's been 393 new social starts commenced within the East Belfast parliamentary constituency, and 421 social housing units have been completed. There are currently 79 social housing units under construction, and within the current 3-year housing development programme, taking us up to 2024, there's a further 381 planned housing units within that constituency. And obviously the bidding for the programme is done on a 3-year cycle as well. I completely recognise that on average around 1,900 homes as part of the social housing development programme is not enough. We need to be more ambitious. We need to be increasing the amount of homes to do that. We need to see the increased capital investment around that. But I also know that we need to have the ability to build the homes. So it's okay saying we'll have the money in place. Is the infrastructure in place? Do we have the builders in order to take forward a programme of that scale? I think the other area that we need to look at as well is obviously the right to buy. I know it was touched on there. When you look at the Housing Executive a few decades ago, there was over 240,000 homes that they had in their stock. We now have less than 100,000. So that in itself tells you why there's a housing crisis as well. In terms of the loss of that stock, those houses aren't being turned over again back into more homes. For every 1,900 that we're on average taking forward a year, we're losing almost 500 through that scheme. I know that that is a popular scheme, but again, we do need to look at it in terms of the options. I do have a consultation proposed, but again, that hasn't been approved at the Executive in terms of just even consulting to look at what the options could be going forward on that. Yeah.
I understand the point that the Minister makes in relation to the right to buy scheme, but would the Minister also accept that many of those individuals who do go on to avail of the right to buy scheme have no intention of moving from that, what is often the family home? And on a second point, could the Minister give an overview as to, and the member who proposed the motion raised this in terms of the skewed assessment of housing need in areas? Can she give an overview as to the current process to determine housing need and whether there will be any review of that? Because there is a particular problem there.
Well, I think in terms of the right to buy, I mean, there are many people who are still living within those homes. There are many properties that are sold off and actually end up in the private rented sector as well. And obviously there are still housing people also. And we know that there's now more families with children in the private rented sector than the social sector. So we need to look at housing in a holistic sense, and that's obviously what we're trying to do around the housing supply strategy, around the legislation around the private rented sector in this term, and then obviously legislation going into the next term as well. So we need to look at all of those issues. In terms of the housing piece and the need, I mean, obviously the point system is one part of that. We're trying to ensure that people on the list are being retained on the list, that we're identifying that need as well. And also, I want to look at the issue around ring fencing and reintroducing that again into the housing development programme. But we need to look in the context of how we replenish the stock that's being lost from the social housing provision, because that's not being recirculated back into those who need it on the housing waiting list. We also need to offer options for those in terms of co-ownership and those around who want to rent properties as well, and to look at an intermediate rent. And obviously we're bringing forward proposals to look at those things also. Again as well, obviously I've already told this House that I believe the targets for social housing are too low, and unless we do something radical about the targets, then we're not going to, the situation around the waiting list is actually going to get worse rather than better. I suppose the continuation of building good quality homes and creating stock for individuals and families is a priority as well. And to that end, I did increase the budget this year. The Executive agreed to an additional £26 million being invested. Obviously, we need to grow that further. I would further call on Executive parties to support my call and that of the housing sector to have a dedicated outcome for housing within the programme for government, because I think that puts a real focus on housing, to say that it is a fundamental right, but also recognising that it's not just for the Department for Communities, it's across government, around land assembly, around planning, around infrastructure, that a home is then built, and that's what we need to look at in the time ahead. And obviously I'm working with housing associations and have been encouraging them to identify land that is available for housing. I'm also conducting on behalf of the Executive an exercise to identify surplus land that could potentially be used for housing developments as well, and I think local councils will play a critical role in this, particularly around the local development plans. So on the one hand, in terms of private development, I would be encouraging and saying that they should be allocating a percentage in terms of social and affordable housing, and that should be fit for purpose. Also in terms of identifying public land that they own. I know there is a difficulty, I can't remember who mentioned it, in terms of a cataloguing of all public land. There is a difficulty that not everybody keeps records. They're all in paper copies and they will have to be transferred, and that will take a bit of time, and that has slowed up some of that work. But we are trying to identify public land for public housing, and that's something that I'm working with the Executive on in the time ahead as well. I know there were some other issues, I know there's some that will come back as well, but in terms of the demolition of the Housing Executive, in terms of the tower blocks, it's obviously not just an issue for East Belfast, and even perhaps an opportunity. I suppose where there is housing need and where these blocks need to be demolished, they are going to be replaced by modern, energy efficient and warm homes. And obviously my department has already approved the demolition of Clara Wood House and Kilbrony House. Once this is cleared, it will create the opportunity for these sites to be redeveloped in a manner that suits the needs on the ground at that time. I do fully appreciate, obviously, that there are those who have lived and they've been born and bred in and around those blocks and within that community as well. And obviously the Housing Executive have assured me that they will deal sensitively and sympathetically with tenants to do what they can to ensure that. And I completely understand the issues that have been raised. I mean, I live in the Market, an inner city working class area, just like many communities in East Belfast, that feel the pressure of development, that feel the pressure of not enough availability of land. I have come from a family of 7 siblings, and 3 of my siblings had to leave that area and go to the north of the city for private rented and to purchase a home because they couldn't get one in the community in which we live. So I'm acutely aware of that, and obviously it's not just about building houses. We want to build communities and ensuring that they're sustainable, that they're thriving, that there's cohesion within the community as well,
a minute left.
That can overcome all of the issues around challenging sectarianism and racism where it raises its head. I think so in terms of the issues, I completely understand that. I touched on the housing allocations earlier in terms of we have established the project team. We're implementing a number of the proposals which will be underway by March of next year, and obviously we're continuing to do the rest of the work. I am in consultation and engagement with the Infrastructure Minister around how we can bring forward schemes and align what infrastructure is doing with what our housing programme is in the time ahead as well. As I touched on, we're doing the housing supply strategy. I'm hopeful that that will go out to consultation at the end of this year, and that's a strategy that will take us up to 2037. It will have 3-year action plans in terms of what it is we're going to deliver over that period, and that will give more definitive information, Andy, in terms of how many homes we think we're going to build over that period. So I don't want to say anything yet until the strategy is going to be produced, but I'll definitely come back to you again as well. In terms of the private rent,
time's up.
It's up? Okay.
You can continue this conversation. You're free to continue this conversation on the rest of the evening if you wish. Members, the Assembly is adjourned.
This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary